Good morning. The Committee of Health, Hospital, and Human Services is called to order. Today's date is February the 9th, 2022. Good morning to my fellow committee members, the Virgin Islands community, and all the listening and viewing today. The Health, Hospital, and Human Services Committee is convened to receive updates from the Department of Health on behavioral health and its use of the American Rescue Plan funds, and from the Department of Human Services on programs under its purview. The committee will also do a deep dive into homelessness, which is a public health crisis that appears to be at an unprecedented level in the territory. While the face of homelessness often looks like people struggling with behavioral health issues, that is only one piece of a very complex issue. Solutions to the homelessness will take more than giving people a place to rest their head. However, it is clear that the territory is not moving with an urgency needed to serve our most vulnerable population. American Paradise really isn't a paradise if you're sleeping on the streets or in your car, with very limited options for emergency shelter. Today, we'll hear from the Department of Human Services, the Virgin Islands Housing Finance Authority, and our community organizers on this pressing issue. Before we proceed, and in recognition of Black History Month, I'd like to recognize Virgin Islanders who helped to advance healthcare in the territory. I'd like to start off with Dr. Melvin Evans, Dr. David C. Canigata, Dr. Roy L. Snyder, Dr. Randall Doc James, Dr. Donna M. Christensen, Dr. Alfred O. Heath. These are just a few of the Virgin Islanders who have provided and supported the health care in the Virgin Islands, and it is only fitting that their work and accomplishment be recognized. At this time, again, I want to welcome all my colleagues and say good morning to the people of the Virgin Islands. And today we're anticipating a very robust discussion with our healthcare providers and, again, our community activists that continue to assist and support this government of the Virgin Islands in their endeavors. I want to remind all those in the audience, my colleagues and otherwise, to please turn your phone and mute or turn them off at this time as to not interrupt today's proceedings. Madam Clerk, please do the roll call.
Senator Marvin A. Blyden. Senator Blyden, present. Senator Samuel Carrion. Senator Samuel Carrion, absent. Senator Kenneth L. Gittins.
Here.
Senator Kenneth L. Gittins, present. Senator Alma Francis Heiliger. Present. Senator Alma Francis Heiliger, present. Senator Janelle K. Soro. Present. Senator Janelle K. Soro, present. Senator Kurt A. Vialet. Senator Kurt A. Vialet, absent. Senator Novell E. Francis Jr.
I'm here.
Senator Novell E. Francis Jr., present. Mr. Chair, we have 5 members present, 2 absent.
Thank you very much, Madam Clerk. Please record Senator Samuel Carrion. He's making his way in as excused until he gets here, as well as Senator Vialet is in fact already present and he's here. And please proceed. Is there any correspondence to be read into the records?
No, Mr. Chairman.
Please proceed with today's agenda, reading today's agenda into the record.
Agenda. Committee on Health, Hospitals, and Human Services hearing, Wednesday, February 9th, 2022. The Committee on Health, Hospitals, and Human Services has scheduled a hearing on Wednesday, February 9th, 2022, 10 a.m. in the Earl B. Attlee Legislative Hall to receive an update from the VI Department on Health on behavioral health in the Virgin Islands and an overview of the use of the American Rescue Plan Act, ARPA funds earmarked for public health. The committee will also receive an overview of the VI Department of Human Services to include programs and senior homes. Finally, the committee will discuss homelessness in the territory and possible solutions to alleviate this public health crisis. Block 1, update on behavioral health in the Virgin Islands, overview of the use of the American Rescue Plan Act, ARPA funds earmarked for public health. Invited testifier, the Honorable Justa E. Encarnacion, Commissioner, VI Department of Health. Block 2, overview of the VI Department of Human Services. Invited testifier, the Honorable Kimberly Kazi Gomez, Commissioner, VI Department of Human Services. Block 3, homelessness in the territory and possible solutions to alleviate this public health crisis. Invited testifiers, the Honorable Kimberly Kazi Gomez, Commissioner, VI Department of Human Services. Dana Clendenin, Chief Disaster Recovery Officer, VI Housing Finance Authority. Malik Stradiran, Executive Director, 10,000 Helpers of St. Croix, Inc. Maria Ferreras, Private Citizen.
That concludes the reading.
Yes, Mr. Chair.
Thank you very much, Madam Clerk. I'd also like to recognize the presence of our Senate Presidents, Senator Donna Fred Gregory. Good morning, Senator. Welcome. Good morning. And also, you could go ahead and mark Senator Carrion as being present. He's here as well. So before we go to Block 1, I just wanted to share with the members of this committee as well as the public a letter that all of us receive as senators from Ms. Josette F. Williams. And again, I just want to share this because I think it's important that the public understands, some of the concerns that have been raised in our community in respect to behavioral health as well as the homelessness. I continue to say that, yes, we're in a state of emergency, but the level of state of urgency, we certainly don't feel or see it. And I'm hoping that, today we could have that frank discussion and really have a discussion about, how do we drive towards resolution and solution to these matters. So Ms. Josette Williams, and she said, good day. My name is Josette F. Williams. I've been taken on the task of championing the cause for the mentally ill and homeless who resides on the streets of our territories. I have a few questions I would like to, and I'll appreciate getting some answers to that is relevant to this cause. Do the legislative body have the power to amend or change local laws? Do the legislative body have the power to amend or change local laws? 1A. If not, can a bill or resolution be drafted up for the approval from the governor? 2, what can you do in your position as senator to change the way of life for the homeless and mentally ill who are hiding in plain view on our streets? What can you do in your position of senator to change the way of life for the homeless and mentally ill who are hiding in plain view on our streets? 2B, is one of the reasons for the neglect because they do not or cannot vote? I've been informed that there are nonprofit organizations that do what they can within the rights of the mentally ill. But how can legislation help their seemingly fruitless labor of love? 4, how can we, the common residents, assist you in your position as a senator to help this invisible population? Though I know that you are busy with the people's business, I'd like to receive a response from you in a timely manner. I'm thinking within a week from today's date. I intend to share your response with the public and also get and share information to help family members who are affected by but do not know where or who to turn to for legal assistance. Seriously involved and is signed by Josette F. Williams. This is sobering for me. because again, this is an issue that I continue to and some of most of my colleagues as well have been at this for quite some time and really trying to bring some resolve to this particular situation. So again, I read that for the purpose of understanding the level of urgency that's needed here, and how do we collectively work towards moving the needle as we continue to talk about behavioral health, mental health, and certainly homelessness. So real quickly, I'll go to block one. And again, to get an update on behavioral health in the Virgin Islands, an overview of the use of the American Rescue Plan Act funds earmarked for public health. Because one thing for sure, we have a lot of money. The governor keeps saying it. We have a lot of money. And again, we want to make sure that that money is put towards where it's most needed and how vulnerable, I believe, is one of those areas. Good morning, Commissioner Justa y Encarnacion. You're on mute. Just checking your devices. Morning,
I took myself off of mute. You can't hear me?
I can now, yes. Good morning.
Okay, good. Good morning.
Good morning.
Increase my volume. I'm ready.
Okay, very well.
Okay.
You have anyone else assisting you on your side of the house today with your presentation?
Always. Of course, I have Deputy Commissioner Renan Steele, who will be assisting in the conversation for behavioral health. And of course, I have with me the team members who are operating some of the grants, the ARPA grants. So I have Dr. Brett Ellis, our Director of Laboratory, Dr. Charmaine Myers, Director of Maternal Child Health and Children with Special Needs, Director Eleanor Charles, who is our Director of Federal Grants, Dr. Janice Valmond, who is overseeing some of those grants, for as well as one for me, and Director Jason Henry, who is the Director of Communicable Disease, DC Jean-Jacques Baptiste, our Deputy Commissioner over Human Resources, Munife Stout, Director Stout is our Director of Immunizations, Director Ovid Williams, who is running our Preparedness Division, and of course, the Deputy Commissioner DC Malloy, who assists with our operational and our special request needs. And I do not see Dr. Esther Ellis. Oh, here she is. My apologies, Dr. Ellis, Dr. Esther Ellis, Territorial Epidemiologist. And I have others stand by if you need them, sir.
Very well. Thank you very much. We do have a very full complement of individuals, so we should leave no stones unturned, no questions unanswered today. We certainly have a full complement from the Department of Health. At this time, Commissioner, you may proceed. And good morning to your supporting staff. And I want to continue to commend the work that they have been doing with the COVID response. And I'm just hoping for the same level of energy as we are having the discussion in respect to behavioral health, mental health, and homelessness. Commissioner, you could go ahead and present your testimony at this time.
Thank you, sir. Good day, Honorable Senator Noble E. Francis, Jr., Chairman of the Committee on Health, Hospital, and Human Services, Honorable Senator Marvin Blyden, Vice Chair, committee members, and other members of the 34th Legislature of the Virgin Islands of the United States, and of course, the viewing and listening audience, non-committee members, and the viewing and listening audience, my apologies. I am Justa Ortita Encarnacion, the Commissioner of the Virgin Islands Department of Health. Thank you for the opportunity to be here today. Joining me are Dr. Janice Valmont, Deputy Commissioner of Health, Promotion and Disease Prevention, Ruben Malloy, Deputy Commissioner of Operations and Special Projects, Renan Steele, Deputy Commissioner of Behavioral Health and Alcohol and Drug Dependency and Communicable Disease, Eleanor Johannes, Director of Federal Grants, Dr. Esther Ellis, Territorial Epidemiologist, Dr. Brett Ellis, Director of Public Health Laboratories, Jason Henry, Director of Communicable Diseases, Dr. Charmaine Myers, Director of Maternal and Child Health and Children with Special Needs Program, and Director Munife Stout of Immunization. Update on behavioral health. The Division of Behavioral Health, Alcohol and Drug Dependency Services, or BHADS, continues to provide behavioral health services throughout the territory, operating from 6 locations. the Barbell Plaza Outpatient Clinic, and the Elder Shelterman Residential Facility on St. Thomas, the Charles Harwood Complex Outpatient Clinic, and the Clubhouse and the Methadone Clinic located in the Charles Harwood Complex on St. Croix, and the Morris de Castro Outpatient Clinic on St. John. In the outpatient clinics, we currently serve 452 individuals, 29 in Elder Shelterman, and 20 members in our clubhouse. In addition, the division is monitoring the treatment of 39 patients at off-island residential facilities, and of those patients, 21 are forensic patients. This includes 22 off-island patients who demonstrate a need for residential treatment and are thereby court-ordered into treatment, otherwise known as 723, or involuntary commitment status. Inmates of the Bureau of Correction who are found to need residential treatment, and clients of the Department of Human Services who are turned over to the Department of Health for case management, psychiatric care, and guardianship upon aging out, turning 18 years of age. 4 patients are also receiving collaborative care within residential facilities here in the territory. The Behavioral Health and Alcohol and Drug Dependency Division also provides case management and oversight for 246 patients locally. In addition, the division continues to respond with guidance and crisis intervention to general community mental health related issues, including evaluation and placements of homeless individuals and community crisis counseling support through the Community Resiliency Project, or CPP. The CPP program to date has had 29,111 contacts with residents in the territory, of which 595 persons receive individual counseling, 9,015 receive group counseling or public education, and 19,500 of those contacts receive brief educational and supportive care. Fortunately, due to the dedication and commitment of our staff, as well as non-conventional solutions, we have been able to continue to meet the needs of the patients. There still is a need to onboard additional staff to not only meet the current demands, but also to the projected increased need for a range of behavioral health services resulting from the pandemic. BHATS has been able to accomplish several objectives, of which we are very proud of over the last year. Key accomplishments of the divisions include expansion of behavioral health services, telehealth behavioral services for our patients, receipt of a grant award extension for the crisis counseling program provided by FEMA and SAMHSA, which allows the ongoing services provided through the Community Resiliency Project in the territory with 2 local contracted providers, Island Therapy Solutions and Insight Psychological Services. It is a crisis counseling program available to all individuals in the territory, helping our community understand the current situation regarding the pandemic and reactions, reducing stress, and providing emotional support, promoting the use of development of coping strategies, and connecting individuals with other people and agencies who can help them or provide support. Onboarding 3 additional staff at the clubhouse, 6 at Charles Howard Outpatient Clinic for expansion of services. Note, there are also 2 vacancies for outreach workers in the St. Thomas, St. John, and Water Island District. BHATS celebrated the kickoff of the 3 mobile outreach vans for the territory, 2 larger ones for St. Thomas, 1 and for St. Croix, and 1 small for St. John. And thanks to the 34th legislature, we received additional funding that will allow for increased staffing and more frequent mobilization of the vans. The behavioral health team facilitated the training of 19 staff members within the Department of Health and VI Police Department, given by the Crisis Prevention Institute, or CPI. It is a non-violent crisis intervention, and 9 of those staff became nationally recognized CPI certified instructors. So it was a train the trainer program as well. The next step is the coordination of island-wide CPI training agencies like VIPD and the Department of Human Services. BHATS was heavily involved in the collaboration with the former Senator Jackson's office and other community stakeholders regarding the establishment and direction of the Office of Gun Violence Prevention. Continued involvement in interagency collaborations with VIPD, Department of Human Services, Office of the Governor, etc., to assist and provide assessment and support to homeless individuals. Interdepartment collaboration continues with the Department of Human Services regarding case management, adult protective and Medicaid services. One of the initiatives or outcome is the potential billing for case management services provided by DOH and DHS. We provided grief counseling and support services to several agencies in response to unfortunate losses of personnel due to the pandemic and COVID-19. As Commissioner of Health, I was invited to become a board member of the High Intensity Drug Trafficking Areas, or HIDTA, and with attendance by DC Steele, the Deputy Commissioner Steele, for awareness at those meetings. Members of BHADS assisted HIDTA and CDC Foundation with the interviewing and hiring of a public health analyst who will work in conjunction with the DEA, VIPD, and the Department of Health Behavioral Health Division regarding the National Overdose Response Strategy Initiative. This grant program is administered by the Office of National Drug Control Policy. Elder Shelterban Residential Rehabilitation of the Annex, the second 32-bed facility project has begun. The A&E phase has started. Project will be out for bid June of 2022. Construction is slated to begin September of 2022, with completion estimated to be February of 2023. This would allow us to bring home our residents for various off-island facilities and open the doors for wraparound services. Regarding the Annis Hope project, the VI Department of Health engaged the Department of Property and Procurement on March 21st, 2020, to solicit architectural and engineering services and scope of work development required for the build-out of the 9.9-acre property. After the required on-site walkthrough, the Department of Public Works official engineer on record deemed that the build-out of a new facility to meet the required healthcare industry standard would exceed the 50% threshold for repairs versus replacement. Due to the Department of Public Works' express lack of expertise with the development of a technical scope of work required for this type of facility, the recommendation was given to engage with an A&E firm that specializes in constructing behavioral health facilities. Therefore, a recommendation was issued from Public Works to the Department of Health to identify additional funding to support the replacement of a new facility rather than completing a renovation that would not meet the critical capacity demands and healthcare industry standards. The funding provided by the 32nd Legislature through Bill 32-0247, sponsored by Senators Francis, O'Reilly, and Viale, and co-sponsored by Senator Thoreau, remains secure. However, we recommend utilizing the identified funding to secure an appropriate A&E firm. The department was awarded a national initiative to address COVID-19 disparities among population grant in the amount of $3,141,521 that supports funding for a community health outreach coordinator who is qualified to offer behavioral health counseling to those population desperately affected by COVID-19. The project has begun, staff is being hired, and supplies have been ordered. Lastly, the division is currently working in collaboration with VITEMA on the implementation of the National Suicide Hotline Initiative to establish the 988 number as a direct link for suicide prevention and crisis support care. This allows individuals access to support whether in the mainland or in the territory. This system has to be designed to first initiate local contact and then roll over to the current regional and national support lines to ensure that the support is available 24/7, 365 days per year. The expectation is to have the 988 number to go live on July 16th of 2022. There have been several challenges in fulfilling the needs of the community. most notably due to staffing shortages, including key personnel such as additional psychiatrists, behavioral health nursing staff, RNs in particular, case managers, behavioral health technicians, therapists, counselors, and a mobile crisis response team. In regards to the American Rescue Plan Act, funds earmarked for public health have been allocated as follows. Behavioral health and drug dependency, Project V7028, block grants for community mental health mitigation, ARPA funding of $125,000 with an end date of September 30th, 2025. COVID-19 rapid testing kits, $65,000, personal protective equipment, $45,000, advertisement, radio station, $7,200, newspaper, Daily News Avis, $14,901. Project V7024, substance abuse block grant mitigation, ARPA funding $125,000 with an end date of September 30th, 2025. Spend plans mimics that of V7028. It allows us, if you merge those together, it allows us to better support the initiative within that. So they mimic the same thing that we just spoke about. Project V707J, substance abuse block grant, COVID ARPA funding, $590,398 with an end date of September 30th, 2025. Salaries, $378,000, fringe, $139,038. For the first year, there are personnel costs, clinical therapists, psychiatrists, case managers, medication-assisted treatment, media, advertisement. Year 2, clinical therapists is a combination of psychiatrists, as we said, it mimics the other one, and case management. Again, putting those grants together, Project V707J and Project V703J allows us to ensure the cost needed to fully staff and provide sufficient supplies to this development and the program. One additional CPI training books. We spoke about CPI before with certification, Blue Code, 10,800, outreach, venue supplies, etc. Personal year 2, and that is in addition to what we just spoke about, so I won't repeat that. Clinical therapist, psychiatrist, case manager, etc. Epidemiology and laboratory received 7 different awards from COVID-19 through ARPA, funding totaling $5,343,452. Project V7029, ELC, detection of mitigation of COVID-19 among people experiencing homelessness. The amount was $449,760. Budget period, August 1st, 2021 to July 31st, 2024. CDC just approved our proposed budget, and this is in the process of getting online with OMB. Project V7022, ELC detection of mitigation of COVID-19 in confinement facilities, $490,000. Budget period is August 1st, 2021 to September 31st, 2022. Online, the budget was online December of 2021. Spend down has just started. Project V7014, ELC, EPI and lab capacity for genomic sequencing, $958,344. The budget period, 8/1/21 to 7/31/24, August 1st, 2021 to July 31st, 2024. The budget was online September of 2021. This award was just received, and there are plans to create local sequencing capacity so that sequencing can be done on island versus shipping to our partners, Yale and CDC. Sequencing can determine the variants that we're seeing with COVID-19 and as well as other different types of sequencing. Items on the public health laboratory are being shuffled in preparation for the implementation. Project V7013, ELC, EPI, and lab capacity for school testing, $3,198,692. The budget period, August 1st, 2020 to July 31st, 2022. 64% of the grant have been spent. The remainder is for 2 personnel that are in process of being hired and some supplies. We are anticipating an extension under this grant to keep those personnel on for another year. V7029 ELC state-based nursing home and long-term care strike teams, $31,987. Budget period, August 1st, 2021 to July 31st, 2024. CDC just approved our proposed budget, and this is in the process of getting online with ONB. V7029 ELC Strengthening Healthcare Associated Infections and Antibody Resistance Program, $189,669. Budget period, August 1st, 2021 to July 31st, 2024. CDC just approved our proposed budget, and this is in the process of getting online with ONB. V7015 Public Health Laboratory Preparedness, $25,000. Budget period, August 1st, 2020 to July 31st, 2024. The funding award is being spent on personnel for conducting COVID-19 testing, hotline operators, laboratory testing, contact tracing, and data analysis staff. These staff have all allowed us to have daily testing for COVID-19, quick and efficient contact tracing, access to COVID-19 hotline, and dissemination of daily reports. Despite supply shortages experienced throughout the nation, the Department of Health never ran out of testing supplies for the duration of the pandemic. We've also spent a large percentage of the funding on testing supplies, including Binance antigen rapid testing and PCR reagents. A robust testing program includes procurement and securing adequate inventory of testing supplies and equipment. Testing was also successful in addressing surges and surpassed over 1,000 tests per day during the Delta surge and peaked at nearly 5,000 tests per day during the Omicron surge. Throughout the COVID-19 outbreak, this funding has also supported the following activities: collaborated with the VI Department of Education and 5 local clinical providers to safely open and keep schools open. Most recently, approximately 12,000 students and staff were able to be tested immediately before reopening. As a result of that testing, 127 positives were identified and safely isolated away from other limiting potential school exposures. Additionally, all school nurses are trained to conduct testing. The VI Department of Health provides rapid testing supplies should a student present with symptoms at school. Perform incoming passenger screening at air and seaports in conjunction with the Virgin Islands National Guard, utilizing CDC's guidance regarding COVID-19 symptoms for testing if needed. Support the mandatory self-quarantine for 10 days and provide instructions to contact an epidemiology hotline by calling 340-712-6299 or 340-776-1519. We work closely with FITEMA and the Personal Protective Equipment Task Force to ensure healthcare organizations and community agencies receive adequate supplies of PPEs using daily on-hand tracking burn rates that's needed. Closely monitor the spend down of the funding granted to the Department of Health by CDC to support the pandemic. Provide relevant public health information to all sectors using all media outlets. Expand our outreach efforts as we coordinate with community organizations. Track orders placed through commercial suppliers for PPEs and other supplies. Support long-term care homes, especially mass testing during outbreaks in these facilities. Support congregate living facilities such as the Bureau of Corrections with testing, contact tracing in response to cases, and provide mitigation recommendations. Test all individuals with flu-like symptoms and generalized aches and pain at the VI Public Health Lab. Review the report tests performed at commercial labs and assist hospitals with supplies and guidance with the quick PCR test performed on both hospitals. In addition to COVID The public health laboratory is also now capable of testing for up to 22 different respiratory pathogens. Also, it's important to acknowledge the laboratory has received the highest certification from CLIA. Communicable disease, Project V7027, strengthening the STD prevention and control for health disparities award, $1 million. CDC was required to submit, CDD, this is Communicable Disease Division, was required to submit a budget for review to CDC in September detailing the expenditure plans. The award period was June 2021 to December 2021. Recognizing that the award was provided late in 2021, CDC requested a 6-month budget justification with the understanding that most of the funds will be carried over to 2022 as a result of the short time frame to obligate and liquidate the funds following the required process of bringing the respective budget online locally. CDD will be allocating year one funding to acquire resources such as vending machines that will house at-home STD and HIV testing kits, condoms, and communicable disease paraphernalia. Additional 1-year funding will also purchase resources to support the public health lab and CDD to enhance our disease intervention infrastructure to bring new STD infection cases to zero. As of January 2022, the division is on standby to receive an updated notice of award of $1 million for year 2. Year 2, 3, 4, and 5 funding will be allocated to hire staff and provide services following the goals of the grant. The goal of the funding is to support outbreak responses needs by expanding and enhancing frontline public health staff, conducting disease intervention specialist workforce training and skills building, building organizational capacity for outbreak response, evaluating and improving recruitment, training, and outbreak response efforts. The Communicable Disease Division staff from STD and the disease intervention specialists were on the front line for COVID testing, results notification, and providing support to COVID contact tracing during COVID, as contact tracing is a part of the routine work during STD investigation. With the identified funds, the Communicable Disease Division will be hiring additional DIS staff members and program specialists. The division will be providing training for all team members as we prepare for our continued response to COVID, STDs, and other communicable diseases. Funds will also be used to purchase resources and supplies for rapid diagnosis and intervention of STDs in the territory. Project V7025 to implement COVID-19 module in the Behavioral Risk Factor Surveillance System, BREFIS, in 2022. Questionnaire received $25,000, award period August 1st, 2021 to July 1st, 2022. Note that BREFIS, or the Behavioral Risk Factor Surveillance System, is managed by our Chronic Disease Unit. The funding will be used to ascertain the prevalence of long-term effects of COVID-19 and comorbidities among those experiencing the virus and its effects. Adoption of the COVID-19 vaccine module would allow VI Department of Health to better assess equitable vaccine distribution by race, ethnicity, and other socio-demographic factors. The impact of COVID-19 as it relates to the workplace will be ascertained through adoption of the industry and occupational module. VIDOH will utilize survey results to measure the impact of place of work on COVID-19 outcomes and decision related to COVID-19 risks. Data collection for the 2022 BREFIS survey will begin in February of 2022. The funds will be spent from July to July of 2022 with an average of $4,167 per month. Public Health Preparedness Division. Project V7016, Cooperative Agreement for Emergency Response Public Health Crisis Response 2018, was awarded $760,742 for the 2021 Workforce Development Crisis Cooperative Agreement, or the COAG. Award period July 1st, 2021 to June 30th, 2023. This two-year cooperative agreement provides the department with additional funding to support COVID-19 mitigation, hiring additional staff, and assist with the development of a stronger workforce through additional training. Currently, the program has not begun to spend on this funding source. The division is currently working with CDC project officer and the department leadership to manage the funds. This cooperative agreement will provide funding $320,228 for salary and fringe to hire 3 additional staff members within the department: certified medical assistant, administrative assistant, and COVID-19 response coordinator. These positions will work with the department's medical director and public health preparedness division, respectively. Funding has been allocated to support the Virginia Department of Education with an onboarding of additional nurses in the Department of Health that will be assigned to schools, one in each district, to assist with both departments in providing COVID-19 support. As the division plans to increase staffing to support our response efforts, the division has allocated $20,000 to focus on building capacity amongst the staff currently responding to the pandemic. These trainings, in conjunction with the Office of Disability Rights, will be geared towards advancing approaches to caring for those with disabilities and other underserved populations in the fight against COVID-19. Funding to purchase equipment and supplies has already been allocated to support these activities, for example, computers and other supplies. The Division of Immunization COVID-19 Vaccination, Project V7010, COVID-19 vaccination, was awarded a total of $2,393,005 via 3 supplemental grants issued in 2021 to be expended by 2024. To date, $412,631, or 20%, have been expended to support clinical administrative staffing, medical supplies, immunization, information system enhancements, promotions and advertisements, healthcare provider vaccine administration, and public community outreach. The primary focus of the program is to sustain vaccine inventory in the territory for every age range as federally approved, vaccine handling and safety, and ensure vaccine access equity with specific outreach to target populations where vaccination hesitancy is prevalent and vaccination rates are lowest. Populations of interest include, but are not limited to, persons who are homeless, persons who work in the sex industry, persons who are undocumented, and persons who reside in low-income communities. Through mobilization vaccination efforts, we have reached a majority of our target population, and including persons who are homebound, those who are elderly, persons with limited access to transportation, and public or private entities that request vaccination for staff management. A significant component of the vaccination effort incorporates public education. The immunization program has provided presentations on the importance of vaccination and specifically the COVID-19 vaccines to private and government entities over the past year. Most recently, the program has partnered with Walgreens to provide an educational series for public school students, faculty, staff, and the public once a month from January through May. For the duration of the grant cycle, the program is focused on increasing clinical administrative staff and support in the form of nurses, data entry clerks, training specialists, procurement officers, a health equity officer, a vaccine demand strategist, and an administrative assistant. The program will be preparing to roll out vaccine administration for 6-month to 4-year-old population following FDA approval and ACIP recommendation. Maternal Child Health, Project VF701K, Pediatric Mental Health Care Access Area Expansion in the amount of $2,225,000. The Maternal Child Health Program will use the Pediatric Mental Health Access Grant for a 5-year period beginning September 30th, 2021 through September 9, 2026. The program has received 1-year funds totaling $455,000. The Pediatric Mental Health Care Access Grant, PMHCA, is a HRSA, or Health Resources and Services Administration grant, to address barriers and health disparities by creating a team that will interact with primary care providers across the United Virgin Islands, covering the 4 islands that make up the territory: St. Croix, St. Thomas, St. John, and Water Island. The project, which we have named Virgin Islands Child Psychiatry Access Program, or VICPAP, will support a territorial network of pediatric healthcare team consisting of a child psychiatrist, licensed mental health professional, and a care coordinator. The project is a pilot project for the U.S. Virgin Islands, as there is currently no pediatric telehealth consultation model in practice in the territory. The project will be the first teleconsultation service network in the Virgin Islands. The Virgin Islands Child Psychiatry Access Program team will provide teleconsultation training, technical assistance, and care coordination for pediatric primary care providers who can screen, assess, treat, and refer children with behavioral health conditions. Engaging and supporting pediatric primary care providers through a mental health teleconsultation access model that will provide increased mental health access to these providers and increased access to mental health care for U.S. Virgin Islands youth. Additionally, the program will provide training in evidence-based screening, assessment, intervention, behavioral and medication management, and referral practices in professionals in the VICPAP network to improve the workforce development capacity of the medical and behavioral health providers in the USVI to identify and manage the mental health needs of the USVI youth. Through key partnership with patients and patient advocacy groups and advisory committee, partnerships and outreach strategies will build a go-to service that is engaged as a reliable and efficient means of breaching the service access and available workforce gap for children behavioral health problems. And for the listen and viewing audience, the MCH program already has MCH transport vans that can be used in this venue as well. As a new grantee, PMCHA grant funds, VIMCH participated in the new grantee orientation meeting that was held in mid-October of 2021. The program participates in a bi-weekly meeting schedule by the HRSA PMHCA project director that provides ongoing technical assistance to ensure proper implementation of the VICPAP program. VIDOH is currently recruiting 4 key personnel that will efficiently manage grant funding as well as carry out the expectation of the grant. Preliminary rollout of VICPAP will be personnel recruitment of primary care providers in the territory. To date, the program is compiling a list of pediatric providers, nurses, and counselors in the territory that it intends to enroll in the program. Once those providers are identified, a survey will be conducted to identify their critical mental health consultation needs and to find their preferences for receiving consultation, training, technical assistance. Once implementation is completed, the VI Department of Health will provide telehealth consultations, care coordination, and connections to local referrals to primary care providers. Committed telephone and video consulting hotlines operating within normal business hours 5 days a week will be staffed by an interdisciplinary behavioral health team, including a child psychiatrist, pediatric psychologist, nurse practitioner, and a care coordinator. This team will serve the entire territory. Community providers will be able to contact VICPAP for rapid on-demand consultation services. Project V7020, Maternal, Infant, and Early Childhood Home Visiting Grant Program in the amount of $100,000. This funding has a run period of May 1st, 2021 to September 30th, 2023. The home visiting program requested an extension of the Healthy Families America model to provide additional services to 25 families in the St. Thomas, St. John district. The site expansion received approval from Prevent Child Abuse America in December of 2021. The American Rescue Plan funds will be used to hire full-time home visitors to provide services to an additional 25 families in accordance with the guidance of the Department of Health and Human Services for the McVie program and in accordance with the Healthy Families American Model Fidelity Standards. Our target population in the United States Virgin Islands are WIC and medical assistant eligible families. At-risk communities have been identified in both districts of the United States Virgin Islands. The St. Thomas St. John district is currently served by the Nurse Family Partnership models. This model provides home visiting services to first-time mothers or less than 28 weeks of pregnancy. The Healthy Families America model will be added to the St. Thomas St. John district as part of an expansion of home visiting services. Use of funds. Service delivery. Funds will be used to serve 125 families enrolled in the McVie home visiting program. Virtual visits and in-person visits will continue as a standard while observing federal and local pandemic protocols and guidance. Priority populations will continue to be focus of home visiting services during the funding period. Staff cost. Fund will be used to hire and train an additional home visiting staff member utilizing the Healthy Family American model. Funding will cover salary and fringe benefits for the new home visitor. The program manager will receive a salary increase as compensation for additional administrative and management duties in grant funding allocation and site expansion. The concerted efforts of the government of the Virgin Islands were critical in reducing the impact of COVID-19 in the territory. To date, the U.S. Virgin Islands remains among the third lowest case and mortality rates in the nation. Cases and mortality rates were over 200% and 300% less, respectively, in comparison to the highest jurisdiction in the nation. In conclusion, Senator Francis, we thank you for the opportunity to testify today to provide updates on behavioral health services and our ARPA funding. The Department of Health is committed to reducing health risk, increasing access to quality health care, and enforcing health standards. And as always, I would like to thank the team at the Virgin Islands Department of Health for their continued dedication to the Virgin Islands community, along with our partners, the unsung heroes, the Virgin Islands Department of Tourism, Property and Procurement, and let's not forget the Departments of Finance and Office of Management and Budget. We continue to commit to building our collaboration with the members of the 34th Legislature and stand by and ready to respond to any questions you may have. Thank you, Senator Francis.
Thank you very much, Commissioner Encarnacion, again for that comprehensive overview of the programs under the Department of Health. So we certainly appreciate that update. I also want to take this opportunity to recognize and commend the Public Health Laboratory, Dr. Brett Ellis and his team, again for that high certification that they have received from CALIA and the work that they continue to do over at the Department of Health and the laboratory analysis that's going on over there. Commissioner, how are you coping with the challenges of the Department of Health and certainly some of the increased demand of the job associated with what we're experiencing with the pandemic and post the hurricanes? How are you coping?
I think it's all a balancing act, Senator, and I think that when I come to the Senate, I always bring my team with me, and that is because one person cannot do it by his or herself. And I think we're able to do what we do because we hold steadfast as a team, meet quite frequently, and they're always there for me. They're there for each other, and it's something that I think that we have a guide ever since we started working as a team together in January of 2019, and it's been very consistent. We have fun, so we continue. We try to support not just the Department of Health, but we support anyone who knocks on our door to ask for help. Most recently, of course, Department of Education, and we're always there with Vitima. As Anati have to tell you, Vitima is more our support than we are their support, even though we work collaboratively. And of course, our federal partners are always there with us. So I think the key thing is to know when to say that you need help and to accept help. And we do that readily as well as we give. In a nutshell.
Very well. And do you care to share how are you handling the rest of the staff as well as your leadership team? Is there a retreat that happens? How do you again engage and allow for them to decompress?
Oh, well, one of the things that we like I always say to them, we tend to take care of others before we take care of ourselves. So we were, and we need to keep this up again, but one of the things that we were doing is trying to bring in mindfulness into our conversation. And that is, I guess, the spiritual part of who we are or who I am. But trying to look at that and what we do, I have to tell you that we always pray together as a team. And I think that's important. We thank God because we are here to serve the public. And I think that's one of the mindsets that I think that we've been trying to infiltrate throughout the entire Department of Health. But we're here to serve others, but we have to take care of ourselves. Yesterday morning, I gave a talk to our emergency operation team, which meets every Monday through Thursday. And I said to them, it's now time for us to figure out how Omicron is subsiding. It's now time for us to see who needs to take a break, who should cover for each other, and how we're able to do that. When we get together, especially if we were able to get together face to face, we were one of the few departments. We did have Christmas parties, and we had a blast. We had a good time. We were safe, but we did have a good time. So we tried to do those kind of things. We have individuals on certain areas. I have to say, Dr. Charmaine Myers is one of them that is definitely out there. She's very active, trying to make sure that we do what we're supposed to do. Tatia Monel Hewitt on St. Croix and Renee Schuster. So we have key members of our team who plans different things to make sure that we even have special prayer breakfasts or simply breakfast, gifts for the staff members. We're not perfect. We have, it's not all happy. Sometimes we have to make some hard decisions, and those hard decisions are made. But you treat people as kind as possible. So tender on the person, but tough on the decisions, tough on the issues, and try and get things done.
Very well. Thank you for sharing that. I think it's important that the community appreciates and understand that a lot of times we look for leadership to do everything possible, not understanding that they too have to take care of their health, their mental health. And, it's sometimes we leave it left unattended. I know I've done that myself, and we don't take care of ourselves, and there's this level of expectation. So I just wanted for you to share that with the community as well as my colleagues, that in fact these jobs come with some responsibility, but at the same time, if you're not able to address your own issues and concerns, then you're not available to assist and support those that call upon you, or you treat them with harsh, boisterous, rude, and disdain, rather than that customer service that you're expecting. So we want to make sure that people are taking care of themselves. At this time, colleagues. Yes, Commissioner, you're welcome. I'd like to open up the floor for a 7-minute round, and I'm sorry. What I'll do is just Senator Viale will be first, and then followed by Senator Saru and Senator Carrion. But what I'll do, Commissioner, is give you a refresh, 2-minute break, and we'll come back and we'll begin with Senator Viale for 7 minutes. The Committee of Health, Hospital, and Human Services of February 9th, 2022 stands in recess for 2 minutes. The Committee of Health, Hospitals and Human Services is out of recess at this time. Of course, we're doing block number one, an update on behavioral health and the Virginals, overview of the use of the American Rescue Plan Act, funds earmarked for public health. And we just heard the testimony from Commissioner Encarnacion, and we'll be open up the floor at this time for a 7-minute round. Senator Viale, you're recognized for your 7 minutes. Before we go to Senator Viale, Senator Joseph, thank you for joining us. Welcome. You're recognized now, okay? Senator Viale, you're recognized. What's that? Senator Viale, you're recognized for your 7 minutes.
Thank you, Mr. Chair. Good morning to the people of the Virgin Islands. Good morning, colleagues, and good morning to the testifiers. In reference to the number of inmates who need or require who have behavioral issues, do we have a number of the number of individuals that are incarcerated that are in need of behavioral health?
Good morning, Senator Violet. DC Brennan Steele, you have those numbers for us?
Hi, good morning. No, we do not have the numbers for BOC inmates currently needing behavioral services.
Does BOC relay that information to Department of Health? I know that we took a visit to the Bureau of Corrections recently, and we saw individuals who are in severe need of residential treatment or services. Is there a discussion and a plan as to how we decrease those numbers?
We actually want, go ahead, DC Steele, and then I'll follow up.
Okay. Currently, no, we haven't specifically discussed the numbers of inmates currently in placement. However, we have ongoing communications with those that need to be transferred out into forensic facilities, and we are most recently set up to have an ongoing meeting and collaboration with the Department of Bureau of Corrections to have those meetings. Yes.
I'm trying to move from the step of meetings and collaboration to actually individuals getting help. I personally know a young lady that was arrested 2.5 weeks ago and has a mental health issue. This is the 5th time she has been arrested, and she continues to be released back onto the street, and then she gets herself into a next incident, and all of her incidents are a direct result of her behavioral health issues. And how do we establish a system? Somebody get arrested once because of behavioral health issue, twice, the 3rd time, the 4th time. At what point does it become that the government need to provide residential treatment for this individual who is repeatedly being arrested because of behavioral health issues? How does that look?
There is a system that DC Steele has presented to the courts at one point in time. He met with them. DC Steele, could you relate that system, how it looks, and how we're trying to implement it here as well?
Yes, currently what Commissioner is referring to is ideally we'd like to have the mental health court system put into place to help the territory so we can streamline those individuals who need behavioral services when they're incarcerated or arrested. Pertaining to that question with those individuals being rearrested, they are linked with us, and a lot of them are participating in ongoing outpatient services in the clinics.
How can we get somebody residential help? Somebody that's consistently incarcerated. I can give you the names. How do we move from being arrested to actually being sent away to receive help?
There are a few steps. If once they are let go from BOC, no longer incarcerated, they need to be assigned, or we need a link between BOC, or actually Department of Justice, as well as Department of Health, which we do. The judges recommend or demand court order them to be placed into a residential facility. At that point in time, that's when we come in and we transfer the patients, or we have been successful within the last year.
3 minutes.
Admitting individuals into elder shelter. But I think, how many residents have we, BOC inmates, have we brought into elder shelter brand this year?
Not at BOC, not to the shelter brand, but we have taken several inmates up to the mainland for treatment. And also we have the difficulty of beds available at those forensic facilities.
As well, yeah.
And I'll move to the next area, but I recently read in a newspaper where a mentally ill individual was released to the custody of his brother. And his brother said that he doesn't know what else to do, because he have tried to get his brother into a residential treatment center, and he just continues to get arrested. And I mean, he's once again going to try, but there must be a link There must be the ability for Department of Justice and the court system to have a plan with Department of Health where we'll be able to take care of these individuals who continue to be arrested. We have someone that is, I won't call the names, that is very popular in Christian Set Tongue that really doesn't trouble anybody, that last year was shot in his head. And he has a behavioral health issue. And I haven't seen him since then. He's been getting treatment, but we just, they're on the street until the point of deterioration and they do something crazy. And then people.
1 minute.
Let me move to the next topic. The behavioral health vans. I know that we called you, Commissioner, and we asked for the amount to be able to fund those vans so that those vans can be accessible. In terms of staffing, are we going to be able to find the staff, or do we have issues finding those healthcare professionals?
DCCO, can you please answer that?
We will have some difficulty for the clinical therapist role, but for the community outreach coordinator and workers for the vans, we should be able to fill those positions. Those positions will be posted very shortly. They've cleared the other hurdles of being budgeted and approved and so forth. So they should be posted very soon.
Okay, well, we already included it in the budget. So what is your timeline for getting these individuals on?
The postings are going out within the next 2 weeks, and then we have to hire.
Okay, and what is the plan as to how the vans are going to be utilized? What's the rollout plan? If you get the staff, how are those vans going to be utilized to help those members of our community who don't come for help on a regular basis? How are we going to implement that?
Time.
Yeah. Can I answer?
Mr. Chair?
You may proceed and answer. Correct. Yes.
Okay. Yes, the goal is to have the vans moved around to several locations in the community, specific locations where we know we've seen a lot of frequent homelessness. But in the interim, we're actually going to have the vans go out March 4th. And the goal is we're having conversations with VIDE. We want to have the vans on the high schools right now because of the current return to school and the pandemic results. So starting Friday, March 4th, every Friday, the vans will be out as in the interim, even until we get the additional staffing.
Will be to the schools to do what?
We want to have on-site support because we've been getting calls from different school personnel who talking about the difficulty of adjusting back to the schools for the kids. So we haven't finalized that, but that's one of the goals we want to have for the vans to be available for such as need be. In addition to the community.
And I applaud, with your indulgence, Mr. Chair, I applaud you for trying to help that particular issue. But if you park a behavioral health van in the front of a school and a student is marched out to the van, you causing pandemonium for the student or for the particular staff. These are areas where we have to be very discreet. I would suggest that you have the administrators of the school find a location in the school and you discreetly try to assist those individuals that are having help. But a van out there, that's a red flag. As you walk through that door, our students are going to be labeling that particular student. And lastly, with all the grants that you name, Commissioner, and I mean, this is a problem nationally, but with all the grants that you name, there's so many grants that have staff. I'm seeing like a waiting onboarding of staff. How are we going to be able to utilize these federal funds? Do you have a list of positions that are required for all of these various areas?
Yes, and for example, Dr. Myers could speak to this, but her grant, the MCH grant, they actually had to submit resumes as well as job descriptions to HRSA. They approved them. Now they've been approved. Now we need to begin hiring. We actually do have a lot of individuals within a territory that we can hire. We have to train as well, and her grant allows for the training purposes. So I honestly think we could find these people. We just have to make sure that we expedite the hiring process. And that's one of the things that we're working on as well. And I know that's what you're referring to.
Commissioner, I was trying to give you a medium to advertise the positions. We need this, we need that, we need this, contact so and so we could get those positions filled. Thank you, Mr. Chair.
Thank you very much, Senator Vela. In respect to having the vans at the school, I think that it's important that we understand that I submit that every single student in those schools are having some difficulties right now. And my suggestion at the time was that we need to try to process every single student, give them an opportunity to be able to come in, have a discussion with them, and then make the necessary referrals from there. Similar to what has been done when we were younger for dental, what was done for vision. But under this scenario right now, I believe that every single student in these schools need to at least have some discussion with a mental health or counselor or some mechanism by which they could be debriefed, and then where there is a need for referrals, then it should be done there. So I'm supportive of having the vans at the school and really just try to process every single student at some point in time, having them there. Additionally, in respect to
Senator,
yes, go ahead.
if I may, I want to just to remind everyone that Deputy Commissioner Steele isn't just the Deputy Commissioner over behavioral health and communicable disease. He's also a certified counselor as well. So the approach that's being taken, it may be a group approach, it may be an individual approach, but whatever approach that we're going to take at the schools is going to be an approach that's definitely going to be very sensitive to all the age groups that we're looking at. And I agree with both you and Senator Vealy. We have to be conscious and conscientious in our approach, but trust me, those are the approaches that we are going to use a myriad of approaches to be able to reach individuals that we need to reach, as well as support the teachers and faculty of the schools.
Very well. Thank you for that. And also in respect to the mental health court, I do have a BR for the establishment of a mental health court. I've been working with Judge Willock, over the presiding judge over at the Superior Court, and others to come up with the language for us to be able to have a mental health court, again, so that we could be able to make some inroads in addressing these things in a timely fashion. Because today we're talking about urgency. Senator Gregory, you recognize for your point of inquiry.
Thank you, Mr. Chair, and good morning to everyone. Very quickly, Commissioner, in your response to the previous senator, as it relates to the use of the vans at the schools, I think the question was around how are you dispersing the vans throughout the community, and we kind of got stuck on schools. So I'm not clear on how you're using the vans throughout the community outside of the school setting. So I need clarification or understanding or more details around that. Thank you, Mr. Chair.
Thank you. Commissioner?
DC
DC.
Steele, please.
Deputy Commissioner Steele?
Yes. Yes, so like we mentioned, when we do onboard the staff, we actually have a clinician on the team. We will have a nurse available to also do screenings, but the goal is to have it at various locations throughout the community, moving it around 2-3 times a week so that it's readily available, is accessible to any individuals in the community. So we set up as like pop-up clinics and basically giving our resources, information, but as those who need the direct care and services, they can receive it right there and then at that moment. And then, of course, they will be referred and continue to the outpatient clinic.
DC Steele, I think what the senator was asking, if there's a schedule that's being prepared in terms of the deployment. Are you going to be in the Sunshine Mall, for example, on such and such a date? Is there a plan to be able to have the vehicles deployed and a schedule that will be available for public consumption to be aware of when and where the vehicles or the vans will be deployed?
Yes, we're finalizing that schedule right now, and it will be marketed and advertised when the vans will be and where it will be. That's all happening for the month of March.
Sure. So, for Gregory, you're recognized for your follow-up on your point of inquiry.
Okay, so I think we're here today so we could have an understanding of what's happening as it relates to behavioral health. We know that, there was a big kickoff regarding these vans, and I believe it was December. So we're talking about our goals, but our concern is what's happening now, because we're talking about the schedule and it's supposed to happen. What is going on, Commissioner, as it relates to these vans? Are the vans deployed now into the community? Is it working? What's the success rate? That's what we're trying to establish. If it's not happening, just say that it's not happening, but it's going to happen by March 1st, March 10th. That's what we're trying to establish. Let's not talk around the issue that we're trying to flesh out, please.
Understand, Senator. I agree with you. DC Steele, could you address that issue, please?
Yes, the vans will be out mobilized on March 4th. Currently, the vans are not out rotated because we utilize the same staff from our clinics at this time. And unfortunately, that's why we would only be doing it once a week when we start on March 4th. But once we get the direct staff, it will be out much more, and we will have a solidified schedule at that time and locations.
Very well, Senator Viola, you're recognized for your point of inquiry, and then we'll come to you, Senator Blight.
Thank you so much, Mr. Chair. Originally, when we conceived the idea of purchasing the vans, we wanted the van not to announce a location where it's going to be, but for the van to go where we know the homeless and behavioral population live. I could tell you, Christiansted, Sorton neighborhoods, Frederick said, we wanted the vans to go there to provide a service. I mean, I did a feeding program once a month, and the exact same spot, you can find them there every day of the week. They're not going to come to an area that's announced. So you got to go where they are, and you have a staff that is trained that would be able to go out and learn and speak to that person to get them in to provide some of the basic services. But we want to help that population that don't show up, they have no means of listening to the radio or no care what. We got to go to them, and that was the idea behind the vans, that we will be able to go to where they are and provide the service. Thank you, Mr. Chair.
Correct. Thank you, Senator Viola. Senator Blyden, you're recognized for your point of inquiry. You're recognized for your point of inquiry.
Thank you, Mr. Chair. Good morning. And both of my colleagues spoke exactly to where I was trying to go, because basically, based on the testimony, my question were, where are they primarily deployed? Because we know why we had those vans online. How many times do they go there? How many people they service on a regular basis, a weekly basis? What the feedback from the community, etc. So I think it's critical that we be clear moving forward when it comes to disseminating information. Thank you so much.
Very well. You recognize at this time for your 7 minutes.
Thank you. Good morning to my colleagues, the viewing, listening audiences, staff, central staff. Good morning, Commissioner Encarnacion, and thank you for that most comprehensive testimony. Good information. Let me go directly. Let me skip that part then, since we have passed that. Let me go to the testimony on page 3 of your testimony. You spoke to the 22 off-island patients, and that there was a court order to have them here in the territory. You also spoke to the Shelterburn facility that's waiting for A&E services, and it should be online in 2023. What type of savings would we realize as a result of those individuals coming back home, Commissioner?
Right now, we pay at least, and this we cannot include the 23 forensic population because we would not have that service here. But we're looking at close to $4 to $5 million annually if we're able to bring those patients back home. DC Steele, you can respond to that as well, but that's sort of the funding that we're looking at. We pay more right now, beyond $7 million, and so our budget is very tight as a result of that. Any savings that we have sometimes go to pay off-island service.
Very well. Thank you for that important information. And the $4 to $5 million, of course, we have used for it, but do you see any need in your department that you're going to try and see how you can shift some of those funds to those areas to assist and shore up the department and the services to the people of the territory?
I have to tell you that looking at the report that we presented today, a lot of it has to do with equity, decreasing disparities, and behavioral health initiatives coming from the ARPA funding. If we can solidify what we need to do, have our HR division, OMB, as well as our Department of Personnel get together, ensure that we have those individuals hired as soon as possible, that would allow us to ensure access to the care. We have to have the people involved so that we can provide the access.
Okay, and in your testimony, you also spoke to additional behavioral health services resulted from the pandemic and you needed more staff. I know there were not a number. How many individuals are we speaking of in terms of assisting the department with the needs of the community?
Well, if we look at what we need, and we did submit the level of staff needed to fully fill the vans. One of the other things that we're looking at is a crisis intervention team. Right now, we call our environmental help as well, but we call our behavioral health team sometimes 24/7 to assist in the community sporadically because we do not have the staff needed. So DCC, do you have the numbers for the crisis intervention team?
Yes. So adequately staffed the crisis prevention team. We're looking, that team alone by itself is running over $4 million because you need 21 personnel to cover 365 7 days a week shifts, as well as having the clinicians readily available for having to hospitalize or de-escalate, etc. And that's just the mobile crisis response team.
We're also looking at increasing the number of staff in an elder shelter brand. If we're trying to bring individuals back home to the territory, we also have to increase nursing, and we're looking at implementing psychiatric technicians into our facilities so that we can reduce the number of registered nurses that's needed, which will reduce the cost.
Okay, thank you for that. And you also spoke to the crisis counseling program grant that FEMA awarded to the department. What's the date of that grant and how much, what's the amount, the date and amount?
The CPP, DC Steel, do you have that right with you? Right here, it says.
The full award, yes, the full awarded grant was 1.3 million, and it started from last year in the end of 2020, and we got an extension. It's currently through May 7th of 2023. However, if SAMHSA allows, based on the numbers of COVID, is whether they will extend that or not.
Now, if I may. One of the person that sent the letter indicated that private entities were providing care. We also negotiate with those private entities, and we have contracts with them. We know we can't provide all the care ourselves, so we try to engage others out there to help us with that. Doesn't mean that we're not involved in the care.
Okay, and also you spoke to the funding, the additional funding for the onboarding of nurses at the Department of Education. Are you having any issues in terms of onboarding those nurses, and how many nurses are we speaking to in that respect?
That would be the preparedness program under Director Ovid Williams, and so that funding isn't currently available. Once they're available, those nurses will be hired in the Department of Health, but placed into the Department of Education to assist with the COVID, because right now, even though we've trained the nurses in the Department of Education to conduct the testing, we still need more hands-on availability to be able to provide not just the testing, but securing separation of students if needed, and helping to organize testing as well.
Okay, and finally, before my time is up, let's speak to the teleconsulting service network in the territory. As you said, it was the first. It's going to be the first coming online. What would that mean? Number one, for the department, and number two, for the people of the territory.
1 minute.
And what would it look like? What would it look like also?
Okay.
Speak to that, please.
Okay, I'll have Dr. Myers speak to that, but I have to tell you that behavioral health as well as MCH began telehealth services as well as a community health, but this is a completely different interdisciplinary program. Dr. Myers, can you please speak with that?
Good morning. Good morning, everyone. Senator Blyden, can you repeat your question, please?
Yes, the teleconsultation service network, the first of its kind in the Virgin Islands. What would it look like, and what would it mean for the department and also for the people that's going to be utilizing that service in terms of revolutionizing the service that's going to be going out to other people?
Basically, the the VICPAC program is earmarked to train pediatric professionals in the mental health capacity so that they'll be, and this is for the pediatric population, anyone between the ages of, school age children from 0 to 18 or 0 to 21. So the primary goal of the project was to just establish a pilot regional pediatric mental health care telehealth access program to provide psychiatric consultation, care coordination, and referral to the behavioral health services in the U.S. Virgin Islands. It would actually increase the psychiatric and behavioral health access needs for primary care physicians, pediatricians, family physicians, nurse practitioners, and physician assistants in the territory.
Time.
So how will you advertise it? How will you get the word out to those that need it?
So we have already compiled a list of pediatric providers to include teachers, and we recently, when Commissioner Encarnacion was on the Senate floor last week, we had a few calls already because she did make mention to the program, and we had calls from certain early childhood providers, persons that already interact with children, and they were already ready to join the program. So we're compiling a list, and we're going to add them to the program, and we're going to have several trainings to train these professionals.
Thank you so much for your responses. Thank you so much, Mr. Chair, for your leniency.
Thank you very much, Senator Blyden. Before we go to Senator Soro, Commissioner, in your testimony, you mentioned that behavioral health key personnel. Well, we've been hearing that there's been some loss in personnel over at the behavioral health area. What is being done to allow for the crisis intervention as well as outreach in that particular area? Have you lost personnel in behavioral health?
Well, that's what, in terms of key personnel, yes, we lost our assistant director who we had poised for becoming the director of behavioral health. So that was a big loss for the department. It was a big loss for me. I'm still trying to get over the fact that he's not here. But I know that is something that a personal decision he made for himself and his family. So I'm happy that he is where he wants to be. However, it's a big loss. So we are now, the position is open, it's posted, and we are recruiting. We already have resumes on hand of highly qualified individuals to take on that role.
And I suspect there is a level of urgency in that matter. Are you, I guess, again, utilizing the state of emergency to expedite the hiring practices of getting those individuals on board?
That is an extreme level of emergency for us and for me. Yes, sir.
Any timeline on when that's going to happen?
Well, it's already posted, and so we're waiting for the paperwork to come back from OMB, which I'm sure will come back shortly. Director O'Neill has been working with us tremendously with all our high-level needs, so I can't see why it would take that long. And then, of course, like I said, we've already selected those that we want to interview. We'll interview, and the hiring process will begin.
Very well. The chair will recognize Senator Soro. You recognize for your 7 minutes at this time.
Thank you. Thank you, Mr. Chair. Good afternoon good morning to the testifiers and to those listening and viewing, and to my colleagues. Before we proceed, Commissioner Encarnacion, I know that you are the head of the COVID task force, but I am pained every day, every time I return to the territory and I see our teachers in a National Guard uniform checking my temperature and scanning my QR code. And I think the time has come for us to maybe hire people with COVID funds or whatever pandemic funds that we have to do that job, because our students are in school, and you have one of the best math teachers. You have teachers literally in the National Guard. You have a band teacher. You just have them all at the airport doing stuff that our civilians, I think at this point, can put the thermometer to my head and scan my QR code. So I just want you to take that into consideration for me. Our students need their teachers. Okay?
I'll speak with the Major General Max Lanebacker on that, not knowing exactly who these individuals are. So that's nice to know that we have teachers doing that. And I'll speak with them and see what we can do.
I know we have federal laws and everything else, but we have St. Croix, we are already struggling with the arts and band, and you have one of the best band teachers in a National Guard uniform for the past 2 years. And if you just, I came from education, so I know my former colleagues, and I am so stressed watching them in a uniform, scanning and taking my temperature. Now, moving on, I want to start with the psychiatric geriatric patient. I don't know if I'm using the right term, but older people who have mental illnesses. And you and I have had discussions. At one point, I had to reach out to you because we had a 79-year-old senior resident. There was no medical doctor to attend to her. No medical doctor to prescribe her the appropriate meds and do a 723. And then Lucinda Millen is no longer adequate. The Queen Louise Home does not take any mentally ill patients, and the shelter brand age limit is 60 years. And if we're going to be honest, our mentally ill population is going to age, and they're going to get to that point. So what is the department's plan to address the psychiatric geriatric patient?
Well, first of all, we need space because, of course, Elder Shelterman is 29, so we're at our capacity. We try to keep a bed here and there open, so when the courts mandate for us to put individuals in placement, we have that. But I've also asked for us to look at the admission criteria for Elder Shelterbrand. And so that's one of the things that we need to do. So that should be top of our priority. DC Steele, that's one of the things that we definitely need to do is really and truly review the admission criteria. I don't see why 60 has to be the age limit for Elder Shelterbrand. I would agree with that. We've discussed that before. So we just have to have the policy reviewed and revised.
So is it So is a 60-year age limit a federal thing, or that's just an internal policy that we can be able to change?
That's an internal policy that can be changed.
Okay. And then, because I'm really worried about this mentally ill population is going to become 70, 71, 79, 80 years. And I don't think that when they reach that age limit, then there's nothing that we have to assist them. Now let's talk about outreach. You and Mr. Steele know that there are many nights I am unable to sleep. I have called in utter frustration. And if I, as a senator,
3 minutes,
dealing with a mentally ill person in my neighborhood, who the neighborhood calls me because I am one to de-escalate, but I fear there will be a day where I am no longer able to de-escalate. And to this day, the person I have called you about still has not received any level of service. And Director Steele, you told me somebody went out, you try and you can't find them. If you go out and you're looking for them, why don't you call me? I could help you find the person, because if I am calling for the help, then I have been at this for a good 2 years now. Mm-hmm. And I have complained 2, 3 in the morning, can't sleep. Can't sleep. And this is probably the story for many people across the territory. So what does your outreach really look like? Because if I am the one to file a complaint and it took 1.5 years to get back to me, and you go out and I say, well, listen, I can't sleep again. I've sent you videos, I've sent you recordings, Miss Sarah. And I'm like, okay, and I go outside and I de-escalate and in the neighborhood looking for Senator Sarah to find her son. I mean, what does that look like? What does your outreach look like? If I am calling you and you can't find him, why not call me back and say, hey, we out now. Do you have the morning to dedicate to us to assist, since I am the one who he responds to?
I think that we simply need to acknowledge that our crisis intervention team needs to be put in place. We discussed that in terms of the number of people we need to implement that. But right now, one of the key people in St. Thomas in particular that we could have relied on also left the Department of Health, Behavioral Health unit. And so, of course, we are down on our outreach personnel in St. Thomas as well. We have 2 individuals hoping to get that position filled. So now we'll have 3. That person is no longer with us as of March 4th, if I remember the timeline correctly. And so we have now 3 positions available for St. Thomas for the outreach program, which we can intervene into.
Well, Commissioner,
crisis intervention.
so leadership requires a level of creativity, right? So I understand your positions, but I'm going back to asking Mr. Steele what precluded him from, if a person makes a call and a person has a relationship with somebody who they're struggling with,
30
what
seconds.
precludes DOH from calling me back and say, hey, Senator Sarah, we would like to go out tomorrow. Do you have time to assist us in finding a person because that person is responsive to you? What, in the absence of personnel, what precludes you from getting the community's help in finding a person that needs the assistance? This is just creative leadership that people are going to get PhDs in.
Yeah. So now
Fine.
if you, Senator, on that, we did have, not only did the team go out, they actually went out with VIPD at one point of time for that individual. They were able to locate the residence. He didn't come out. Then VIPD had us do a 722. They went back a few days later. VIPD said now that it's expired. They couldn't take that to the hospital. So we ran into many roadblocks and problems with that. And the staff was also provided your contact information to make that contact when they were on scene. So I'm sorry to hear that they didn't do so. But the major hurdle was when VIPD was not engaged. Because of the notarization of that document, we were faced with hurdles and getting him admitted, and then he kind of fell off again where they couldn't locate him. So there was not a lack of effort being done on that, but there is some follow-up needed. And like the Commissioner said, the shortage of not having a designated outreach staff, we were pulling staff away from other patient care in the clinics.
But we can readdress that, right, DC Steele?
Absolutely.
We have a second round, Mr. Jay? Okay. And just one more question. What are our recruiting efforts? Because I meet so many people who have degrees in social work and in counseling, and this is a redundant question I've been asking from the budget season. We have vacancy on top of vacancy. They're funding. We have federal dollars coming in, and we're just not hiring the people. So I'm listening to one of your hindrances would be lack of personnel. What is your recruitment effort? Because I look on Indeed and I don't really see much. I look on all the major, people would love actually to move here as well and take a job in Sun and see and run away from COVID for a moment. So, well, COVID is here too, but I mean, our environment, sunny, nice. So if you could tell me, what is your recruitment effort to fill these critical vacancies that you're having?
Well, we do locally. I do not have DC Jean-Baptiste. Unfortunately, she was called out, so she's not able to speak to that. But we recruit locally. We also recruit externally. I cannot say if we've ever used Indeed. I know we use them for particular positions, like professional positions we use Indeed for. But I can't say if we've used those for crisis counselors, for outreach workers. So doesn't mean that we can't. You go back to creativity and how we actually implement change. And so your words are well noted.
Mr. Chair, that's one of our greatest issues, that this vacancy excuse all the time why we can't provide services to our people, that's to me is garbage at this point. We are not recruiting the way we should to find people are looking for work, and we are not recruiting the way that we should. Thank you, Mr. Chair, for the time.
Thank you very much, Senator Soro. Before we go to the next senator, Commissioner, I know Dr. Sims, during a recent appearance before the legislature, had mentioned about students experiencing mental health challenges, to include suicide and ideation. Can you tell me what is being done to address that situation? We just saw recently where the Miss USA committed suicide as well. Having the helpline is wonderful, but beyond the helpline, what support is provided for those that may be in need of counseling during a suicidal thought?
Okay, so whenever that occurs, we're immediately called in, but I like to look at it from a preventative standpoint as well. You don't have to wait until you're called because someone is trying to commit suicide or have suicidal ideation. But going back to what DCC spoke about, going into the schools, yeah, the vans will be parked up, but conversations in the schools and having that plan in place. We don't need to wait for the vans to do that. So those are some of the things that we can speak with education about. We've actually had those conversations with education, honestly. So I think putting a plan in place as to how we actually go in and when we go in outside of the vans and speak with them. I think them understanding their feelings is one thing, and I don't think we do that well as a people. And I think that we need to really address it so that we can talk about it and then act. DCC, do you want to talk about some of the ideas that you may have for the schools? And it can't just be high schools, it has to be the lower grades as well.
Yes. No, the vans rolling out was to start with high schools and then move to other age groups. But I also want to share that our team has been working with students on a regular basis. As recent as last week, we had a student in the same situation making suicidal statements on a platform. We were contacted by VIPD. The staff immediately mobilized and went out, met with their family and that young lady, got her safely to the hospital, and care was provided. So this is something we're doing this on a routine basis. Despite the shortage, we pull all hands on deck and have the clinicians respond. However, with a more robust team and having it in place, it would make it a lot more efficient. But that is the exact reason we wanted to start with the vans in the schools, because we recognize that these children are struggling with many different facets emotionally right now. So being present, and that would also help reduce the stigma for the future. And we're using evidence-based models as to how we approach those students, and just being present, and they build relationships and know our counselors is not to have them feel like you're being labeled or dragged in to say, okay, you have mental health issues. That's not the approach we're taking.
Thank you, DC Steele. You have a point of inquiry? Senator Carrion, you recognize your point of inquiry?
Good morning. Good morning. Thank you, Mr. Chair. You have a point. Has there been any type? Good. Has there been any type of assessment or survey to measure the impact of this pandemic on the behavioral health of our students or the younger population of Virgin Islands?
No, we have not. We did that. The last time that was done was the Casper survey that was done post-storm. Dr. Ellis, do we have any idea whether or not we would be having a Casper survey to determine mental health effects or behavioral health effects?
Good afternoon, Dr. Esther Ellis, territorial epidemiologist. We do not have a CASPER plan to address behavioral health in schools, but it is something we could consider if there is a need for it.
I think that there is an identified need, so we can get back to you, Senator Carrion, to see how we can actually implement that. We also spoke about the breakfast survey, and that in itself would allow us to provide some feedback as to the level of behavioral health needs throughout the territory, and that is beginning, and I think we spoke about that beginning in March of 2022.
Because I definitely believe that there is a need, so I'm willing to support, help any way that I can so that we could have this service and assessment. We need data to know then what the amount of services, what we need to provide to our students and young population. Thank you, Mr. Chair.
Thank you very much, Senator Carrion. You're absolutely on point with that. I mean, we definitely need some baseline data to move forward on. The chair will recognize Senator Alma Francis Heidegger at this time. You're recognized for your 7 minutes. Senator Francis Heidegger. Senator Carrion, you're recognized for your 7 minutes.
Thank you, Mr. Chair. With regards to, we're talking a lot about staffing, and let me get some clarity, Commissioner. First of all, let me say good morning to my colleagues, Chair, and the testifiers, and the people of Virgin Islands. We all know that behavioral health we're in a crisis in the territory, and we really need to pay attention to it. What's the amount of staffing that you have in the behavioral health, alcoholism, and drug dependency division? What's the number of staffing you have available?
DC Steele, can you respond to that, please?
Currently, there's 21 staff members, but of that 21, there is 7 only that's providing counseling. 2 case managers and 2 nurses and a part-time psychiatrist. All the other staff are administrative support or clubhouse services.
And can you say who we contract with also to provide those services?
And we contract with Island Therapy and Insight Psychological Inc. to provide other services in the community. And they also provide some of the psychiatric and psychological evaluations for residents.
Okay, can you break this down per district for me, please?
The District of St. Thomas, currently clinical staff is 3 counselors, 1 nurse. The ESF has RNs, primarily only RNs, 5 RNs currently, and then a few LPNs. I don't have that exact number in front of me. St. Croix Clinic currently has 2 therapists, a clinical supervisor, 1 case manager, 1 outreach, 3 clubhouse staff members, and the other staff for support and admin as well.
So in order to provide the services that are needed in the territory, we're talking about, Commissioner, what's the amount of staffing that you should have?
We have a staffing plan. I don't have it in front of me, but we can, DCC, do you have the staffing plan you submitted to our HR department? If we can get that to you ASAP, because that was submitted a couple of times. So I will I'll get that information to you.
Yeah, I don't have it in front of me at the moment, but we will get that to you.
Do you have an approximate figure that should be in the range of this amount?
Well, for, like we mentioned on here, just even the implementation of the 988 service that we're going to be required to put in place by July. That program not only requires the staffing to answer those calls, which we have on there, we're slating that for 6 operators who are trained in behavioral health, but apart from that, a team to respond. And that's where we need a team. Even on a scaled down service, we were going to start with a team of 9. So that's 15 staff just for that one 988 response. And then we talked about mobile crisis teams separate from that as well, which would also need to have much more staff. So because
excuse me, DCC, you said 21 for that. So we're now at least looking at an advancement of 36 staff members in addition to what we have. We're also speaking about increasing our nursing staff up at Eldridge Shelterben. So we're looking about at least 20 staff members, because we are going to incorporate not just inpatient care, but also daycare services at Eldridge Shelterben. So there's a vast amount of staffing needs within the behavioral health and alcohol and drug dependency division. So that staffing plan was submitted, and we can actually include these newer figures and resubmit that staffing plan so that you can see it.
3 minutes.
And then, so Commissioner, what is the biggest obstacle as it relates then to filling these positions, recruiting the staffing that you need?
I'm going to let DCC speak to that, since he's involved in a lot of these interviews.
Yeah, because if we're talking about providing services to our community that is in need, and staffing is the issue, then we have to get to the root of this.
Yes, we have the issue on both, and staffing the current vacancies is one issue, and what we're finding is we do have a lot of recent eligible candidates applying, and it's from the mainland. A lot of them are individuals who want to return home. Sometimes the salary is not competitive, so it doesn't make it enticing to make that transition. They talk about just not being able to make ends meet with what we're offering. However, a lot of the other positions we still have for local applicants, we still have the difficulty of them meeting the qualifications as what's required from the SAMHSA, which is the Substance Use Mental Health Administration guidelines of standard of care, and what will be services that will be reimbursable, because our goal is to make it more self-sufficient. So the services we're providing can then actually be billed for and create revenue for the department. So it's not just putting individuals in slots, it's putting them for qualified for the best of care and to still make it reimbursable for services we provide.
So then the obstacle is dual then. It's the lack of qualified candidates within the territory, that's what you're saying, and also competitive salaries?
Well, yes, that's what I've seen from our most recent rounds of trying to fill vacancies, correct.
Okay, Commissioner.
Senator, to carry on, I think that we can be honest in saying that the hiring process is not the easiest and it's sometimes slower. I think we can say that. But one of the things that I will say is we're involved in a business process improvement with 6 other entities within the government.
1 minute.
Personnel, OMB, finance, education, Department of Human Services, so that we can actually see what we're doing right, what we're not doing well. So we have to say that we need to improve our processes as well, and we're working on them currently.
So the process is also an issue, which shouldn't be, because if we're under a state of emergency, especially particular in this area, the processes shouldn't be an issue. And I heard you mentioning earlier that, filling these positions, it's a matter of urgency, and it's critical positions. And that's easy to state and say, but then when it comes down to implementation and getting it done, it's something different. We're constantly saying that we're in a state of emergency, but we're not moving as though we are in one. So what's the hold up and what's the hold up there? Because you have some of that power within your department to change policies and be able to implement some of these changes that are necessary.
I wouldn't disagree with that. I just, like I said, we right now are in the process of looking at our process flow and what we need to do differently. So I'm there with you. And we do need to do some things differently, and we're working on that.
All right. Well, I hope to see some improvements soon, Commissioner, because our community is suffering because of the lack of staffing. And if competitive salary is the issue, then let's talk about it and let's make the changes necessary so that we could be competitive and have the qualified people in the areas pertaining that we have the needs in. I'll leave my other questions for the second round. Thank you, Mr. Chair.
Thank you very much, Senator Carr.
Mr. Chair, if I may.
You may, Commissioner.
I would like to say that, yes, it is, I would say it's not twofold, but threefold. We are improving our processes internally, as well as assisting others to do so. It is competitive salaries that we're looking at, as well as qualified individuals within a territory. So all of those are obstacles, but I agree this is an emergency and they have to be overcome.
Very well. Thank you, Commissioner. Senator Joseph, you're recognized for your point of inquiry. Please recognize Senator Joseph's mic.
Thank you kindly. Thank you, Mr. Chairman, and a pleasant good day to testifiers, my colleagues, and the people of the Virgin Islands. My point in inquiry is just to follow up on the previous senator's inquiry, because I noted that you have several vacancies, but I wanted to go to asking you, what is your retention rate of your staff? Because that is critical. You indicated you've lost 2 staff members in the behavioral health, and that probably has impaired your ability to actually launch some of these vital programs. So how many staff members have left the Department of Health over the past, say, year? Do you have any numbers? Your Deputy Commissioner of Human Resources available that could tell us? Because that's part of the issue there. You have to be able to recruit staff and then retain staff. Thank you.
Well, let me first apologize for DC Jean-Baptiste. She was actually called upon for a legal issue, so she's unable to be with us this morning. She was on the call, but she had to drop. So I do apologize for that. Our turnover rate in the Department of Health is not as high as one may think. I think that our department is actually one that provides that support. We did lose 2 key individuals in the Division of Behavioral Health and Alcohol and Drug Dependency, of course, the Assistant Director, as well as one of the outreach workers. They just left one, actually the last day would be March 4th for the second one. So it hasn't impeded any of the implementation right now. However, we don't want it to. So we bumped that up to the top of the list, and we're trying to expedite to backfill those positions.
Thank you so much.
Thank you very much, Senator Joseph. At this point, the chair recognizes Senator Fred Gregory. You're recognized for your 7 minutes.
Thank you, Mr. Chair, and good morning again. A few questions, and I just want to thank the Commissioner and her team for providing a very comprehensive testimony, but I do have a number of questions around behavioral health, mental health, etc. in the territory. So I'm going to start with I note that you have about $6.8 million available in ARP funds, as well as another $6.5 million available in other funds to support mental health and behavioral health services in the territory. So that's an aggregate of about $13.3 million. And I need to understand of that $13.3 million, because you gave us breakdowns for some of them, but not all of them. But primarily my concern is, are all of those, I think you said some were not on the system yet. How many of those programs are not on the system? And I mean the financial management system.
Okay, I would have to go through.
Okay.
I have to say that I.
Okay, so
I
so you don't have that information. So let me ask then, of those that are not on the system, because I know it's always difficult if you don't have it in the system, then you can't do the necessary hiring. So it's lagging. So are there policy plans being put in place in the interim as you build your, I guess, the budget and getting these respective programs on the system? Because we're having a $13.3 million conversation now.
Okay, so there's a one grant that we have not spoken about today, just very minimally, and that is our disparities grant. That actually also offers some behavioral health.
No, that's not what I'm asking, Commissioner. Stay with me because my time is limited, of course. I'm asking, of those grants that are not on the system, you don't have to give me the aggregate amount. What I'm trying to establish is, are you behind the scenes working on the administration of those grants, how those grants will be administered, the needs of those, the required resources that's tied to those funds? That's what I'm trying to establish.
I was getting there with you in terms of program management, because we are hiring program managers in each grant so that they can do just what you're requesting.
Okay.
So the answer to that is yes.
Okay, so let's talk about program management, because I noted specifically, and I do have it highlighted here. So I'm going to ask that out of order, but it's out of the order of what I was going to ask. But I see that you have a particular grant where you're looking to recruit 4 key personnel that will effectively manage grant funds. What grant is that? And what's the amount of that grant?
That is the MCH grant. Dr. Myers can
What's
speak
the
to that.
total amount of that grant?
Good morning, everyone. Dr. Charmaine Myers. I'm the MCH director. The grant is $2.2 million.
Okay.
$2,225,000.
So we have a grant for $2.2 million, and we are hiring 4 individuals to manage the funds. You have other grant managers within the Department of Human Services, correct?
Within the Department of Health, yes, we do.
I'm sorry, Department of Health. So you do. So do we hire as we bring on new grant programs? Each grant program needs to have a grant manager to do the administration of the grant, because you said effectively manage grant funds.
3 minutes.
I'm a little
There's
about that.
the operational side. There's the operational side of the grant, and then there's the financial side of the grant. So each division or each grant funding now is affording us the ability to have a financial, even if we share it with another grant, to have that financial person.
Okay, Commissioner.
But also have somebody who's operationally managing.
Commissioner, I understand what you're saying, and I'm going somewhere with this. And perhaps you're already doing it, but it's not clear here. So if you have 5 or 6 grants, you should have an individual who's managing 5 or 6 grants, and you're having cost sharing. That's what's happening?
Correct.
Okay, that's not how this was presented, because it was very alarming to me that you have a $2.5 million grant, and you have 4 individuals that you are bringing on, I guess is the way it was worded, to effectively manage grant funds. Oh, you did say as well as carry out the expectations of the grant. Just seems like a lot of people, is an MCH grant. MCH is already in existence. It just seems to me that what we should be doing is, if it requires you to offer a stipend or whatever it is to the personnel that's already there, then you do that to allow them to move this along, as because we know that we are challenged with hiring personnel in the Virgin Islands. So we have to be realistic. I think we are at the place where we need to change our approach. So I'm going to move on from that. Now let's talk about the Eldra Shelter Grant annex. I see that we've talked about this. I think when I became a senator in 2019, I think the phase 1 had opened sometime in 2019. And we are just now talking about the bids for phase 2 in 2022. When did the funding become available for Eldra Shelter Grant?
We're using right now tobacco funding to begin that project because the FEMA funding still is not available. But because we didn't want to delay the project even more, we got permission to use those funds.
Okay, thank you. So that's because of the FEMA issue. And a lot of times basically what I'm saying, Commissioner, Mr. Chair, if you would allow me, we have to share the information because I am aware that these funds should have come online, and then it seems like you're not doing, it's such a lag. So I think it's important to share the information. If Mr. Chair, if you could allow me to wrap up, I want to ask you, you're familiar with Act 8152, right? So Act 8152 provided the sum of $3,082,000 to the Department of Health in the 33rd legislature. That's the funding around the MAP debacle for the 33rd historically. What's the status of those funds? Those funds were allocated to the Department of Health for mental health programs in the Virgin Islands. Have we spent any of those funds? And if we did, what's the status? What did we use the funds for?
Time.
You can answer on the chair's time.
DC Steele, can you answer to that?
Yes, those funds have been part of that was establishing the clubhouse services, staff in the clubhouse. Part of that included the vans that was mobilized, that was brought in to provide that. And there is still a balance there. And I believe, and it also allows us to extend out the clubhouse services and staffing through another 3 years is what it's earmarked for right now at this time. But we could get a balance.
Through the chair, I would like to see the balance. The sum of $90,000 was a separate allocation outside of the $3 million for the vans. So that's a separate allocation outside. So through the chair, I am requesting that we receive the update on the funding, the balance, and the use of those funds. Thank you, Mr. Chair.
Thank you very much, Senator Fred
Mr. Chair,
Gregory.
may I use your
Go ahead.
Mr. Chair, may I use your time to discuss something? I appreciate Senator Fred Gregory's conversation in regards to grant management, and I wanted to touch on that a little bit. We have two different aspects that we're doing. We spoke about the business process improvement that the Association of State and Territorial Health Officials is working as a result of the Office of Interior. They've provided funding so that now the GVI can go through a business process improvement. So like I said, there's 7 entities: PMP, OMB, personnel, finance, Human Services, Department of Justice, and 8 actually, and the Department of Health working together. Last week, we spent 4 days looking at how we're going to improve the processes for federal grant, inclusive of the hiring process. So that's being done. One of the other things that we're doing, we have a specific insular affair task force that we're working on. We have, last week, we were spoken to by the Assistant Secretary of Health and Human Services. And so they're helping us, providing information, changing the way grants are actually being given to the territory and how we're allowed to spend it. Traditionally, we've been giving a whole lot of money and said, run your grant, you can only hire one person. What we're seeing now is a change in how grants are being ran. So they're providing access for allowing us to hire individuals, which we did not have before. So we were failing with the grants because we didn't have anyone to run those grants appropriately, like project officers, project managers. Now you're seeing more individuals being provided the opportunity to be hired for that. So that's where we are right now. So this is a new way of looking at the grants, but we are here and we're willing to fulfill what the change process looks like. So I wanted to thank Senator Gregory for that question.
Very well. Thank you. Yeah, ready. We'll go with Senator Payne and then we'll come back to. Senator Payne, you're recognized. Welcome. Welcome to the committee meeting. You're recognized for your 7 minutes at this time.
Thank you very much. Thank you very much, Mr. Chair. Thank you very much. Good morning. Good afternoon. You understand? Afternoon. Good afternoon to the listening of your audience. Good afternoon, colleagues. Good afternoon to testifiers. Commissioner Encarnacion, before I begin my line of questioning, I just want, could you please explain to the listening of your audience, why is it that the Omicron strain of corona is less deadly than the Delta? However, we're experiencing more deaths in the territory. Can you explain that to the public, please?
Okay, I will have Dr. S. Ellis. I don't have Dr. Hunt on, even though she's available to jump on if needed. But I do have Dr. Esther Ellis who can speak to that more specifically.
Hi, good afternoon. So very simply, the reason why Omicron is causing more deaths than any other previous strain is because so many more people are getting infected. So the sheer volume of individuals getting infected, it is a lot less deadly, but because so many individuals are getting infected, we are having more deaths due to Omicron worldwide.
Okay, and also, if a person who is fully vaccinated does not take a booster shot, will their fully vaccinated status become invalid at any point?
The current definition of fully vaccinated still only includes 2 doses. However, that definition is subject to change, considering that the booster does protect you against severe disease so much more than just having the 2 doses. If you finished your series for Pfizer 5 months prior, you should be boosted, and for Moderna 2 months prior, you should be boosted.
Okay, thank you for that. Commissioner Encarnacion, you stated to one of my colleagues earlier that you have one psychiatrist who works at the Department of Health?
That wasn't a question, but yeah, if that's what you're asking, yes, we have one psychiatrist. We also have telehealth, and so DCC to let you know how many psychiatrists are involved in that as well.
Okay,
Yes, currently it is.
Go ahead.
Yes, our in-house psychiatrist currently is part-time, but we do contract with Insight and Island Therapy to fill the gap of psychiatric needs.
And how many persons are available?
We have a posting for a psychiatrist right now. We're looking to hire a psychiatrist, so that's been posted as well this week.
Oh, I didn't hear you clearly. How many psychiatrists are actually available?
Available, it would be, I would say 1.5 would be the FTE count.
Do we have a psychiatrist on island?
Yes, our part-time psychiatrist is on island.
Okay.
And the 2 other providers have psychiatrists in island, but they also use remote, yes.
Okay, so how many psychiatrists can we gain access to at any one given time?
Directly with the Department of Health, it would be 0.5. Our part-time psychiatrist is the one in-house, in-office.
And that person you feel is enough to service the entire population?
Absolutely not. And that's why we found funding and we posted right now. We're looking for a psychiatrist, and even 2 wouldn't be enough to truly cover the needs.
Okay, well, let me ask the commissioner this. Is there someone on your staff whose sole responsibility is to recruit possible staff to fill vacancies? Someone who goes out and holds job fairs at the university, on each island district, or even in the mainland?
3 minutes.
Because every time we have a commissioner who comes before us, and this happens through different hearings, there doesn't seem to be a sense of urgency when it comes to hiring, and there's no one person who's responsible for seeing to it that vacancies are filled. So we have hearings after hearings after hearings, and we hear the same, we're still looking, but no one, we haven't been able to fill the vacancy, but this is going on for some years now. So is there someone on your staff whose sole responsibility is to do that?
Not necessarily one person on the staff. We have 5 individuals working on our HR unit, attempted to hire 2 more at this point in time, but not one specific person focused on solely on recruiting.
do they go out to do job fairs? Do they travel to the mainland? Do they hold job fairs in the mainland? Hold job fairs in each island district? Do they recruit at UVI?
Yes, well, we coordinate with UVI's job fair, Division of Personnel job fair. Last year, we held a job fair on St. Croix, and then we held a job fair on St. Thomas. I think was the week after that. So yes, job fairs are occurring. We do have planned job fairs this year as well. So but that's locally. In terms of Senator Saros spoke about using areas like Indeed and how we can increase that. We do for specific or professional resumes requests so that we can expand that search as well. But like I said, DC Jean-Baptiste was called off for an emergency and was not able to be with us today. So I cannot give you specific as to every tagline that she uses for recruitment.
Okay. I'm going to ask you a few questions relative to St. John. How many persons are assigned specifically to address behavioral health issues on St. John?
I know that we rotate to St. John, but DC Seal, can you tell me how frequently they go over to St. John?
1 minute.
Yes, we have staff. The staff that currently rotates to St. John, she goes to St. John 2 to 3 times a week specifically to be at the clinic, and she makes appointments with all the enrolled patients, so they have contact with them regularly.
And how are the individuals who are homeless on St. John being serviced?
That's serviced when we have a joint operation where the outreach team plans together and go out and try to do outreach. We haven't done one there for quite some time, but that's part of the plan of bringing back on the outreach staff that we're looking for and being able to re-implement that.
Okay, and also, was my time call, sir? No, right? Okay, well, that's one last, let's just wrap up. St. John has a large population of homeless persons suffering from substance abuse as well as mental health issues who were sent to the Virgin Islands on a one-way ticket by their family members. How is the department tracking and or servicing that population? Thank you for the time,
we
Mr.
track down. Yeah, we have been finding that not only in St. John, we've been finding other islands lately where we have individuals we come in contact with to assess and they're not a resident of the island. We try to re-engage them with family members if they're able to give that information. Some refuse to, but we have to treat them and provide the same services as we do to any other homeless individual.
Yeah, but how do you go out in the community and track them and engage them? How is that done?
Yeah, when we do the outreach and we actually interact with homeless individuals, we just approach them. We let them know who we are. We try to find out more information if they're actually from the territory or not and what their needs are. And we also been working more closely with DHS. So we've been providing assessments. If it's specifically just housing related, we would link them with DHS or refer them for emergency housing, etc. But then we have them in a database on an encounter form. So now we know if we frequent this person again, this is the second time we've offered services and we have a record of that if they provide information. We have a lot of individuals who just flat out refuse to give information.
Okay, thank you very much for your responses. Thank you very much for the time, Mr. Chair.
Thank you very much, Senator Payne. DC Steele, can you expand on that? I mean, what does that mean in the true sense? What happens there?
Yeah, unfortunately, what's been happening is if you have an individual, we assess them and they don't have a history of behavioral health or substance abuse needs, for example. That individual identifies they just need a place to live. We would try to link them with human services. If we find from assessment that individual needs substance abuse services, we try to link them and offer them to be able to go in for treatment in a residential. However, we don't have a current detox facility in the territory either. So that individual can't just choose detox alone and then try to regain their independence. So we have a gap there again in services within the territory. If they're willing to accept behavioral services and they're not meeting the needs to be stabilized or admitted to the hospital, we right there and then offer them appointments, do the assessment, and link them with outpatient services. If they need to go to the hospital, then we try to arrange that with VIPD, etc. for those who at that time meet the criteria for admission.
Very well. Don't we have a detox center? Is the village another detox center? A structured detox center?
They're not providing medical detox to my knowledge. We've reached out a couple of times for individuals, but they're not doing medical detox. They do from our last interactions. It's just cold turkey detox kind of thing.
Yeah, we'll have to have a conversation with them again, because I think from my involvement with them, they do provide medical detox as well. So we'll have a conversation. I'll put you together with them so we can clarify the services that they provide. At this time, the point of inquiry, Senator Fred Gregory.
DC Steele, Mr. Steele, it seems to me like you are doing everything in your power to make a difference. But in your response, I continue to hear, we try to connect, we try. So it makes me beg the question, because I'm hearing that you are doing what you have to do. But it's important that the information is shared. And I know that, when you're part of a team, you want nobody on a bus, and we have all that going on. But we need to know what we can do to ensure that your job becomes easier, right? So we're trying to figure out, so where are the areas where you're experiencing difficulty to address the issues that we are trying to flesh out today? I mean, let's just keep it real. We want to have a real conversation with you so we can move the needle, because there is a level of frustration here. But in your responses, I'm definitely hearing that you're doing all that you could do. But we're hearing a lot of try and goal and try. But we're not hearing, this is what's happening. So could you help us to understand what your challenges are? Because clearly you're experiencing challenges and where they're occurring. Thank you, Mr. Chair.
Thank you, Senator Fred Gregory. DC Steele.
Yes, okay. There are several challenges. I mean, we identified some here in this format where clearly staffing is an issue to respond to every behavioral need within the community. That's first and foremost. However, we have a clear issue with, or a challenge in the community where housing is a major issue. We encounter a lot of individuals who simply need a roof over their head before they could even begin to address any of their other needs. So we run into that bottleneck. We also have individuals who have become so disconnected with family, etc., or family no longer in the area, so there's no support system in place. We try to link those with our outpatient services. They do come in for services. We treat them in that respect. We link them with case management. But now we have, because we've increased the wraparound services with our case management, now we have case managers carrying caseloads of 100+ patients. That's not efficient. So it points again to not having the services. And for sure, we know as far as the outreach, we do need an increase of outreach staff to be able to be consistently engaging with the community and reaching those who are hard to reach, because many times it takes 4, 5, 6 times a contact before the individual might accept some help.
Very well, thank you. Thank you for that. We do have real challenges. Commissioner, in respect to a recruiter, is that something, you have a large department, is that something that you have considered, having a recruiter on board?
Senator, thank you so much for saying that. I have to tell you that once the budget came online in late October, early November, one of the things that I said is that we need to right fit our HR division within the Department of Health, because if we don't do that, then we're not going to be able to help any other division. And so we've been able to successfully recruit, I think, 3 additional individuals in HR. We have one coming out of my office that's helping HR. So we need to make sure we solidify our HR department. And so we've acknowledged that we have an issue with our processes. And so we need to make sure we fix that. We have 2 more individuals we need to put into HR, and one can actually focus on the recruitment portion of it. And so that we can all turn over these requests real quickly and work with OMB and Department of Personnel to get these NOPA up and running. Of course, we have other opportunities. That is to outreach some of our hiring processes with the use of contracts like CDC foundations, which we have done, especially for COVID. But of course, then you lose some funding coming to the territory. So we try to weigh that. But if the need to expedite is there, we may have to continue utilizing outside resources to hire and then eventually put them on the GVI system. So there are other options as well.
So is that a yes in respect to a recruiter? You're looking to earmark and identify the person because they'll be able to handle the housing issue and all those other things that may present some challenges for the rest of the HR staff. So I'm thinking that a person that will be ultimately responsible for the logistical aspect of the responsibility of recruiting, as well as going out into the open market and the industry, will then focus on recruiting.
I know that Senator Fred Gregory is not going to like it when I say I will try, so I will not try. I will make sure that it happens and that we have a opportunity to that.
I ain't getting between the two, y'all. I ain't getting between the bark of the tree. All right, no problem. Senator Viola, you recognize for your point of inquiry.
Wise move, Mr. Chair, not to get in between those two individuals. I concur. In reference to, I know you said you did a job fair in St. Croix, a job fair in St. Thomas, and I know that recently we did a job fair in Atlanta. What were the specific results for each of those job fairs? How many individuals were hired as a result of it being held in St. Croix, St. Thomas, and Atlanta? Break it down for me.
I can't say for sure, and like I said, I really apologize. DC Jean-Baptiste is not on the call, but as a result of legal issues, she really could not stay with us. So I can get that information to you as soon as possible.
Okay. But to your knowledge, was anybody hired? Was the Atlanta job fair, the St. Croix, St. Thomas? I'm just trying to find out if that is a good avenue for us to be able to attract individuals.
Local job fairs, I know we had some individuals that we hired out of the job fairs, and we now have resumes that we could go back to. So I would say yes for that. The job fair in Atlanta, I spoke to several individuals who presented their resumes. I know we're bringing some individuals back home. I can't say that it was linked to that in particular activity, but it's linked to us going outside of the territory. So I would say that those kind of events are definitely something that we need to consistently perform and look for our own people to bring back home. Basically.
Okay, thank you so much, Mr. Chair. Should the recruiter be with them or with personnel? If we think about the overall picture with human services and all of that, just was something for us to ponder.
I think the recruiter should be disciplinary. It should be one for, because both of them have a large volume of employees. So if we're talking about recruiters, we should have one for DHS as well as one for DOH.
Is that discussion taking place, Commissioner? Are you having any of those discussions yourself or personnel in terms of recruiters?
Not necessarily, because right now our HR division does the recruiting, but I agree that if we focus on recruiting, then that person would, throughout the division, because it is an issue, and we wouldn't have to wait, because we want to make sure there is somebody from personnel into every interview, which is the EEOC issue. So if we have a recruiter, we'll make sure that they're there. We could pull someone else in if we need to. It's an excellent idea. I'm going to pursue it. Knowing that I was a former recruiter at the hospital, I could understand where everyone's coming from.
Okay, thank you.
Thank you very much. The chair would like to recognize the presence of Senator Genevieve Whitaker. Welcome to the hearing. Next, we'll be going to Senator Frances Heiliger for her 7 minutes, and then we'll come to we have Senator Gittens, Senator Joseph, and then Senator Whitaker. 11 strong today. You were able to bring out Commissioner of Health. So, Senator Heiliger, you recognize for your 7 minutes.
Good afternoon to my colleagues. Good afternoon to the people of the territory. Good afternoon to the testifiers. I wanted to ask some questions first and foremost in regards to dealing with the psychiatrist and lack thereof. Have the department looked into potentially having virtual psychiatrists participate? Because as you know, since COVID has come about, we have been able to utilize video in a way that has been able to help so many. Is this something that you guys have been able to look into, since you're not able to get people to actually physically do the job?
Currently, yes, we do. We also had a psychiatrist that worked with our elder shelter-run population. But as DC Steele has indicated, we do that in the clinic, and we also have contracts with 2 entities within the territory, one in St. Croix, one in St. Thomas, that also does telepsychiatry. DCC, anything that I missed?
That's correct, Commissioner.
So it's currently available, Senator.
Okay, thank you. I also wanted to, they touched earlier as it relates to vaccinated and the booster shot. What I would like to know that since those shots came out initially, it was for the original form of COVID. And as we have shifted over to the Delta version, now the Omicron version, and we're seeing that more people are becoming infected, whether vaccinated or unvaccinated. Is this herd immunity stance still part of the process? Because I'm trying to understand that if we're now at a stage where the narrative has changed, where initially it was as many people get vaccinated as possible, that we could then get herd immunity. But since it's been shifted to now get vaccinated because it assists you from not getting as ill as possible and potentially dying, does herd immunity still is it still an option, part of the equation?
Luckily, this afternoon, we have two individuals. I'll ask Dr. Tyhan Caesar, who is our expert in infectious diseases, to speak to it. And Dr. Ellis is also here. Dr. Hunt?
Good afternoon. I'm Tyhan Caesar, Medical Director for the Department of Health, Infectious Disease Specialist. Thank you very much for your question, Senator Heiliger. The answer regarding the herd immunity is going to be very tricky, in that the numbers from an epidemiological standpoint remain consistent, that herd immunity is possible when you have about 70 to 80% at least infected or immunized population within the territory. And we know that that is a significant challenge within our community. But I can also further complicate the question by stating that it's not something that we necessarily are battling locally. This is a global pandemic. Therefore, we will really have to hope that we vaccinate and immunize the entire country or nation or world, I should say, a global. It's a global goal. So if we don't have herd immunity around the entire world, what will happen is we will continue to have variants that are going to emerge.
So herd immunity is still a part of this equation, based on what you're saying.
3 minutes.
Okay.
Herd immunity is always a part of an equation for all pandemics.
Thank you. I wanted to touch a little bit on Charlottesville. I had an opportunity to head up there and really get a chance to see the second facility that has been shuttered for some time now. And in conversations and even listening to our governor, I think you guys spoke about putting out for bid, et cetera. And in really digging deep into that, I think I was told that it's an additional 35 units or individuals could go into the second building. Now, if this could be completed, what do you think the potential time frame between a bidding process and completing this project? Because clearly we need to have these additional services here in the territory.
So right now we're looking, it's hard to forecast because you don't know what you're gonna come up with, but we're forecasting March of 2023. DC Malloy, let me know if that was an incorrect, but that is the figure we're looking at.
Okay.
You are correct.
March of 2023, thank you. As an individual potentially dealing with family members that might have mental issues and speaking to constituents in our territory, so one of the things that they are dealing with is, what is the next step? A lot of times they reach out to government agencies for assistance because they don't know where to go. We listen to a lot of the talk shows, we listen to a lot of the conversations in the public, and people don't know exactly if something is happening to them or their family member, what is the first step that they can do in reaching out to the government? Can you share that with us?
The first step is to contact the Department of Health, Division of Behavioral Health and Alcohol and Drug Dependency.
1 minute.
DCC, do you have numbers right at hand so that we can let the general public know where they need to call?
Yes, the number for the St. Croix Behavioral Health Clinic is 340-718-1311, extension 3631. St. Thomas District, it's 340-774-9000, extension 2105. And St. John is 340-776-6400, extension 6002.
30 seconds.
The other question I wanted to ask, last night I had the opportunity to attend a town hall meeting down in Hull Bay where our residents really spoke up about their issues. And one of the topics that came up that they expressed, they spoke about the need for health insurance and health care and things that they need surrounding health. And what I want to know from this department, how serious do you believe as it relates to our population and lack of health insurance for as many people as possible impacts the wellness of our population overall? And do you see that even in the future that we could have some sort of universal health care for our population, which based on the last census is a little under 90,000?
That's interesting because we were having a discussion just last evening how we can actually utilize that. We're not saying that we're going to go into universal health care because that's a national conversation, but looking at how we can utilize the universal health care that's surrounding us in terms of our other Caribbean islands and how we can benefit from them, how they can benefit from us. And so looking at services, how we could think exponentially on how we access care, how we bring individuals to our territory to provide the care. Of course, lack of insurance is going to impact health no matter how you look at it. And overall physical health is impacted by behavioral health. Behavioral health impacts physiological health as well. It's a combination of both. Dr. Hunt, would you like to answer that from a medical standpoint? She may have been called off, but I think I've answered the question from a nursing standpoint.
Yes, you have, Commissioner. You answered it very adequately. Thank you.
Well, may I ask my final question?
I thought you just did, but you may proceed.
I
thought you just did, but go ahead. You may proceed.
No, I didn't. That's why I'm asking, Mr.
You may
Chair.
proceed.
Appreciate it. I wanted to speak a little bit or ask a question in regards to the connection between the health department and the court system. I had an experience where one of my properties was robbed and the individual was taken to court and locked up for a very short time period and then released. Unfortunately, they were released because they have mental issues. Shortly thereafter, I happened to be out in public and he walks up to my car and asks, can you pay me to wash the windshield? And I'm looking at this individual like, I had no idea you came out. And I got to the point where I was feeling sorry for them when I was the victim because I couldn't understand how this individual has mental issues, clearly is in need of help, but had to be released because they cannot be catered to in our prison system. Now, how does the health department tie in with the court system in potentially dealing with people that have ailments such as this, where the courts can assist them, but they're still allowed to just be put back out on the streets?
We had that discussion a little earlier, so I'm glad you brought it back up so we could read it for the general public who's just tuning in. But there is a system that DC Seal can speak about. Senator Francis is going to also help with that. But DC Seal, can you please go ahead with the courts and how we can work on that behavioral health court?
Yes. Good afternoon. Well, currently, just to answer a specific situation like you're mentioning, there are individuals who are picked up found to have behavioral issues, and they're not even referred over to the Department of Health for behavioral services. Then there's others who we get the request for an evaluation. The evaluation is completed and submitted. The judge determines whether, based on the evaluation, this person needs long-term care or they feel that this person is not a danger to self or others, and they're then released. There's also individuals at BOC who may have that evaluation done in-house with their psychiatrist there at this site, and we're not involved in that process. But overall, we would like to have a mental health court system. So once that individual is identified with such needs, it's expedited through a process where everyone involved in that court has the knowledge and training as well and understanding. So you have an in-house forensic case manager, you have an in-house psychiatrist ready to do evaluations, you have a team that's focused and able to manage those caseloads specifically of those individuals who have behavioral needs who are caught up in the system.
Thank you so much. Appreciate the additional time, Mr. Chair.
Thank you very much, Senator Heidegger. Very important questions. Senator Payne, you recognized for your point of inquiry.
Thank you, Mr. Chair. Mr. Steele. Mr. Steele, you there?
Yes, I'm here.
In regard to the services that you guys provide when you're doing community outreach, if your team comes across a person who is an obvious alcoholic, from their knees to their ankles are swollen like balloons, their feet are like pitch black like asphalt, what type of services does that person receive? To include, is that person sent to an alcohol substance treatment program? Let the public know what type of services will that person actually receive. Thank you for the time, Mr. Chair.
If that individual upon assessment is in danger of their health or danger to self or others, we do what's called a 722 to initiate the process for them to be taken in for an evaluation at the local hospitals. If that evaluation done by the psychiatrist deemed that they're going to be kept for stabilization at a hospital, that process takes place. Usually that's a 72-hour window. If the psychiatrist initiate the next step of a 723, it goes back to DOJ to have a hearing to specifically say this person needs to be involuntarily committed, and then we start the process looking at off-island care because we don't have those beds in the territory.
Thank you, Senator Payne. Thank you, DC Steele, for your response there. At this time, the chair will recognize Senator Gittins. You're recognized for your 7 minutes.
Good afternoon. Thank you, Mr. Chair, and good afternoon to all. First off, let me commend the department on the work that you're doing with COVID-19. Also, I do check to see if agencies and departments are taking advantage of the Department of Interior's grant offered to the territory, and I see where the Department of Health is a good client of theirs. So I commend you on that as well. But I'd like to see the department and even the Department of Human Services well apply for grant funding behavioral health. Although the grant minimal, I pick up some $500,000 to help. I've heard questions and responses regarding the vacancies and hiring.
Senator.
Where are you on the permanent hires of getting a Commissioner? Where are you on the permanent hires of health inspectors and enforcement officers?
Okay. If you can hear me, Senator, we didn't hear everything that you said, but I think that you mentioned one, trying to ensure that we get some Office of Interior grant funding for behavioral health, and we will look into that. So just to respond to your first part of your statement. Second of all, I did sign some PRs. They came back approved from OMB. So we are well into the hiring process for environmental health officers. I do not have Director Harris on the line to let us know exactly where we are in the officers portion of it. So he would have to answer. I could get that answer from him prior to the end of this. and get back to you. But I know that we definitely are recruiting for our officers, our environmental officers. But the enforcement team is what you're
So
asking for.
you signed PRFs for enforcement officers. What about health inspectors?
Health inspectors, I think it's 5 health inspectors that are going to be hired within the next couple of months. All of those PRF came back approved by OMB. Recently.
Okay, I've been asking about this for a couple of months now, and we're still into a couple of months again. How soon do you think that you'll be able to get those positions in?
Well, we're eager to get them in because it's something that we needed for COVID. We need now, and we have over 6,000 businesses that we have to keep a record of. So we need them ASAP. So I would say.
I guess what I'm trying to ask is what's the holdup? I know that some of the inspectors you have are on a temporary basis. Are any of these individuals in the pipeline for permanent hire?
Of course. Yes, sir.
Thank you. Would the enforcement officers within the Department of Health, will they be trained to assist with the mental patient?
3 minutes.
Yes, we have now trainer availability, and all our enforcement officers and security guards will be trained under CPI, and DCC is one of those trainers. So we have someone readily available. There are 8 other individuals within the territory that have been trained to train.
And this is specifically to deal with mental patients, correct?
Correct.
Okay. How are you on payments to vendors? Are you current?
I don't have CFO Hewitt on the line with me, but payments to vendors, I know that there are probably some outstanding payments. So I don't want to go on the record and say we're completely all caught up. I know that I get calls ever so often and always respond accordingly. I can send you an update on the outstanding vendor payments.
I'll appreciate that. And can you utilize any of the ARPA funding for vendor payment?
It depends on what the services that is being provided. If they're related to COVID funding, on care, yes, of course we can.
Okay, I'll await the document on the vendor payment.
Right, and if
while there is a brag or a boast about all these federal monies coming into the VA government coffers since the 2017 hurricanes and now with the pandemic, what's the status of Charles Howard Hospital facility and the Nude Hansen complex? These structures are like older than many of us. Our parents have worked in there. We have worked in there, and the facilities are still there, standing. However, not conducive in a lot of areas for workers or clientele. What's the status on any plans to renovate or outright build a new facility in both districts?
30 seconds.
It's very happy to report that we're well underway with our architectural and engineering firm, FLAD, for the rebuild, the complete demolishing and rebuilding of Charles Howard Memorial Complex. And so that's well underway. We've been meeting with FLAD for the last 4 months, I think. And when you drive by, you'll see that our signs are up, letting everyone know that we're well underway there. DC Malloy, would you be able to give a very brief overview of the Charles Howard project and what we're doing also in St. Thomas?
Time.
Yes, Commissioner. Good afternoon, everyone. As Commissioner indicated, we have secured the services of FLAD Architectural Engineering Firm, and they have engaged in the visioning session and gathering our requirements for a facility that would last 100 years or more. We are in the process now of finalizing the space requirements. We've had all of the Department of Health has pretty much been involved in the process. We've had many meetings. We have weekly project meetings with FLAD. We've had many visioning session meetings with FLAD and DOH. And this is being done in the collaboration with Department of Public Works, Tawana Nichols, Chief Engineer Tawana Nichols attends all our meetings. We have made several payments recently made payments to FLAD as a result of the work they have accomplished. We anticipate being able to have some rendering sometime this summer, and we also anticipate having in the near future, very near future, town hall meetings so that we can further inform the public on what we're doing to demolish and rebuild Charles Howard. I too was born in Charles Howard, as well as many of us. As far as Newt Hansen is concerned, Newt Hansen.
So all that said, what's the timeline? Do we have any timelines on this project?
Yes. Let me get the timelines. Hold on one second.
I believe the time was called, so I don't want to abuse the time. When you have those timeline, if you could share it with the committee. And Mr. Chair, you just permit me to make one statement or ask one question.
You may proceed, Senator.
I wanted to say that besides the COVID-19 public service announcements, I wanted to know what community outreach or public service announcements are active with regards to public health.
Well, first of all, we did put a press release out last week, and Dr. Ellis and Dr. Hunt in particular can speak with Legionnaire's disease and what we're doing with that. Chronic disease, we're always out there because, of course, not just with COVID, but chronic disease is on a rise in the territory. So we're also speaking about that. We also speak about COVID and preventative measures, and smoking and preventative measures, diabetes and preventative measures. Every day we have different, basically all day long, you'll hear media broadcasts of what we're doing territory-wide from an overall public health and preventative aspect. So we're always on the news.
Okay, thank you. And just to repeat, you said you didn't hear me at first, but I first commended the department for the work that you all are doing with regards to COVID-19, and I stated that I do check in with the Department of Interior grant program to see how many of our departments and agencies are taking advantage of these funding, and I see where your department specifically is one of the good clients. So again, keep up that good work, and thank you much for all that you do. Thank you, Mr. Chair.
Thank you very much, Senator Gittins. I also commit to being able to brief my committee members, as I was a member of the working group in regards to the FLAD discussion in respect to the rebuild of the Charles Howard Hospital and some of the work that's being done there and the demolition timeline that have been established for that purpose. I'll share some of that information with the committee members as well, so we could get a better understanding of what's being done to the Charles Howard facilities and the Newt Hansen facility as well.
And Senator, if I may, this is time for us to now think of when we can bring you back and the hospitals back in so that you can look at what we've done thus far, getting closer to the visionary, the outlay of what is actually going to look like so that we can get your final inputs in that. So look out for another invitation.
Very well. Thank you. At this time, the chair would recognize Senator Joseph. You're recognized for your 7 minutes. 7. En punto.
Gracias, Senador Francis. Buenos tardes. Buenos tardes, and good afternoon to everyone, and thank you so much, and the listening audience. I do have some questions to ask you, Commissioner Encarnacion, but prior to doing that, I wanted to first commend you and your team for the wonderful job you're doing relative to the pandemic and all of the outreach plans that you have in place. And also thank you for putting together this very comprehensive presentation and your report to us. I just hope that it was a bit earlier, but I know you're very busy, so we'll try to work and not try, but let's get the reports in a little earlier, the testimonies a little earlier. But I'll jump right in because I'm a really fast reader. I wanted to start first on page 3 of your report, on your testimony specifically. You indicated that you had 39 patients at off-island residential facilities. I wanted to ask you, kindly indicate for us the cost monthly, just go monthly if you have that available. The cost monthly for each patient that we have in off-island facilities. And these are patients that are receiving behavioral health care services off island because we don't have the services available here on island.
DC Steele, you have that?
We don't have it broken down by patient, but the average is about $580,000 monthly for those patients to receive off-island.
500.
And 81,477 monthly.
580. Okay. Just say it out. I'm not getting it clear on this end. Just read out the numbers. Read the number, the average number.
Okay, 581,477.
Okay, and this is on a monthly basis for each patient. That's the average. Okay.
Total for all patients.
Oh, total for all patients, all of the 39. Okay, now I understand. Total. Okay, now let's move forward with some of your other testimonies that you have. You mentioned on page 4 at the top, you have expanded your behavioral health telehealth services for your patients. How many patients are you currently serving since you've expanded this service? How much you were serving initially, and now how much you are serving?
I don't have the number we served prior in front of me, but we're serving 452 individuals between.
How many? Mr. Chairman?
452.
Yes.
452.
452 persons you're sharing, you're serving, territorially?
Between both districts, yes.
Okay, and you don't have a breakdown available?
Not prior to that, but I can get that to you.
Okay, please send it to the chair. Now, I also want to go down further on this same page and ask you about your behavioral team
3
facilities.
minutes.
This will be, how much?
3 minutes.
This will be item number 17, line 17. You said you had 19 staff members within DOH, and only 10 of them are now CPI who are trained between DOH and VIPD, and only 10 of them are trained. do you have hopes, Commissioner, of trading the remaining amount?
Let me clarify that. Let me clarify that for you. 19 individuals got trained in CPI and got that certificate, but the 9 additional members became certified trainers to then be able to provide it throughout the territory.
Okay, so it was nine on top of the 19. Is that what you're saying?
No, 9 of 19 became certified trainers.
Okay, and so the other 10 are not going to become certified trainers.
No,
but they are trained to provide the service and that model.
Okay,
yes.
understood.
So now they can react. So if they see an incident in front of them, they would better be able to de-escalate that situation in a very manner in which they need to.
Okay.
That does not threaten
Okay.
the situation.
All right, that's great. Thank you so much. I have another follow-up question, and it's relative to your advertisement and recruitment efforts. Do you recruit and advertise your vacant positions internally?
Yes, we do.
And where are those? I'm sorry?
We use 2 platforms. We use our website and we use Yammer. So that's something that is also a part of our Outlook platform. So those 2 areas we look at. Of course, we post on different buildings as well.
Okay, so you do some internal, and you have persons who you have promoted internally because they have demonstrated an interest in those positions. So you
1
do.
minute.
Okay. My final question, so I want to be on time, is on page 9. I know line 14, you have the state-based nursing home and long-term care strike teams. What is that about? I know you're saying you're waiting. This is in the process of getting online. But what are you doing with this program? What is your intent? What is the work plan
30
for
seconds.
this program? And you may answer on the chairman's time, because I want to be very, very respectful of the chairman, as I am not a member of this committee. Thank you so much.
Chairman, can I ask Dr. Ellis to respond to that, being that she is managing that grant?
Yes, Commissioner. Dr. Ellis?
Hi, good afternoon. Esther Ellis, territorial epidemiologist, Department of Health. The total for that funding, the state-based nursing home and long-term strike team, is $31,987. So it is a small grant. It recently was awarded, but the budget has not been approved yet. So we're working on the budget to submit to CDC to be approved. And just one point of clarification: when the funding for this was given, it's given to each state and territory without any kind of budget or work plan, and then each state and territory has to submit the budget and work plan back to CDC for approval, and then we can get it online. But the objectives that you asked for are to assist recipients with supporting long-term care facilities during the response to SARS-CoV-2 infections, and also to build and maintain the infection prevention infrastructure necessary to support resident, visitor, and facility healthcare personnel safety. And we had one activity on this funding is to train, it's training and regular procurement of testing supplies, outbreak investigation, and contact tracing.
And also, Senator, if you remember, we had several outbreaks. One indeed was the nursing home in St. Thomas, Queen Louise, and we participated strongly in mitigating transmission, teaching education in reference to infection control practices, supplying PPEs. That enhances that program. Anything that we need to do in that light, this $30,000 would be able to assist us.
Thank you very much for that. Before we go to the next senator, which is Senator Whitaker, for her round of questioning, Commissioner, I wanted to ask you, in the upper funding, I saw where there is an earmark specifically for $1 million to go towards behavioral health. I think that that's grossly inadequate, especially when we talk about the Honors Hope build out. I am in full support of utilizing that funding for the A&E, and to provide that at least the design. But outside of that, I believe if we're not talking in the neighborhood of $15-20 million to go towards behavioral health and to look at infrastructure, staffing, and upkeep, maintenance, and everything else, then we're grossly inadequate in terms of the numbers that we're presenting. So can you speak to the $1 million earmark that has been slated in the ARPA for behavioral health?
To support services, that $1 million that you said, I agree, is not going to go very far, but we can see how we can implement advanced care. I have to tell you that my hand was way up when I heard the possibility of utilizing ARPA funding to increase the structure on that plaque that we have. However, Director O'Neill and I have spoken, and they're very stringent guidelines, and infrastructure is not one of the supporting guidelines for utilization of that fund. Just to let you know, that was a discussion that was had. And so the $1 million in terms of what we use for that would increase the services that we have right now. If we need to increase what's going on right now with our 2 private companies that's working with us, those are some of the things that we're doing. We can look at staffing, because staffing is one of those things that we can do. So DC Steele and I will work on how we can best utilize those funding. But it can be for infrastructure.
Very well. I'd like to be a part of that discussion as well, because I think it's important that we continue to be able to collaborate on this particular issue as it pertains to behavioral health. Certainly the Committee of Health, Hospital, and Human Services have a vested interest to be a part of this in respect to moving the needle. So I don't want it to just be a silo discussion, but more so that it's real inclusive and comprehensive, as you do with other projects as well. At this time, Senator Whitaker, you're recognized for your 7 minutes.
Thank you, Chairman. Good afternoon to you. Good afternoon, colleagues, legislature, good afternoon, testifiers. Just want to zone in. Of course, a lot has been covered already. Really highlight what has been dedicated, shared. Commissioner, really right now on 1.5, correct? Because in the submission of under mental health services which is on page 6 for by way of reference of the American Rescue Plan, I just want to be clear that of course those plans are updated. We're still dealing with approximately $1 million for community-based mental health and $500,000 for substance abuse. Am I correct with those numbers?
That's the same conversation that we were talking about, the $1 million for the American Rescue Plan. I have to tell you that I did not hear everything that you were saying. For some reason, coming out of the legislature in St. Croix, I think that there's a feedback, so I'm not hearing everything, and I do apologize. But you're asking about the $1 million from the ARPA funding?
Yes, and I've also indicated that you have $500,000 allocated for substance abuse, because we know mental health and substance abuse coincide, correct?
They don't coincide. They work together. Sometimes there's a correlation. Sometimes there's not. So you do at point. But whatever funding that we have, alcohol and drug dependency is something that we also focus on. So we'll be working towards utilizing those funds. And like Senator Francis said, we will be getting together to ensure that he is also aware and provide feedback on how those funds are being spent.
I want to now zone in on the staff. We spoke a lot about staffing, and one of the concerns brought to me, which I witnessed firsthand, is at Charles Harwood. The staff is complaining of mold, which I have firsthand knowledge of, actually, experienced myself. As we look at, of course, funds can be used for different reasons. How are you working on addressing the mold issue at the Charles Harwood for the modulars, not the main hospital, but the modulars? the mold issue?
Okay, I'll have DC Malloy speak to that, but I have to tell you that we are affected by the mold issues at the modulars. However, it's actually improving. We brought in a new company that was able to really air out the vents. So now we have a system of cleaning the vents on a consistent basis. And the environment is a lot cleaner. I feel it as I was affected with it as well. We're also working with FEMA to see whether or not we are eligible to shift from the modulars elsewhere. We have to provide validation of certain items, but DC Malloy, can you speak to that as well? Because it is a condition that is concerning to all of us.
Commissioner, you covered it. We're taking several tracks. One is to do cleaning as frequently as periodically and even more frequently if needed. The last cleaning included fumigation and seemed to have.
Wait. I'm gonna stop you there though. DC, I'm gonna stop you right there. Not if needed. Not if needed. I myself, I don't want to dedicate all the time to that. But
3
it's
minutes.
not if needed. The space there for staff goes into work, even for you all as you go into the office, affect everyone. It's not if needed. There needs to be an overhaul. I'm very concerned of what I witnessed first. It's not something that I'm just getting directly and hearing their concerns. So what I would like to receive through the is the information about the cleaning, the information about what the process. But just that if needed, it's not an if needed. It has to be done. These are the health and safety of the people who work, your colleagues.
We take that very seriously. Like I said, Senator,
just for clarification.
if I may, just 1 second, DC Malloy, Senator Whitaker, we take it very seriously because when you say the staff, we are also included in the staff that's being affected. So we are all being affected by it, and so we take it very seriously. So the cleaning was conducted about 3 to 4 times in each building as that complaint has come to us, and so. We continue to clean. We're also bumping it up. What can we do differently? So we're underway. Right now, I have to say that one of the buildings that was highly affected was the MCH building. The nurses, the staff was complaining. They have also told me that once that last cleaning took place, they have become more comfortable, but it doesn't mean that we have given up on looking at alternatives to what we need to do, because health and safety is priority to each and every one of us.
Thank you for that, Commissioner. And I would like to see it in writing from me. And I want to see that also in writing. So I appreciate that. And on their behalf, and even everyone who's affected, I want to drive home in terms of when we speak about behavioral assistance. There's the grassroots. There are nonprofits and other providers. How can you explain the procurement process by which anyone can apply for any of the funding that will be used to help address and basically provide program and services for those who are suffering
1 minute.
from mental health, those who are dealing with mental health.
A lot of the funding that's being provided right now is linked to COVID. And what we do, and Dr. Ellis can speak to this as well, whenever a positive case is identified, that person is referred to behavioral health counseling. So this is as easy as that. However, DC Steele just called out the numbers for our clinic areas. So if there's any concern, to call those numbers, we should be able to get back to you. We will get back to you and provide that service that's needed. DC Steele, can you call those numbers one more time so the general public can know how they can? And then we can also call out the epidemiology hotline numbers, because those are the 4 numbers that needs to be readily available.
Okay. In St. Croix District is 340-718-1311, extension 3631. St. Thomas District 340-774-9000, extension 2105. St. John 340-776-6400, extension 6002.
Time.
Thank you. And I also
epidemiology hotline. apologies, the epidemiology hotline numbers as well are 340-712-6299 or 340-776-1519.
Thank you for that. And Commissioner Encarnacion, in speaking about numbers and calls, I know one of the challenges is the availability of staff after hours. If you don't call for a certain time, and a lot of different divisions have limited times. How are you shoring up as we address public health with really a 24/7 type service where persons have a dedicated number to call after hours on the weekends? And so how are you shoring up staffing in that area, like temporary staff to really address basically people have to call different questions they have around testing and things of that?
So, one, we're working on a suicide hotline, and DC Steele spoke about that. The deadline is July of 2022. So we're working on get that completed. We already have 24/7 care in reference to our EMS division that occurs as our first responders. That's always there. In reference to after-hour care, we're looking at, we have and I really can't remember, and forgive me, I will get all of the hotlines that we have available to you so that you can know and advertise it to the public as well. Of course, we have our EPI hotline that is an extension of our day. So it is available from 10 a.m. to Dr. Ellis. Don't let me guess, just let us know exactly when those hours are.
Right. The EPI hotline is open 8 a.m. to 10 p.m., 7 days a week.
And if you're speaking about any other preventive,
was my time called?
If you
Yeah, it was called 3 minutes ago. You may conclude, Senator Whitaker.
Thank you. Well, we had a bit of a
No problem.
beginning.
That's why I gave you the additional time, but you may
Chairman.
conclude.
I will conclude. But in conclusion, what I would like to really conclude with is, for one, number one, I want to thank you. As you know, I came hard with the mold issue. Curious about that, but I do commend senior staff. I know you all do amazing work, but I also know environment has. The final question I have really is surrounding just continued community effort. What is, especially around the working with the Department of Education on the school test. A lot of concerns have come by way of parents, others just dealing with COVID testing for students. Right now, of course, the free testing is from 1 to 3 p.m. Monday through Friday. Would there be a consideration for the children who have to get tested, both by the Department of Education and coordination with the Department of Health? Would there be a consideration of some special hours for preschoolers, children catered to preschool?
Dr. Ellis, you want to take that question?
Yeah, that's a really good question. We actually have daily testing at the Department of Health. Now it's 9 a.m. to 12:30 p.m. That's free. For the school testing, school nurses have been trained to do testing on site. So if a student is at school sick, they can actually get tested at school immediately. So the school can know if that individual is positive, who all might have come into contact as quickly as possible. The goal is to get the test accessible and quick and accurate so that we can also quickly control a potential positive, isolate, quarantine those that could be close contacts. We are also working with VID to set up surveillance testing in the schools, where we'll be testing about 10 to 15% of all public schools as a subsample. And that's for surveillance purposes, to see kind of to guide what could actually be happening on a bigger level within the schools. And a big thank you to our partners. We've been working with 5 private providers that have made all of this possible in collaboration with Department of Health.
Thank you. Thank you very much, Dr. Ellis. Thank you very much, Senator Whitaker. That concludes the first round of questions today. What we'll do is take a 5 minutes recess, and then when we come back, I'll allow for a 2 minutes rapid fire. If there's any burning issues that anyone may have, I'll allow you to ask your questions within the 2 minutes. The Committee of Health, Hospital, and Human Services of February 9th, 2022 stands in recess for 5 minutes. of Health, Hospital, and Human Services is out of a recess at this time. Before we go to the next senator for his 2-minute round, I wanted to ask DC Malloy, you wanted the record, you were trying to respond earlier to Senator Whitaker. At this time, you could go ahead and put your response on the record.
Thank you, Senator Francis. To complete the thought, what I said was, what I was about to say was, we schedule periodic cleaning and more frequently if needed. So that was the complete statement. But Commissioner Encarnacion articulated the sensitivity, the level of sensitivity and urgency we have in addressing the mole issue. We acknowledge it. Our housekeeping staff on a daily basis do targeted cleaning whenever instances of specific mole growth appears. We also, and we're also going to plan to do those periodic cleaning. We've done several cleanings in the past. This cleaning seemed to be more comprehensive and successful, as Commissioner indicated. So we're going to continue that, what works. So we're going to do periodic cleaning and more frequently if we need to do it more frequently, but we will adjust to the situation. So thank you, Senator Francis. Also, on the scheduling for Charles Howard, if I may, I can answer now, but I can wait. Depends on your guidance.
You talking about a timeline for the Charles Howard demolition?
Yes, sir.
Yeah, you may proceed.
Okay. So we've developed a schedule for this phase of the project, which is the architectural engineering design phase. Indicated we did the visioning session, of which you were a part of, conceptual pre-design bid. Then we're going to move to the federal consistency review and approval process, which is lengthier than had originally been projected. In parallel, we do a demolition plan and permitting and procurement. We expect a 30% design by end of May, rather, 60% by end of July, 90% by the end of September, with phase 4 completing the 100% design. We're allotting 4 months for permitting and procurement. So that brings us to March 2023. In our reporting of our critical priority projects, we have final completion of November 2025. However, FLAD is right now, based on all the information that we've collected to this point, refining that schedule, and so that date may change. But right now, it's November 2025. Thank you, sir.
Thank you, Deputy Commissioner Molloy. At this time, the chair will recognize Senator Viale for his 2 minutes. Senator Viale.
Yes, and thank you, Mr. Chair. And just some quick questions. Is going to be rebuilt at the same spot? Mr. Molloy? Charles Howard, you're going to demolish and rebuild at the same spot?
Yes, sir.
And the area in front of the modular units that's being cleared now, what are you building there, a parking lot?
Yeah, that's a temporary parking lot for the modulars.
Okay. We had mass testing of students before the start of, or the resumption of the school year this year, mass testing of students and mass testing of faculty and staff. What is it, that was a one-time event, or is there a plan moving forward that every 2 weeks, 3 weeks is going to be testing within the schools? What is that plan?
A certain percentage of the students, faculty will be tested. Dr. Ellis spoke about, we have engaged with 5 local companies that will assist us with the testing. The nurses have already been trained to test as well. But what percentage, Dr. Ellis, are we testing, and when do we begin those retesting?
And the local companies are going to the school, or is this a next thing? Will be done again on weekends?
No, we will go to them.
Okay.
What the days that it's going to be done, I don't think that's finalized, but we are going to go to them so that they do not have to come to us. That I know for sure.
30
Dr. Ellis?
seconds.
Correct. So the plan is to test 10 to 15% of students every month for surveillance purposes. We also test any student who's sick immediately. The schools have test kits on site and have been trained in how to do the testing as well as how to submit the results. So far this year, since schools have been open, almost 300 tests have been done in school on site. And as Commissioner Encarnacion stated in her testimony, we tested almost 10,000 students immediately prior to school opening and about 2,000 staff and found 127 positives. And the plans are to do the testing that's happening, the surveillance testing that's happening once a month for 10 to 15% of students will be done at various schools.
Time.
Yeah, last question, Mr. Chair. In reference to outreach, I know we just, $1.9 million was just allocated for diabetes outreach. How did that process take place in reference to how much money for a particular area, a private or a newly formed nonprofit? How did that look? Did that go through Department of Health? Because I know we have a lot of different areas, cancer awareness, blood pressure, etc. How did that come about? And I know that Frederick Health Center also do diabetes outreach. How did we end up with a new company and the amount and the particular category that we're looking at?
Well, I think that it's not necessarily, it's a part of the company that's growing, let's put it this way, into a nonprofit, but that company also speaks to chronic disease from years to come from my knowing of. But I have to tell you that Department of Health was involved in a conversation from the beginning. We interviewed, we spoke with them, and we had a presentation, Dr. Janice Valdman, who's over the prevention, health promotion, disease prevention division also came with me. And so we sat and spoke with them. So conversations did take place, and we agreed that that's something that diabetes is a precursor to cardiac disease as well as renal dialysis. And so that's really one of the major factors I think we need to deal with.
Were there conversations with any other nonprofit?
Any other nonprofits at that point in time? The only other nonprofits that we were speaking with or did have conversations regarding funding was another nonprofit that works with renal disease and dialysis.
Okay, thank you.
My pleasure, sir.
Thank you very much, Senator Viale. At this time, Senator Blyden, you're recognized for your 2 minutes.
Thank you, Mr. Chair. Commissioner Encarnacion, I know earlier in a testimony you spoke to the projected increase in the need for behavioral health services as a result of the pandemic. So have an analysis been done in respect to the numbers? What are they telling us? Have we looked into that?
Well, we spoke with Dr. Ellis. There is a possibility for us to begin a CASPER survey that we conduct, much like what we conducted right after the storms. However, our breakfast program begins their survey for behavioral health in February. So it goes from February to July. So after that, we would be able to give you more of an information of the impact of behavioral health within our community based on COVID. So that's actually starting this month.
Okay, great. And also, when it comes to the extension, the grant extension, how were the contractors selected and what is their rate of pay under the contract? You're muted. Your mic is muted. Your mic is muted.
Thank you, sir. In reference to the COVID testing, is that what you're speaking about?
Yes.
First, what we did is we reached out to the community to see it was an emergency. So first of all, I got a permission from Department of Property Procurement to proceed since we had a state of emergency. Omicron surge was definitely increasing, so we reached out to our normal partners and they were willing to test. We got them engaged within a week. They were engaged and they were testing, so they helped us test close to 12,000 individuals, so it was an emergency. And so that was approved through the procurement process. And we reached out to who help us right now. All of the ones that help us with who we worked with.
Very well. Thank you so much, Mr. Chair, for the time. Thank you for your responses.
Thank you, sir.
Thank you very much, Senator Blyden. Senator Soro, you're recognized for your 2 minutes.
Thank you, Mr. Chair. Who's over the communicable diseases division?
Director Jason Henry, and he's on the line.
Good. So when we had a meeting recently with Cigna, Cigna identified, I think this was, I want to say September, they identified, and he's a perfect person to answer me actually. They identified the top 5 illnesses plaguing the territory, and HIV/AIDS was between 3 and 4. And then you have grant funding here. It says the division will be providing training for all team members. And there's STDs and other communicable diseases, and funds will be used to purchase resources and supplies for rapid diagnosis and intervention of STDs in the territory. PrEP and PEP pills, is that included?
Sure. Good afternoon. Jason Henry, Director for Communicable Disease, and thank you for the opportunity. Some funding, most of the funding that we receive from our federal partners do not allow us to purchase PrEP and PEP. However, we are looking at ways in which we could actually work with our federal partners to address this, because PrEP and PEP is a very important strategy. One of the key terms that you're hearing from our...
Hold a second. For the public's consumption, can you tell them, I know what PrEP and PEP are, but can you tell them what PrEP and PEP is? And then you can proceed.
Sure, definitely. PEP, post-exposure prophylaxis, PrEP, pre-exposure prophylaxis. What that is medication that is for that is medication provided to individuals who have possibly been exposed to HIV to help them to reduce the risk of actually acquiring the disease. For PrEP, that's pre-exposure. What we do is that we provide that for individuals who are maybe engaged in sexual activities to prevent them from actually acquiring it from another individual who may be infected with HIV already. And that is a key component. I'm sorry? That is a key component of our...
Mr. Chair, is he allowed to finish his response? Yes, go ahead.
Sure, thank you. That is our key component of our strategy of 340, getting to zero, as we're working to end the epidemic by 2030 of ending the HIV epidemic in the territory. And so definitely, that is something that we're looking closely at. Even our federal partners are lobbying with Congress, because federal fund doesn't allow us to purchase medications for PrEP and PEP. But however, there's a national campaign, Let's End the Epidemic. But for us to end the epidemic, we have to have the resources, such as medications for PrEP and PEP, to do that. So that's something that we are looking at, and we definitely would like to start a PrEP and PEP clinic. And so those are some of the strategies that we are definitely looking at, Senator, and would love to have some more dialogue with you as we work to address this and look forward to actually implementing a PrEP and PEP clinic.
And just one more follow-up to the first time I met you, I was in 10th grade when you came and gave the introduction and this whole speech on HIV in health class. And are you still...
You're making me look old.
10th grade, high school. The outreach was amazing at Department of Health and the program you were working with. Are you still doing that level of outreach in the public school and private schools on the impact of what unprotected sex can yield? Thank you, Mr. Chair, for the time.
Sure, great. Actually, just last week, our DIS and Adrian Edwards and our prevention coordinator, Robert Thompson, actually was at a school providing some outreach and prevention activities there. But we are even going bigger than that. We want to do more than just the schools. We want to do just about everyone. And so actually for Valentine's Day, keep your ear tuned. We will be out in the field doing a lot of some activities, such as doing some HIV testing combined with COVID testing, and offering some great incentives, distribution of condoms and so on. So we do have a lot of activities that will be coming up really soon to actually address that. And as we know, this is Black History Month. And so Tuesday was Black HIV Awareness Day. And so definitely, and as you know, we are predominantly Black community. And so definitely we are looking at new strategies, and these fundings that we've received are going to help to do great things. One of the stuff that you heard us speak about is the vending machines, because getting tested for HIV, people feel stigmatized. And so if we have a vending machine that has COVID testing, HIV testing, condoms, different things, you can just go to the vending machine, get your HIV test, and we have a mechanism in way that you could report back the results to the Department of Health, and our DIS could actually contact you if you have questions, etc.
Can you speak about the summit real quickly? 2 seconds.
Sure. Definitely. And actually, see Dr. Hunt as well on. We are actually collaborating with some of our federal partners and also AIDS Education Training Center in NPCDC in the mainland. And in March, again, to the strategy of ending the epidemic in the territory is full. And so we're having a summit, a 2-day summit, where we will be providing education to our healthcare providers in the territory of new strategies and updates on medications and therapy for taking care of our HIV and STD population. And so that's going to be a 2-day summit. Particularly, we're starting off on St. Croix, and then we're going to then do another summit again 2 days on St. Thomas for those who aren't able to come over to St. Croix. And so definitely one of the key things is that Dr. Hunt, for example, she's our communicable disease, infectious disease provider, but we want to get to take some of the burden off, but we want to get more of our local partners and providers to make HIV testing a part of routine healthcare. So when you go to the emergency room, HIV testing is a part of your routine healthcare. When you go to your regular provider, did you take an HIV test as part of your glucose screening, as part of your cholesterol screening? And so getting more of our local providers involved and our pharmacists involved, and especially for PrEP and PEP, and they talk more about that, then the stigma of just talking about HIV and talking about an STD is actually becomes mute at that point in time.
Thank you very much for that,
Mr.
Jason. I can
Chair?
see the passion. I can see the passion.
Chair, may I ask?
I just go ahead, Dr. Tyan Caesar.
I really apologize. Ty Hunt Caesar, Medical Director, Department of Health. To further illustrate Jason's point with what Senator Saru questioned about post and pre-exposure prophylaxis. What I want to underscore is that Director Henry mentioned that he is trying to develop PEP and PrEP clinics. But what I don't want the public to think is that we are not actually engaging in these therapies currently. We really don't need a specific clinic to provide these services, and these services are provided by myself as the HIV and STD provider, and discussed at every STD and HIV encounter that I provide, as well as with other private providers within the territory. So I do get referrals from individuals, and when I speak to them, if they actually tell me that yes, they are taking these medications that are prescribed by their private providers. So our private providers are engaging in the current guidelines for pre-exposure prophylaxis, and we are extremely resourceful in trying to make certain that the individuals can actually acquire these medications outside of using the federal funding that we are not allowed to do. So with the expansion of the Medicaid funding with the Affordable Healthcare Act, as well as the pharmaceutical assistance programs that we can acquire with the assistance of participating pharmacies, we are actually quite resourceful in ensuring that the medications are available and people have access. So I just wanted to make certain that everyone understands and knows that we have been and continue to prescribe pre-exposure prophylaxis and post-exposure prophylaxis to prevent disease transmission. Thank you.
Very well, thank you for that, Dr. Tyan Caesar. And it's very important that we continue to do that and be as aggressive as possible in our endeavors for the PrEP and PEP, because obviously the Virgin Islands and Puerto Rico, as well as the Caribbean, has been considered one of the highest rate of infections. So it's critical that we continue to be on top of this as we move forward. At this time, we'll go to Senator Donald Fred Gregory. You recognize for your 2 minutes.
Thank you, Mr. Chair. I have, I think, 3 questions. I know that we're not here to talk about Legionnaires, but I think it's important that we get some information on that. I note that in the news of late, there has been an outbreak in the Virgin Islands, so I need to hear from you as it relates to how are you sharing that information outside of the news with our community to ensure that this situation is mitigated, or this outbreak is mitigated.
So what I will do is that it's also an environmental issue. So we've had three different areas working on it together. We have environmental health, epidemiology, and of course, Dr. Hunt Caesar being our infectious disease expert. So Dr. Hunt, I'll start with you, and then we can go to Dr. Ellis. Dr. Hunt?
Thank you for your question. Ty Hunt Caesar, Medical Director, Infectious Disease Specialist. So our department, Division of Epidemiology, was right on top of the reporting and the intervention by requesting assistance from the CDC for technical assistance and testing. So Legionella or Legionnaire's disease is a bacterial infection that can cause mild fever-like syndrome or a very severe pneumonia that we commonly are able to identify quickly with testing when someone is admitted to the hospital. And we routinely look for it whenever someone comes in with pneumonia so that we can quickly identify it and treat appropriately with antibiotics.
Okay, so what I'm trying to get at, Dr. Hunt, is are we putting information out in the community? Are we doing ads on the television, et cetera, to ensure that individuals with homes are ensuring that they're doing what is necessary to mitigate this? That's really what I'm trying to get at this point.
Yes, ma'am. Yes, we are.
So you are.
Yes,
so
I can speak to that a little bit. So Dr. Esther Ellis, territorial epidemiologist, we did send out a press release on February 4th as soon as we identified recent cases of Legionnaire's disease to talk about what it is, why it's important here. And that was picked up by the media widely, and various news articles also spoke about it. We spoke about it at the Government House press briefing on Monday that Deputy Commissioner Molloy was there for that, and he also answered questions from the media at that venue. But in addition to that,
30
we're
seconds.
specifically reaching out to VRBO and Airbnb owners, especially those that may have hot tubs, because as Dr. Hunt Caesar said, it's airborne, aerosolized, and so hot tubs are a risk factor because
I'm
they
trying
can,
to get, and it's
cause
like
a bacteria
hard.
to go into
My
the air
time is
and-
about to be called, and this is like a real hard conversation. All I'm trying to establish is, are you placing media ads so the entire Virgin Islands community could understand how to mitigate this situation? Yes or no?
Yes.
Thank you. All right. So I've looked at your the various grants that have come into the Virgin Islands, and I talked about that earlier around behavioral health and drug dependency services. But I note that under your basically how you've broken down the various budgets, your advertisement is basically in the newspaper of the Daily News and the Avis. And that concerns me. Are you using, I mean, you're not saying it here, but you probably are. Are you using other mediums to share information with our community? Everybody don't purchase the Daily News. Everybody don't purchase the Avis. So how are you getting the information outside of these two news mediums?
Okay, of course, social media is a big one. We're trying now to expand our social media access. Facebook is not the only social media, so we're trying to expand access, and of course, radio. So we do a lot of radio announcements as well.
So you do radio, okay? Because you didn't indicate that. Based on the last conversation, I think my time has been called, but let me just wrap up. The last conversation regarding PEP and PrEP in the Virgin Islands, and we talked a lot about HIV, of course, in this conversation. What is our HIV rate in the U.S. Virgin Islands?
Dr. Henry?
Among adults and among adolescents?
Sure, I will get the exact numbers for you with regards to the rate. But however, currently the Virgin Islands have over 800 known cases in the territory. Out Are these all cases active? No. But since we've started gathering the data, we have over 800 people who have been diagnosed in the territory with HIV and AIDS. And I will get back to you with the exact numbers as relates to adults and adolescents.
All right, thank you. Through the chair, because I know we are going to wrap up soon. If we don't get it by then, we'd like to get that information, please. Thank you, Mr. Chair.
You're welcome, Senate President Fred Gregory. And again, Commissioner, if we could just get that information sent forward to the chair, we'll circulate it to the rest of the committee members and other senators. At this time, the chair will recognize Senator Joseph. You're recognized for your 2 minutes.
Thank you so much, Mr. Chairman. Commissioner, I wanted to ask you relative to the behavioral risk factor grant that you have here on page 13 of your testimony. I noted that you mentioned that the grant period is from August 1st to August 1st, 2021 through July 31st, 2022. Have you begun expending any of this funding? Because
That
July
funding-
31st is right around the corner.
But it starts this month, so it's every month. It's $6,000 that will be expended. That Dr. Von Mann would be able to say whether or not we've actually expended any of that, but we have until the end of the month to expend over $6,000. So that's really how it works. But just to let you know and to clarify to the community, this is a survey that's being done through Brephis. We have our Brephis contract that goes on an annual basis that looks at a gamut of illnesses as well.
Okay, so it's every month. And how often do you do the surveys? And who are your clients who are being assessed?
It's phone-based surveys. And Dr. Van Mann, do you want to speak specifically to that briefly?
Certainly. Good afternoon. Janice Valman, Deputy Commissioner, Health Promotion, Disease Prevention. The Brephis, yes, it is an annual survey, a telephone survey that's conducted all over the nation, and we participate in that. And there's different modules and different types of behaviors that are examined within the Brephis, including behaviors related to behavioral health. And it's ongoing. We've completed the 2021 survey, and we're starting 2022. In February.
But if you could just indicate, who are you serving? Are you serving young people? You're serving individuals who come through your clientele within the Department of Health, your clinics? Are you focused on a certain demographic? That's what I'm trying to get at.
Certainly, I can answer that for you. The Brephis is a population-based survey, so it surveys the entire population. But once the data comes in, then we can look at the various demographics. You see who answered, but it does survey 18 years and older, only adults.
18 years and older. Okay, that's exactly what I wanted to get, what the demographics were, 18 years and older. Okay, I also had a question, and most of my questions are relative to the grants, Commissioner, because I see you have a number of grants here, and I'll just bulk it into one. How many of these grants that you have are currently online and that you have access to that you mentioned in your reports?
30 seconds.
Senator, I do not have that number available to you. Someone else did ask for that, and so I will be sending that to you with the other information that's needed to the chair.
Final question. On page 17, you mentioned about the staff members who are coming online and you're looking for. Do you have any timeline to bring in your staff members, the new staff members? 17, line 13. Do you have any timeline to bring in some of those project managers and the like? Those grant managers?
Time.
Once we can begin recruiting right now. So once the budget goes online, we have already pulled from our pool of resumes, and we could begin that process. Giving you a timeline, it would be specific to each grant. So once they go online, we can begin the recruitment process and the process for hiring through OMB and Division of Personnel. Okay. I'd like to say 2 months after the grant comes online, we can actually conduct recruitment as well as onboarding.
Okay, thank you so much, Mr. Chairman, for the time.
Thank you very much, Senator Joseph. And Commissioner, I know that we're here today to talk about ARPA as well as the behavioral health. However, I have a concern that have come into my attention in respect to EMS and the staffing at EMS, and the fact that there's individuals occupying positions for an extended period of time that could very well be freed up, especially in the St. Thomas district, could be freed up for able bodies to be able to support and assist EMS. Is that something that you're aware of, and can you speak to what is being done to address that situation?
I'd have to really look into that a little bit more in reference to if they're speaking about bodies being out on leave and how we can get them off of leave, whether or not they're no longer working with the Department of Health, or bring them back to work or free up that position.
Apparently, these are individuals on light duty. I'm sorry. Apparently, these are individuals that's operating on light duty and that's occupying, I guess, positions of EMTs or EMTRs or whatever may be the situation.
Okay, we'll work on that. One of the suggestions that was made earlier is, can we shift them over to do some other functions like 911, because we need those areas of expertise if they can. So we'll work on that.
Correct. Okay.
I'll look into that.
Very well. Thank you. Senator Heiliger, Francis Heiliger, you're recognized for your 2 minutes.
Thank you so much. Good afternoon once again to my colleagues, the people of this territory, and to the testifiers. Commissioner Encarnacion, I wanted to get some details in regards to quarantine. One of the things that I had discussions about is sometimes when the CDC shares one narrative and then there's a different narrative being told here in the territory, how do you guys decide what will be the final response? And I'll give you a quick example. I had a individual that shared with me that they had COVID and they had contacted the agency to find out, do they have to quarantine for the 10 days? But literally around that time, the CDC had put out some information about cutting it down to possibly 5. And in trying to get responses at the time, they were told they have to find out which narrative is going to be put out. Could you tell us definitively, how is your department handling when one message is coming out nationally and then locally we have to potentially either implement it or stand to what we have decided to do in this territory?
Just to let you know, CDC puts out recommendations and not mandates. And so once they put out recommendations, they allow the jurisdictions to make the final decision. So because of our demographic area, it is important for us to be a little bit more conservative on what our applications are. And that's what we've been doing. And we've been very successful, so we're not messing with success. To let you know, what we do is we make a decision. Dr. Ellis, Dr. Hunt and I sit down. We make a decision as what we need best to do. I have to tell you that I've actually spoken with the director of CDC. She knows that sometimes we counter what they're saying only because of our demographics and our geographical location. And she is actually in agreement with that. And then we get it out using social media, radio announcements, press conferences, all the above.
Okay, thank you. As of right now, are we still on the 10-day quarantine as it relates to COVID? Is that the official stance of the agency still?
Yes, it is. Yes, it is. If you are, and it goes one person at a time, if you are fully vaccinated and have the booster, then exceptions to a 7-day quarantine is made, and only then.
Okay, so there's two depending on what status. What I want that is being utilized to really push, whether outside of the hotline, are there other programs that you guys are doing, and how do you market this to the public? And I'm saying this because I had spoken a while back to the police commissioner and had asked about statistics of suicides that they are aware of through the department. And
30 seconds.
I'm very much concerned about the mental health and well-being of the people of our territory. So how do we really push suicide hotlines, other programs to this territory?
So we do a lot of information outreach on social media. We do a lot of radio announcements in regards to suicide and suicide prevention. We have ads within the theater so that when you actually sitting down, we have your attention there. And then we also engage the juveniles or the prefix of the younger generation and how they're reacting to not just COVID, but way before COVID. So there are different venues that we use for suicide prevention. The last couple of years, last year we didn't, but prior to that, we had 2 prevention conferences that were very successful. The first one was in person. The second one, of course, had to be virtual, but we'll continue those venues. And we have experts coming down to actually train, as well as utilizing our experts here within the territory.
Could I just wrap up this? In regards to this, have you guys done any studies to see which avenues of marketing and advertising to the public that you get the best results from? So I could better, and the public could better understand how strongly these marketing tactics are in actually getting the message to the public.
That's something that I can speak with the Bureau of Economic Research about, because we're looking at how we collect the data and what we're doing. And I'm sure we can work with them on how we do a really good research study and how marketing affects preventive health care. So that's an excellent conversation to have. So thank you for that.
But I would look forward to having a report on it. Thank you so much. Thank you, Mr. Chair.
You're welcome.
Thank you very much, Senator Francis Heiliger. Senator Payne, you're recognized for your 2 minutes.
Thank you for the time, Mr. Chair. Commissioner, I just have 2 short questions for you. In your testimony, you stated that we have 39 patients at off-island residential facilities, and of those patients, 21 are forensic patients. For the education of our listening of your audience, please explain what is a forensic patient.
Okay, forensic patients are patients who have been diagnosed with not guilty for reason of insanity. Are you online still, Renan Steele?
Yes, I'm here, Commissioner.
Okay, good. You want to expound upon that?
Okay, yes. So the forensic population is those who've been convicted, found not to be competent. So they're classified as not guilty by reason of insanity, but they need residential treatment. They're sent off to residential care. So being that they have the potential for higher risk of violence, so for they're placed in forensic psychiatric hospitals rather than streamlined hospitals.
And they are placed there for a period of time or for the remainder of their lives?
Yes, the goal is for them to be there until they're found competent. So there's a periodic review requested by the Department of Justice. It's every 6 months right now. They do a review to find out if that individual has attained any competency or if they need to remain in treatment.
Okay, thank you for your response. And lastly, Commissioner, what additional behavioral health services are needed to address the increase of persons suffering from behavioral health issues, and how is your department moving forward in a direction to address them?
Could you repeat that question? I didn't hear the first part of it.
Okay. What additional behavioral health services are needed to address the increase of persons suffering from behavioral health issues in the territory, and how is your department moving forward in a direction to address them?
I think that prevention is the key, and I would say public health is all about prevention, Senator Payne. So I think, first of all, we need to conduct the surveys that everyone is speaking about, go into the school system, start from young. How can we identify what the needs are? Asking the questions, letting everyone know that behavioral health is something that we all are exposed to, whether it be mental illness, behavioral health challenges, mental health and mental wellness. They're all aspects of behavioral health, but how do we know what's going on? We have to be out there and we have to ask the questions. So I think that this conversation is an excellent way to have this conversation and continue that conversation. DC Steele, any additions to that?
30 seconds.
Yes, you covered it very well, Commissioner. The prevention is definitely where we need to begin, and just more engagement, because we do have to face and reduce that stigma that still exists when we talk about behavioral health.
Thank you very much for your responses. Thank you very much for your time, Mr. Chair.
Thank you. Thank you very much, Senator Payne. Senator Joseph, you're recognized for your point of inquiry.
Thank you. Thank you, Mr. Chairman. Mr. Chairman, to Commissioner, to specifically Mr. Jason Henry. I know he mentioned the word PrEP as one of the programs he manages. Could you just tell me what that PrEP, I'm thinking, stands for?
Sure. Good day. Pre-exposure prophylaxis, and PEP is post-exposure prophylaxis.
Okay, thank you.
So even for further,
go ahead.
Okay, sure. Even for further clarity, for example, PEP, a victim who of sexual assault, upon presenting to the emergency room, we've been working with emergency rooms as well too, who they are offered PEP, which is post-exposure prophylaxis. So someone who's been a victim of sexual assault is provided PEP to reduce their risk of actually acquiring HIV after having sex with someone who been infected with HIV.
Okay.
And in PrEP is that individuals who are having sex with individuals that they may not be aware of their status, they take that medication pre-exposure to prevent them from acquiring HIV from someone that they may have sex with in the future with HIV.
And just one follow-up question. How long have you been collecting the data? Because you mentioned is 800 active cases. When did that start? When did you start collecting the data?
Sure. So the data as relates to HIV in the territory has begun since 1989 as relates to when the Department of Health started collecting that data. There were some minor gaps shortly after hurricane, and our surveillance division is working on actually closing up that data because our systems were affected as a result of the hurricane. But we do now have a cloud-based system where that would not affect that process anymore.
Okay, thank you so much, Mr. Chairman, for the leniency. Thank you, Mr. Henry.
Thank you very much, Senator Joseph. And as we go to wrap up at this particular round, again, I want to really commend and thank the Commissioner for her responses here today and for the success stories of the Department of Health, and to really implore her to redouble her efforts in those areas that we believe that we're falling short on. And, COVID, while it is an emergency, it's not the only emergency. And we really need to unmask behavioral health and address it in with a level of urgency that is so deserved. Again, we can't continue to be considered that behavioral health is an invisible population or those hidden in plain sight, and that matter is not being addressed. So we all have a responsibility, and today I'm not here to point fingers, but to really work collectively with the executive branch as well to make sure that we're able to address this particular issue. I intend to, after this discussion today, is for us to, again, engage the governor by moving a resolution and asking for that there be some level of urgency. I'm not talking about emergency no more, but there must be some level of urgency in being able to move the needle on this particular issue, and we're all in this together. So I want to give you a few seconds to make your closing statement at this time, Commissioner Encarnacion.
Thank you so much, Senator Francis, and I want to thank you and other members of the 34th Legislature for always being a big support for behavioral health services throughout the territory, and of course to the Department of Health. And so it's really appreciated. I want to take the time now to thank the general public for the response and the support that we got during Omicron. You, as a community, identified the need to be tested. And as a result, we were able to quarantine and to reduce the transmission. The Omicron surge occurred within 3 weeks. We had a peak. And then, of course, now we see a drastic diminution of numbers, but long-term effects remain, and we're continuing to see deaths. So I think it's important to know that Omicron can present with severe illness, and even though most cases are mild to moderate, Omicron can and have proven to lead to death, depending on risk factors like diabetes, hypertension, cancer, and other comorbidities So please bear that in mind. But in reference to what has been spoken about today, we heard you. We will continue to work with you, to collaborate with you, and continue to provide the information that's needed. The grant funding now, as we spoke about, is now providing us with more access to human resources, and we will hire a recruiter, and we will hire the individuals that we need to into these grants so that we can expend the money that's there to assist us. And thank you all so much, my team that came on with me. I really appreciate each and every one of you, those that are there working. Thank you so much, Governor Bryan, Lieutenant Governor Roach, and my colleagues in the cabinet. Thank you all. And thank you so much, Senator, once again.
Thank you very much, and thank you again to your team, your management team, for all the work that they're doing, as well as your rank and file employees. We appreciate the fact that they continue to put their own lives on the line every single day as we go through this pandemic situation, as well as the other crises that we are finding ourselves in and challenges that we're finding ourselves in. We certainly appreciate it, and we only hope to keep everyone earnest, so that we can continue to, do better for our community and do all that we can in our respective areas of responsibility. At this time, I'll ask the DOH team to go ahead and sign off, and thank you. And I'm asking for my colleagues' indulgence as we move into block 2 and 3. I'll merge the blocks so that we could continue and try to wrap up in a reasonable time today. Thank you, Department of Health. You may sign off.
Thank you.
We'll ask the Madam Clerk to please read block number 2 and to ask those individuals for block number 2 to go ahead and put on their cameras at this time.
Block number 2, overview of the VI Department of Human Services. Invited testifier, the Honorable Kimberly Kazi Gomez, Commissioner, VI Department of Human Services. Block 3, homelessness in the territory and possible solutions to alleviate this public health crisis. Invited testifiers, the Honorable Kimberly Kazi Gomez, Commissioner, VI Department of Human Services, Dana Clendenin, Chief Disaster Recovery Officer, VI Housing Finance Authority, Malik Stradiron, Executive Director, 10,000 Helpers of St. Croix, Inc., Maria Ferreras, Private Citizen.
Thank you very much, Madam Clerk. At this time, we'll just go for a device check. Good afternoon, Commissioner. How are you doing?
Good afternoon.
Afternoon.
Mic
Well,
check.
very well. Do you have any other staff with you today?
I do. I have my leadership, but I feel like I'm getting some back feed.
Yeah, you need to get a little bit closer to your device or something, Commissioner. You're breaking up.
Good afternoon. Mic check.
You sound good now. Go ahead with your other staffs.
I have with me today Assistant Commissioner Mikkel Reimer Brown. Mic check, Mikkel, please.
Good afternoon.
Good afternoon.
Assistant Commissioner Carla Benjamin.
Good afternoon.
Good afternoon, Ms. Benjamin.
Chief Financial Officer Charmaine Modeste Antoine.
Good afternoon.
Good afternoon.
Deputy Commissioner of Human Resources, Labor Relations, and Payroll, Rhoda Rojas.
Good afternoon.
Good afternoon. Okay.
Chief Legal Counsel Kimberly Berry.
Good afternoon.
Good afternoon, Ms. Berry.
I have Deputy Commissioner Miguel Tricoci.
Good afternoon, everyone.
Good afternoon, Deputy Commissioner.
I have Director of Nonprofit Kendall Tutine, who will be in Block 3.
Good afternoon, everyone.
Good afternoon.
That is it.
Very well. Thank you. As you know, we merged block 2 and 3 so we could have just the a simultaneous discussion in respect. And we also have from representing the Virgin Islands Housing Finance Authority, Ms. Dana Clendenin.
Ms. Clendenin is not on the line as yet. This is Darren Richardson, Virgin Islands Housing Finance Authority Chief Operating Officer.
Very well.
Actually, she's, I think, in the waiting room right now.
She's in the waiting room? Okay, so. Good afternoon, Ms. Clendenin. You have joined us?
I'm here. I have.
Okay, good afternoon. Just checking your device at this time.
I'm here.
Okay. And for your information, we have merged block 2 and 3, so we'll just go right into it. And Malik Sridharan, Executive Director of 10,000 Helpers of St. Croix. Device check.
I'm here. You can hear.
Very well. I can hear you.
Good afternoon, everyone.
Good afternoon. Good afternoon. And I know that Maria Ferreras is not on, but she did send in some testimony that will be read into the record at the appropriate time. Also, I want to welcome everyone to this block. And again, today in block number 2, we're hoping to have an overview of the Virgin Islands Department of Human Services, as well as block number 3, which speaks to homelessness in the territory and possible solutions to alleviate this public health crisis. At this time, Commissioner, you may go ahead with your testimony.
Good day, Honorable Senator Novell E. Francis Jr., Chair of the Health, Hospitals, and Human Services Committee, committee members, other senators present, and the listening and viewing audience. Thank you for the invitation to provide an overview of the Virgin Islands Department of Human Services. I'm Kimberly Causey Gomez, Commissioner of the Virgin Islands Department of Human Services. As requested, I have members from my executive senior leadership team with me today. Chief Financial Officer Charmaine Modeste Antoine, Assistant Commissioner Carla Benjamin, Assistant Commissioner Mikkel Reimer Brown, Chief Legal Counsel Kimberly Berry, Deputy Commissioner of Human Resources, Labor Relations, and Payroll, Rhoda Rojas, and Deputy Commissioner of Operations, Miguel Tricoshi. Scope and overview. The Virgin Islands Department of Human Services receives its authority pursuant to Title 34 of the Virgin Islands Code, the designated state agency for all publicly financed social services programs. We serve over a third of the territory's population through our 84 programs within our 15 divisions across all 3 islands. DHS plays a critical role in sustaining individuals, families, institutions, and the local economy through rendering our services daily and through pursuing and successfully securing additional federal funds and enhanced federal matches. Throughout the pandemic, the community's need for DHS's services have increased, and we are called upon to serve more people than ever. An overview of our divisions and services. The Office of Intake and Emergency Services, or INTAKE, performs 2 major critical functions within the department. The office receives and investigates all new cases of suspected child maltreatment on a 24-hour on-call response basis. It also responds to all matters involving children in need of social intervention, such as children with behavioral challenges. This office conducts initial investigation, transfers of cases to other programs within the department, and refers clients externally for continued services. This office provides emergency welfare services in the form of brief financial assistance to individuals and families to assist with the continuum of care of services, from rental assistance to essential appliances to burial and cremation services. The intake administrator conducts the territory's child abuse registry checks. The Division of Children and Family Services houses 2 components. The Protective Unit provides services for families with an elevated risk for child maltreatment, with a goal of remediating the issues and lowering the risk. The second component is the Foster Care and Adoptions Unit, which provides services for children that come into the department's care and custody. This unit also conducts custody and adoptive local and international home studies for the courts for agency and private matters. The Foster Care and Adoption Unit is responsible for recruitment, training, licensing, and the retention of foster and adoptive parents. The Division of Children and Family Services currently works with the U.S. Department of Health and Human Services, or HHS, Administration for Children and Families, ACF, Children's Bureau, the Capacity Building Center for States, and other federal and national partners to bring the territory's social services system into alignment with the Family Services Prevention Act of 2018, which was fully enacted nationally on October 1st, 2021. The Division of Intervention and Prevention Services provides services for youth at risk for involvement in the juvenile justice system. This division has a unit per district to provide traditional casework services and 2 residential facilities, the Youth Rehabilitation Center and the Anna's Hope Group Home. The intervention and prevention units clients remain in their homes and receive services such as individual, group, and family counseling. These clients are at times adjudicated as persons in need of supervision, or PINs, and may be subject to consent decrees, probation, and court orders that govern their activities via strategies such as curfews. YRC is the only secure detention facility for adjudicated youth in the territory. Clients at YRC are remanded by a judge for violations of law, and their charges run the full gamut up to and including murder. Upon discharge from YRC, youth remain clients of the Intervention and Prevention Unit in their district on a voluntary basis. The Anna's Hope Group Home is an 8-bed co-ed foster group home for youth ages 13 years old to 18 years old. Clients at the group home receive contracted psychological and other services toward the goal of permanency, whether permanency means reunification with the family or another independent living for youth transitioning to adulthood. The Office of Residential and Interstate Compact Affairs manages and monitors the department's relationships with residential facilities within and outside the territory, whereas the department's clients across the lifespan are admitted. The residential clients present a variety of developmental, psychological, conduct, and/or behavioral issues which require specialized treatment outside of the traditional home setting that are often not available within the territory. All services are provided through contractual agreements, all of which are locally funded. The department expended $5,763,913 for clients placed outside of the territory in residential treatment, and $5,376,980 for clients placed in residential programs locally in fiscal year 2021. Currently, although it states 38, we have 39 clients that are currently out of territory placements ranging in from ages 12 to 68. 57 clients are currently in local residential facilities, placing ranging from 3 months to 65 years old. Movement of minors that are in care across jurisdictional lines for treatment, permanency, and other reasons is regulated by 2 nationally recognized compacts: the Interstate Compact on the Placement of Children, or ICPC, and the Interstate Compact on Juveniles. The Administrator of Residential is the territory's administrator of ICPC, as well as the territory's commissioner of ICJ. The U.S. Health and Human Services Administration of Children and Families, Office of Head Start, administers the Head Start program in the U.S. Virgin Islands. Head Start promotes the school readiness of children who are 3 years old by December 31st, and up to 5 years old at enrollment from low-income families. Head Start is recognized nationwide as the primary empowerment program for low-income families, involving them in all aspects of the program, including governance. The Head Start program is a gold standard in early childhood education. The Department of Human Services Head Start program's funded enrollment for the territory is 794 children or students, 500 students in 15 classrooms on St. Croix, and 254 students or children in 14 classrooms on St. Thomas, and 20 children in 1 classroom on St. John. The Head Start program currently has Office of Head Start Disaster Recovery Awards of more than $45 million in the process of utilization. The fully funded projects include reconstruction of Head Start playgrounds across the territory, installation of security cameras and surveillance systems for all Head Start sites, and 8 major Head Start construction projects spanning all 3 islands, Cruz Bay, Head Start in St. John, Belongo, Lindbergh, Tabor and Harmony, Minetta Mitchell and St. Thomas, Concordia, Anna's Hope Administration Building, and Charles H. Emanuel for St. Croix. The Head Start program recently implemented the COVID vaccination mandate that was announced by President Biden in September 2021. The Office of Head Start subsequently integrated the vaccination mandate into its performance standards with a deadline of January 31st, 2022. All but one Head Start employee have either been fully vaccinated or have an approved accommodation based on a medical or religious exemption. The Office of Child Care and Regulatory Services consists of 3 units that reflect the office's 3 main functions. The Subsidy, Resources, and Referral Unit determines eligibility of families to receive child care subsidies to pay for child care and to ensure that children in the territory have access to quality early learning experiences. The Licensing Unit licenses and monitors all child care and learning programs in the territory to ensure that children are safe, stimulated, in healthy environments. And the Quality Unit provides services to increase the quality of child care through consumer education, caregiver teacher training, and provision of resources for quality improvement. The office administers the Child Care Development Fund program, or CCDF, which provides subsidies to parents and families for child care and regulatory services, which licenses and certifies private and government-operated child care facilities. The federally funded subsidy program supports both licensed facilities and informal providers who have been selected by parents and approved by DHS. The Division of Family Assistance provides timely and accurate food, cash, energy, and family support assistance to Virgin Islands residents with integrity and compassion. The division is comprised of 7 units, and these units include certification, front-end, issuance, claims, fraud, jobs opportunity, and basic skills program. There are several federal grants that are administered in this division. These grants are Supplemental Nutrition Assistance Program, or SNAP, Temporary Assistance to Needy Families, or TANF, the TANF Jobs Opportunity and Basic Skills Program, Personal Responsibility Education Program, or PREP, Low Income Energy Assistance Program, or LIHEAP, Aid to the Aged, Blind, and Disabled, or AABD, SNAP Education, or SNAP-Ed, and Employment and Training, E&T. As a result of the COVID-19 pandemic, there are new grants that have been added to the division to administer. These grants include the Pandemic Electronic Benefit Transfer, or PEBT, Pandemic Emergency Assistance Fund, or PSNAP, by the American Rescue Plan, and the Low Income Housing Water Assistance Program, or LEWAP. The Supplemental Nutrition Assistance Program, or SNAP, provides food assistance to the maximum number of eligible households in the territory in accordance with federal regulations. Throughout the territory, DFA provides SNAP to approximately 24,000 persons. Eligibility for SNAP benefits is determined by the certification unit. Eligible applicants receive benefits through the Electronic Benefit Transfer System, or EBT card. The Low Income Home Energy Crisis Assistance Program assists eligible low-income households in the territory with paying electricity bills and purchasing propane or cooking gas. Households are certified for a period of 6 months and must certify or recertify to continue receiving those assistance. Each eligible household can receive up to $400 in assistance with their electric bill every other month. DHS pays the Water and Power Authority, or WAPA, directly on behalf of the household. 2 tanks of cooking gas are provided yearly for eligible households. In addition, households that experience a temporary crisis in paying their electric bill can apply for assistance. In fiscal year 2021, VIDHS provided 6,603 seniors and 715 persons with disabilities, LIHEAP totaling $1,083,863 in financial assistance. The Public Financial Assistance Units provides monthly cash assistance to all eligible individuals and families territory-wide. In accordance with federal and local regulations, DHS partners with the Administration for Children and Family Services, or ACF, to administer the following cash assistance programs: the Temporary Assistance to Needy Families, or TANF, and the Aid to the Aged, Blind, and Disabled, AABD. TANF provides monthly benefits to parents and guardians who reside with children under the age of 18 and can prove a qualifying relationship. AABD provides monthly benefits to individuals who are at least 65 years old, blind, or disabled. DFA also administers the locally funded General Disability Cash Assistance Programs. JOBS is the employment and training component of TANF. The program is designed to help TANF recipients improve their employability and increase self-sufficiency. JOBS offers participants career building, basic education, work experience, and subsidized employment opportunities through a variety of public and partner and private partnership agreements. The Employment and Training SNAP program plays a vital role in the mission of DHS by providing a wide range of employment and training services for clients who receive SNAP benefits. The SNAP ENT program provides intensive case management to support client goals and supervise job search training. These services are provided to non-public assistance SNAP recipients to increase opportunities for paid employment that lead to increased family self-sustainability and independence. One of the new COVID grants is the Pandemic Emergency Assistance, or PSNAP, which gives a supplemental issuance of SNAP benefits to households who are not receiving the maximum benefit for their household size. On a monthly basis, DHS issues over $2 million in PSNAP to over 12,000 SNAP households. During fiscal year 2021, we issued a total of $20,554,591 in PSNAP. From October to December 2021, or the first quarter of fiscal year, an additional total of $3,289,777 was issued to eligible households. PEBT, or Pandemic Electronic Benefits Transfer, it's anticipated that PEBT will be issued in mid-February 2022 for eligible school children whose schools participate in the National School Lunch Program. Planning and implementation for PEBT meetings will be ongoing with our eligibility and issuance contractors, Department of Education and FNS, and submission of application to FNS. In fiscal year 2021, DHS issued approximately $17 million to SNAP and non-SNAP children who were deemed eligible. Approximately 17,000 school-age and child care children received PEBT. DHS continues to play a major role in ensuring food sufficiency for our children and families in the U.S. Virgin Islands. Funding provided under American Rescue Plan, ARPA, provides a unique opportunity for states and territories and local governments to make strategic investments in long-lived assets, rebuild reserves to enhance financial stability, and cover temporary operating shortfalls until economic conditions and operations normalize. The Coronavirus State and Local Fiscal Recovery Funds program, a part of the American Rescue Plan, delivers $350 billion to state, local, and tribal governments across the county to support their response to and recovery from the COVID-19 public health emergency. The Low-Income Housing Water Assistance Program is a federally funded program with the purpose to assist low-income households that spend a high proportion of their income on drinking water and wastewater services. LIWAP benefits can assist households who have had past bills for drinking water and/or wastewater services. We anticipate LIWAP and issuance to qualified low-income individuals and families by or before March 31st, 2022. Pandemic Emergency Assistance Program, or PEAF, provides funding to states administering a TANF program to assist needy families impacted. Grantees may use funds to provide certain non-recurrent short-term benefits. VI plans to issue a one-time payment to clients who are currently enrolled in the TANF program. In addition, the clients in the community can apply to receive benefits. DHS will be launching PEAF cash assistance to eligible families with children during the second quarter of fiscal year 2022. Medicaid is the U.S. government program that provides free or low-cost health insurance coverage for low-income people. Medicaid funding comes from a combination of state and local and federal dollars. And there are both state and federal regulations that apply to the operation of the Medicaid program. As each fiscal year approaches, the Centers for Medicare and Medicaid Services, or CMS, calculates annual allotments under Section 1108G of the Social Security Act, then issues grant awards to the territories containing that allotment funding. The calculations issued for the U.S. Virgin Islands Division of Medicaid and CHIP are as follows. For fiscal year 2020, $128,712,500. In 2021, $127,937,500. And for fiscal year 2022, $131,390,000. The allotment calculations did not affect the territory's federally matching assistance program, or FMAP. Beginning October 1st, 2021, the Virgin Islands FMAP was to revert to the 55-45 federal local match portion. However, Congressional Action CR PL 11743 HR 5305 extended the FMAP to 83% through December 3rd, 2021. Additionally, CR GEB 18-2022 passed on December 3rd, 2021, extending the FMAP to 83% through February 18th, 2022. The territory also continues to qualify for the temporary 6.2 percentage point increase to provide a broad fiscal relief to the approved FMAP for the VI under Section 6008 of the Families First Coronavirus Response Act through the end of the quarter in which the public health emergency ends. VIDHS is currently the executive sponsor of several informational technology projects which will improve and transform the Virgin Islands healthcare system. Current active projects are as follows. The Patient Lookup System for Emergencies, or PULSE, is a web portal offered by Audacious Inquiry that allows appropriately verified providers, clinical providers, emergency medical response personnel, volunteer healthcare providers, public health nurses, etc., to find and view electronic patient data. An environmental scan will provide a comprehensive snapshot of the current health information technology landscape in the U.S. Virgin Islands for the providers. PMO Health Information Exchange will provide project management and health information exchange technical services to the assisted department in the implementation of the territorial HIE, to be known as the Virgin Islands Health Information Exchange. PMO, or Virgin Islands Benefit Enrollment System, or VIBES, will provide project management and eligibility and enrollment technical service to assist the department in the integration of SNAP, TANF, LIHEAP, and childcare into our E&E systems of VIBES. So the Division of Senior Citizen Affairs. Human Services has the mandate and pleasure of improving the quality of life for our seniors of the Virgin Islands, preserving their personal dignity and ability to function independently for as long as possible or until their care plan requires a transition to assisted living or residential services. The Division of Senior Citizen Affairs, or SCA, through our dedicated staff, has continued to provide critical in-person services to our seniors aged 60 and older and adults with disabilities ages 18 to 59. Raise community awareness to prevent and, when necessary, report abuse, neglect, and financial exploitation of our most vulnerable adults and elderly, as well as maintain 2 homes for the aged during the COVID-19 pandemic public health emergency. Since the COVID pandemic took over the nation, the Federal Administration for Community Living collaborated with states and territories, state units on aging, to include the Virgin Islands Department of Human Services, to meet the nutrition, socialization, and wellness needs of seniors. DHS has continued to target areas of our service delivery during the COVID pandemic. The Meals on Wheels nutrition program has served a total of 55,538 meals to 824 clients in the first quarter of this fiscal year. This includes outreach to our seniors who are actively participating in activities in our senior citizen centers before the pandemic. The centers have remained closed since March of 2020. However, our DHS staff has prioritized keeping our seniors who attended those centers socially connected. Birthdays and anniversaries are still celebrated. Our staff ensure they continue to keep in contact with those seniors, completing weekly wellness checks and via phone calls. Additionally, our senior center staff joined the senior community nutrition aides to deliver the meals to the homes of seniors who requested them. DHS suspended volunteer and work activities for the Senior Volunteer and Foster Grandparents Program and the Senior Community Service Employment Programs due to the COVID pandemic. During their time away, however, from their volunteer and work activities, our seniors continue to be paid their wages and their volunteer stipends. We're truly blessed with a dedicated staff at both of our homes for the aged. All our residents at Herbert Grigg were vaccinated and received their boosters. All but one of the residents at Queen Louise Home for the Aged have also received the COVID-19 vaccine and boosters. We have continued strict COVID-19 safety protocols in both homes for the aged. There's still no in-person visitation, but we use Skype and tablets and telephone calls with the residents' loved ones, and that has continued. Fun activities have continued in a safe and healthy way with COVID protocols in place. We're thankful for the hard work, dedication, and support of the Virgin Islands Department of Health epidemiology team for their immediate response to our concerns and for providing PAFFord nursing support during this pandemic. Our homemakers continue to go into the homes of our elderly, frail seniors and adults with disabilities to help with activities of daily living, like baths and assistance with eating, mobility, personal grooming, and dressing. The diligent adult protective services, social workers, and other unit staff continue to investigate all reports of suspected abuse, neglect, and financial exploitation of our senior and adults with disabilities. The Family Caregiver Support Program has maintained their caregiver support groups for caregivers. At the time of this testimony, APS is consciously aware of the patients. There's approximately 10 at Schneider Regional Medical Center and 5 at the Juan Louis Hospital who've been designated as boarders. None of the boarders are wards of the state, and a ward of the state is becoming an adult ward of the state is when the court determines that the adult is incompetent and that there are no suitable family members to act as guardians. The adult ward of the state is protected by law after they are deemed incompetent. Human Services APS staff remain in their regular contact with hospital staff for updates on their status. By assessment, all the boarders are unable to care for themselves independently and require regular monitoring, assistance with activities of daily living, and medication management. In most all cases, there is a limited family support and the unwillingness of or inability to provide the needed care and supervision should the boarders be discharged from the hospital to private homes or independent or assisted living environments. Our Human Services team recognizes the ill effects of patient boarding, not only for the boarder prospective patients and the staff, but also the significant toll it takes on the hospital coffers. Our territory is challenged by the dearth of resources or the lack of nursing home facilities and the scarce solutions available for even transitional respite care. Nonetheless, we remain hopeful and stand ready to rejoin our efforts with all the stakeholders in curbing delayed hospital discharges. The space is currently limited at both homes for the aged to accommodate the discharges locally. Off-island placements are an option at a monthly rate of $5,000 to $9,000 per person. The annual cost for an off-island placement would be between annually $900,000 to $1.6 for all 15 individuals. Funding would need to be secured prior to obtaining an approved contract for services. Many stateside facilities are not accepting new patients. A local option is also available in St. Croix with some minor renovations and an increase in the annual operational budget, staffing, supplies, and maintenance of approximately $2.5 at the Herbert Grigg Home for the Aged. Governor Albert Bryan has prioritized the construction of 2 state-of-the-art skilled nursing facilities for seniors as a core target of the governor's Healthy Housing Initiative. Our territory's lack of resources of the continuum of care for those that need it is a hardship for all of us, but DHS is a willing partner for solutions for the spectrum to provide quality of care. By this, I mean we have an integrated system of care that guides and tracks patients over time through a comprehensive array of health services spanning all levels of intensity of care. It's been extremely challenging several years for the Division of Senior Citizen Affairs, but we remain committed to assisting our seniors to live out the rest of their years with dignity, self-respect, and the caring support of the Virgin Islands community, all while staying safe within the pandemic. The Division of Disabilities and Rehabilitation Services has continued to provide services throughout the pandemic. As a result of the public health crisis and subsequent closure of schools, DDRS has seen a decrease in the number of referrals and applicants. During the first quarter of this fiscal year, client services were provided to approximately 275 consumers, with a large majority of them being students. The program achieved 57% employment rate, and 45 of the participants attained a competitive employment status as their individualized plan for employment. 33 students are enrolled in vocational training, and 48 are in the Transition Services program. The Transition Services training sessions focus on 5 core areas: job exploration, work-based learning experiences, post-secondary education counseling, workplace readiness and training, and self-advocacy instruction. 62 seniors received assessment glasses and visual aids from the Independent Living Services for Older Blind program, and DDRS partners with Island Therapy Solutions Incorporated to provide supported employment services to the significantly disabled. 35 individuals have been referred and have received situational assessment, adjustment training, job coaching, and placement. The Department of Human Services successfully filled the position of Chief Legal Counsel last fiscal year. There is a vast set of responsibilities housed in the Office of Legal Counsel, of which there are currently only 3 employees, and one of the position was vacated at the end of fiscal year 2021. This position is currently being filled. Responsibilities include drafting or reviewing and facilitating the execution of DHS contracts and MOUs and MOAs, overseeing the Crime Victims Compensation Program, taking a crucial role in drafting legislation that impacts the department and its constituents, managing the hearings and appeals process for all benefits offered by the department, and overseeing the Child Fatality Review Team, by responding also to subpoenas and other requests for documents, drafting and ensuring compliance with internal policies, and assisting the Human Resources Department with employment matters. The Crime Victims Compensation, although consistently reviewing claims, has been limited by a lack of local funds, as well as some federal funds, causing claims to back up for over years. Currently, it will cost about $350,000 to catch up on the past monies awarded, and there's a potential of a federal 70% reimbursement in the following year if we spend the $350,000 this year. The Office of Fiscal Affairs remained especially busy this past year as responsibilities to operate an efficient system of accounting and budgeting controls for all divisions and activity centers of the second largest government department only increased due to the pandemic. The Department of Human Services has over 70 open and active grants, which require specialized fiscal oversight. Losing key staff in the Office of Fiscal Affairs has presented several challenges. This highlights the critical needs of staffing in the office to ensure proficiency. Once appropriately staffed, we can promote continuous improvements by focusing on implementing efficient processes and internal controls. As we stated earlier, DHS is among the 3 heavily federally funded departments in the government of the Virgin Islands, currently tracking about approximately $300 million in open and active federal grants. Federal regulatory guidelines mandate how federal funds are to be spent. These guidelines are both general and grant specific. It is crucial we administrate our federal funds with transparency, efficiency, and compliance. The Office of Nonprofits and Support Services provides programmatic and fiscal oversight to DHS assigned nonprofit agencies appropriated funds in the GVI miscellaneous and crisis intervention budgets. In fiscal year 2022, 29 funded programs totaling $2.8 million provided services focused on youth, homeless, elderly, transportation, cancer support, substance abuse, parenting and family education, victims of violence, and disability support services. The office is partnering with the community-based and public agencies to develop a system for vulnerable populations to access needed services to end homelessness in the territory. And we'll talk about that in Block 3. The divisions of operations is responsible for the oversight of maintenance, transportation, capital development, and planning, as well as disaster recovery projects. The division is and has always been short-staffed in the areas of maintenance, transportation, and capital development. Maintenance, facility staffing, and an OSHA specialist are just some of the positions that are open, as we need more staff to ensure the smooth transition of our major projects. Within capital projects and disaster recovery, some of the major DHS territory projects are underway. Queen Louise Home for the Aged was approved for prudent replacement under the Bipartisan Budget Act, or BBA, considerations, now estimated at over $18 million, up from an insufficient of $16,000, which was first estimated by FEMA. The department has identified a property which is currently being assessed, and we are negotiating through our partner agency, DPP. We should have an update as we should have that finalized within the next 2 weeks. The New Hanson Complex, FEMA estimates for repairs due to Hurricane Irma and Maria could exceed $12 million. Included in repairs will be a complete roof replacement with a far more resilient multi-layered membrane system, impact-resistant windows throughout, and upgrades to the HVAC and electrical systems to current building ventilation and energy codes and standards. This will greatly improve working conditions and productivity for DHS staff at the New Hanson offices for the future. Herbig Rick Home for the Aged awarded the complex contract for the completion of the dining room roof repairs, and that was completed. The roof was completed, and now we're working on the dining room area. Richmond Senior Center, temporary repairs to the facility have been a major focus and continue to work towards permanent repairs. A contract has been awarded and will include renovations of both bathrooms. Head Start facility construction is a focus over the next 18 months as DHS leadership diligently worked with the Department of Health and Human Services and recently received 8 major facility construction awards for a total of $43 million. YRC, or the Youth Rehabilitation Center, was recently awarded a $1.1 million for the WIN retrofit project. St. John Multipurpose Center initially was estimated by FEMA to have sustained $90,000 of damages by Hurricanes Irma and Maria. A facilitated discussion held last year resulted in FEMA agreeing that this project would exceed the large project threshold and agreed to rescope and cost the entire project, making the facility eligible for the BBA Act of 2018 considerations. FEMA's latest estimate is more than $450,000, and we're finalizing those steps and timelines. The Office of Human Resources and Labor Relations and Payroll has been extremely busy managing all the daily challenges and changes, flexibilities, waivers, telework agreements, etc., that the COVID pandemic has caused to our workforce. DHS and that is a little bit of a change. We have 664 active full-time employees, and that includes CSEP. The first quarter of fiscal year 2022, there was a loss of 20 employees due to retirement, resignations, and dismissals. The second quarter seems to be promising in being able to backfill in federally funded positions. Currently, DHS has submitted 116 personnel request forms, or PRFs, to the Office of Management and Budget for approval. As of late yesterday, just want to make sure my numbers are correct, additional PRFs were received. And of the 116 submitted, 72 PRFs have been approved and 15 positions have been posted. We had 16 rejected due to some discrepancies, which we're clarifying and resubmitting for approval. The balance of the PRFs submitted to OMB currently have no action. Currently, the low staffing levels in core functions does not allow the agency to operate at a high level. We have 4 HR roles posted and are in various stages of the interviewing process. In fact, we just hired one who started and we're hoping to have the other one start on Monday. Hiring additional staff will allow the focus of the HR team to meet the needs of the agency in workforce development and strategy, training and development, recruiting, and onboarding and labor relations. Additionally, Chairman Francis, in conclusion, the last several years, not months, but years, have been more than difficult for our Virgin Islanders, and especially our Department of Human Services team. The impact of COVID on our daily lives and now the Omicron and Delta viruses affects us all. but especially our department as we continue to serve our most vulnerable in a state of a health emergency. I'm proud that the pandemic has not diminished the passions, professionalism, and provision of services to our community. I ask the Virgin Islands community to truly appreciate the services and to take a moment to thank our team members for their dedicated frontline service to you, your children, your parents, your family members. With the continued support of my executive branch colleagues, members of this legislative body, Governor Albert Bryan and Lieutenant Governor Tregenza Roach, DHS will continue to be committed to working together to make a difference for the people of the Virgin Islands. Thank you so much. I know it was a mouthful, but thank you.
Thank you. Thank you very much, Commissioner Kazi Gomez. I wouldn't allow you to read the testimony for Block 3 just yet. I'll ask the Madam Clerk to go ahead and read the two correspondents that we have on record and give you a break. And then we'll come back and and get you to read Block number 3. And then we'll hear from the other testifiers as well. Madam Clerk.
Committee on Health, Hospitals, and Human Services. The Virgin Islands, like most places, faces the sad problem of homelessness. And due to the fact that we are a small community, it is all the more poignant when we see this problem on a daily basis. As we all are aware, the problem is multi-layered. There are various degrees of homelessness, notwithstanding loss of job, loss of housing, mental illness, and addiction issues. No matter what the root cause, it affects our entire community, both from a financial level and a humanitarian level. Eradicating homelessness as an issue is daunting. May I offer the suggestion that would begin with short-term goals, with longer, more ambitious goals as our destination. As I have mentioned in the past, this endeavor could be dubbed the Virgin Islands Humanitarian Project, with a long-term mission statement of alleviating the misery of homelessness in the Virgin Islands. The goal of this project would be multi-tiered. A long-term goal would be supervised housing unit established for those who are mentally ill and homeless and unable to care for themselves. A short-term goal would be to systematically assist people out of homelessness one by one. The short-term goal has the advantage of the project seeing success along the way towards the completion of larger goals, which will require funding. For the short-term goal to succeed, it would not be unreasonable to assign a team to include an elder care worker, social worker, and mental health professional and legal advisor to go out in the community to assess those we see living on the streets one by one. The team would gather information on the mental conditions and status of the individual, the physical conditions necessary to assist, availability of perhaps Social Security or Medicare assistance, basically examine each case on an individual basis. If the teams were able to assess a few people a week, we may see desired results quickly. Even a few success stories will go a long way, and momentum may be gained for the larger and more expensive solutions. Currently, there were many people in need in the community who were unable to take care of themselves on the streets. These people are citizens of the Virgin Islands and neighbors and friends and family. While the goal of ending homelessness in the Virgin Islands is a large one, we can, one by one, alleviate the suffering of persons in need. We must manage our expectations. The Virgin Islands has many problems we as a community are attempting to improve upon, homelessness being one. However, should the community see success cases, I feel the momentum for others to join and solving this issue will be great. Thank you for allowing me to submit this testimony. Kind regards, Maria Ferreras. Good afternoon, Chairman Novell Francis, members of the Committee on Health, Hospitals, and Human Services, other members of the 34th Legislature present today, staff, fellow testifiers, and guests. I apologize for not being able to appear today, but appreciate the time being taken to read my testimony into the record. So, in the interest of time, I'm going to try and keep this testimony brief, not because this issue is not a complex one and doesn't deserve considerable thought and effort into a viable solution, but because I think by now as a community, we should have the answers to this issue. I think that individuals sitting in this chamber in leadership should collectively be able to come up with the necessary solutions to this issue. What has really been missing for several decades is only the collective political will to put the resources necessary together to solve this vexing problem. For me, this issue boils down to how much we as a community truly care for the least among us. This should not pose so much of a puzzle to us because so many of the individuals that are homeless and mentally ill in our community are related and connected to us in so many different ways. They are not strangers. In many instances, they are family members, people we grew up with, people we went to school with, acquaintances, people we know. The unfortunate reality is that we as a community just don't care enough and have turned our backs. We need not reinvent the wheel to find solutions and innovative ways to take care of the homeless in our community. The reality is, when viewed as a percentage of the total population, we are not talking about a large group of people. When I look at what has been done in London and the transformation of double-decker buses into homeless shelters, I look at the old buses that are in Frederiksted sitting. I see a potential solution for the homeless individuals on the Big Island. Many modular homes in Cambridge, England, are being used to help get people off the streets and giving them a shelter to stay in. That could easily be duplicated here with the right will and determination. In India, Habitat for Humanity has teamed up with Tevasta Manufacturing Solutions to produce affordable ED printed homes. Could we not attract them here to the Virgin Islands to do the same thing here for us? There isn't a shortage of innovation. What there is a shortage of will, action, vision, a plan, and true determination to do something meaningful and lasting that will comprehensively take care of our homeless and mentally and behaviorally ill from a legislative, medical, administrative, therapeutic, and social way. That is what the people of this territory entrust the people in this chamber in leadership to do. I spend a considerable amount of my time in the downtown area, mainly in Savannah. It is tragic to see how our historic town has literally become a place where the homeless daily, unregulated, defecate and urinate in areas where our ancestors were sold and lived as free men and women after they were emancipated. Places that should reflect our rich and proud history to residents and visitors alike are desecrated by folks who have nowhere else to call home. This isn't new. It isn't foreign to us. We know this has been happening, but have decided to turn a blind eye of convenience. So, as the young people say, no more long talking. I ask this committee to put the resources, will, and effort behind putting the solutions in place to impact this issue once and for all. There are enough people in the private sector in this community that are willing to assist and expand the bandwidth of this government when necessary to work on solutions. We only need to be asked and tasked with the responsibility to do so. We would ever be reminded of the admonition by Christ himself in the book of Matthew chapter 25, verse 40. Verily I say unto you, inasmuch as ye have done it unto one of the least of these my brethren, ye have done it unto me. It is by this creed by which we all as a community will be judged. Leslie Commission.
Amen. Yes. Powerful testimony that was provided by private citizens in respect to homeless and behavioral health issues. At this time, Commissioner, we'll go to you for your testimony on block number 3, which is, again, homelessness and possible solutions to alleviate this public health crisis.
Okay. Let me just pull that one up, make sure I got the right one. Good afternoon again. Honorable Senator Novell E. Francis Jr., Chair of the Health, Hospitals, and Human Services Committee, Honorable Senator Marvin A. Blyden, Vice Chair, committee members, all of the other members of the 34th Legislature of the United States Virgin Islands, and the listening and viewing audience. Thank you for the invitation to testify. I'm Kimberly Causey Gomez, Commissioner of the Virgin Islands Department of Human Services. As stated earlier, for the record, I have my whole entire executive senior leadership team with me, and I've also included Director Kendall Tutime to provide additional support and information as needed for the subject matter of homelessness and the territory and possible solutions to alleviate the public crisis. I wanted to start off with a quote of, "Homelessness is not simply houselessness. To be homeless is to lack roots or ties to a place and a sense of belonging. Extending hospitality, reestablishing connections, welcome everyone in a safe, personal, and comfortable space, a place of respect and acceptance and friendship, including them in a life-giving and life-sustaining network of relations. Homelessness is a community partnership. To end homelessness, a community-wide coordinated approach to delivering services, housing, and programs is needed. It takes every one of us in this room and beyond to care and to act. There's not one solution, as everyone who is homeless has a story and we need to listen. And maybe we will be able to know how to prevent it in the first place. The Virgin Islands Department of Human Services' role on the continuum of services in addressing homelessness in the U.S. territory is to participate in the planning and development of services and make referrals to homeless service programs. The department also collaborates with and monitors assigned community-based programs awarded with GBI funds to provide direct services to the vulnerable in the community. Currently, the Nonprofits and Support Services Director has oversight of 29 GBI-funded programs through Act Number 8489, or Bill 340124, Crisis Intervention, and the GBI Miscellaneous Act 8474, Bill Number 340109, totaling $2,849,000, of which 23% of the funds fund 9 homeless programs territorially. Services funded include 1 soup kitchen and 4 shelter-based programs, 2 transitional housing, 1 outreach or street outreach, and 1 homeless prevention program. There are other homeless service programs within the community, but are not monitored by DHS. However, DHS collaborates with all the programs to ensure the persons experiencing homelessness or at risk for homelessness are referred for the appropriate services. DHS is a member of the USVI Continuum of Care on Homelessness, or COC, and has representation that serves on that board, and is the chairperson for the COC Coordinated Entry System Subcommittee. The COC Coordinated Entry System Subcommittee is responsible for the HUD-mandated development and implementation of a Territory Crisis Response System, or Coordinated Entry System. that provides an assessment, prioritization, referral process for homeless and persons at risk for homelessness to access housing and needed services. The USVI Territorial Crisis Response System is currently case conferencing referrals from the Continuum of Care Council agency members to determine eligibility and referral to the HUD-funded VI Housing Authority Emergency Housing Voucher Program. The Emergency Housing Voucher Program mandates that all referrals must come from the Continuum of Care Council. The VI Housing Authority has been issued 20 tenant-based permanent housing vouchers for the use of the territory. Through this crisis response system case conferencing process, the COC has approved 14 applications for referral to the Emergency Housing Voucher Program. This crisis response case conferencing review team is comprised of private and public service providers. DHS and the VI Housing Authority are the lead agencies for the VI Interagency Council on Homelessness, a public-private collaborative that is charged with developing policy and strategy to end homelessness in the USVI. We Access to Services Subcommittee is developing a work plan identifying at least 2 prioritized service areas and funding to develop these services in fiscal year 2022 to address the demand for homeless services. We have representation from the Department of Health, Housing Finance, DHS, and nonprofit organizations serving as the Access to Services Subcommittee that meets on a monthly basis. I've included a chart of the point in time for the Virgin Islands count of the homeless population in the territory from 2009 to 2019. Based on HUD-mandated USVI point-in-time count data organized by the USVI Continuum of Care on Homelessness, in 2019 there were 314 persons or homeless, of which 232 were unsheltered and 82 were identified as chronic homeless. Chronic is defined as a long-term unsheltered homeless experience and may suffer from either a mental health disorder and/or mental health and/or substance abuse disorder. In 2021, 174 homeless persons were counted, of which 111 were unsheltered. Does that really mean that the unsheltered homeless has decreased? Not necessarily, and we say no. It means that the point in time count was not necessarily staffed sufficiently nor prepared in this COVID-19 environment to count the unsheltered homeless during the January event. Anecdotal observations support that the unsheltered homeless is higher than 400 in the territory. Nonprofit homeless services providers that work closely with DHS report 5 to 6 calls per week requesting assistance for sheltering homeless persons, accessing a monthly clinic hosted by nonprofit agencies and church organizations, and nonprofits providing meals to homeless in the community monthly. The demand for overnight shelter, transitional housing, and permanent supportive housing and affordable housing far exceeds the available resources. The subpopulations of those identified as homeless is indicated in the chart above, references the 2009 to 2013, and provides the following areas: the unaccompanied youth, adult survivors of domestic violence, person living with HIV or AIDS, chronic substance abuse, and the severely mentally ill. Solutions, the community will. It is imperative that the USVI community demonstrates the willingness to address the causes of homelessness by funding much needed preventative programs to address the needs presented by the unsheltered homeless, the sheltered homeless, and persons at risk for homelessness. There, but by the grace of God, a person does not wake up and say they want to be homeless. It happens because of circumstances of life, whether it be errors in judgment, economic troubles, suffering from mental illness without appropriate treatment, or making a series of bad decisions. It can happen to anyone. The government must also establish a territorial policy that sets the framework to establish a system to identify and prioritize need, identify and fund services, and establish service standards to ensure that high-quality services are provided in our community. Services that to build a continuum of care to address homelessness would include behavioral health services. As indicated earlier today through the testimony of the Honorable Commissioner Justa Encarnacion Ortita, behavioral health services are crucial. It includes mental health and substance abuse services, residential inpatient treatment, outpatient treatment, and peer support programs. Target outreach programs. The chronically homeless benefit from targeted outreach programs that require trained staff to provide continuous contact and check-ins daily or weekly to build rapport for possible transition to shelter. A successful targeted outreach program has trained staff who in the following areas: motivational interviewing, stages of change, cultural competency, de-escalation techniques, confidentiality assessment, and appropriate documentation. The use of the Department of Health mobile van or mobile unit to offer healthcare screenings and mental health and/or substance abuse assessments, COVID testing, and vaccinations, of course mentioned this morning, could be a part of the coordinated health outreach program with private service providers as well, offering services where people live, prevent more acute illness, and thus supports reduced costs to the community healthcare system. The drop-in center, a designated space where the unsheltered could come in for the day to be removed from the business areas for the day and provided a meal, a shower, a medical checkup, mental health services, assessment, and referral for services. Outreach workers, police can bring persons from the street to the locations when needed. Sheltered homeless persons can come in for assistance with access to housing and employment. An overnight shelter would provide a safe place for sleeping only. Clients are admitted at 7 p.m. and are discharged at 6 a.m. Overnight drop-off for the police would be an option. Offers opportunity for bed and a shower and a meal and access to services through assessment and referral in a safe place from the street during the night hours. This should be considered gender-specific sheltering sites. The permanent supportive housing. This level of housing will end homelessness in the U.S. Virgin Islands. Persons who have housing and the appropriate support systems will have successful home management experiences. The support system can include behavioral health, including mental health treatment and substance abuse, assistance with disability, in-home elder care, etc. The Housing First model utilizes this type of housing strategy to ensure that persons transitioning from unsheltered homeless status and have special needs can be successful in a housing experience. Affordable housing. And an adequate inventory of affordable housing will assist those at risk for homelessness, allowing persons to move to appropriate to the economic ability of the household without fear of ending up in a shelter or couch surfing with friends and relatives living on the street. Staffing and sufficient compensation. There's also a need to build a staffing capacity. There's a need to fund certified mental health workers and certified substance abuse counselors and trained outreach workers and case managers, like stated earlier today, and ensure that compensation is a living wage. Working with vulnerable populations is challenging and requires appropriate compensation is needed to develop a field of personnel. It does take a village, a comprehensive continuum of care with an array of services provided by government and nonprofit agencies. All players must be at the table. Bottom line, a coordinated systems approach, rapid rehousing, assistance for the most vulnerable, permanent supportive housing, designing a crisis response, and increasing employment and income are all ways to help end homelessness in the Virgin Islands. We can do this, but we have to have a committed effort working on it daily or weekly. Chairperson Francis, the Department of Human Services, committed to providing social services that will enhance the quality of life for individuals and families with diverse needs and empowering them towards self-sufficiency. As stated before, we obviously cannot do this alone. I would like to take this opportunity to personally thank our Virgin Islands Department of Human Services team of professionals who have been without a doubt on the front lines providing direct services to our Virgin Islands people throughout the COVID-19 pandemic. We truly appreciate the continued effort and support of Governor Albert Bryan Jr. and Lieutenant Governor Tregenza Roach and this legislative body as DHS continues to be committed to our motto of working together to make a difference. At this time, we welcome the opportunity to respond to any questions you may have regarding our remarks today, and our team stands by. Thank you, sir.
Thank you very much, Commissioner Kazi Gomez, for your testimony there. And next we'll go to Malik Stradiran, and then we'll wrap up today's testimony with Dana Clinton. Malik?
Good day, Senator Novell Francis, Chairman of the 33rd Legislature Committee on Health, Hospital, and Human Services. Committee members, the viewing and the listening audience. My name is Malik Stradiran, and I am the Executive Director for 10,000 Helpers of St. Croix, Inc., located on St. Croix, Virgin Islands. 10,000 Helpers of St. Croix, Inc., better known as TPH, is a 501c3 nonprofit organization established in 2002. This agency focuses on transitioning homeless, mentally ill men with or without substance abuse issues back into society within 18 months. The mission recognizes the devastating impact of mental illness on individuals, family, and friends, and recognizes the isolation and the social rejection that the condition triggers. As a result, 10,000 Helpers is committed to assist in creating an environment of caring and hope in our community, which would encourage healing, recovery, and acceptance. 2 programs have been in operations at 10,000 Helpers, Project Sunrise and the Drop-In Center are each program. Project Sunrise is an 18-month residential program that provides apartment-style living for 10 male clients referred from any agency, families, hospitals, rehabilitation programs, detoxification centers.
Yeah, I think we have Malik, you might be frozen. Okay, he might need to log off and log back on. At this time, we'll go to the Virgin Islands Housing Finance Authority, Dana Clendenin, to begin her testimony.
Good afternoon, Senator Novelle Francis,
Good
Chair of the Committee on Health, Hospitals and Human Services, committee and non-committee members present, and our listening and viewing audience. At your request, we are here to provide insight into the Virgin Islands Housing Finance Authority's role in addressing homelessness in the territory in the areas of emergency housing and shelters. My name is Dana Clendenin. I'm the Chief Disaster Recovery Officer. And joining me today are Mr. Darren Richardson, Chief Operating Officer, Ms. Valdez Shelford, Chief Financial Officer, Ms. Ann Hanley, Director of Programs for CDBG-DR, Ms. Janine Hector, Director of Federal Programs, and Brenda Harrigan Waller.
And obtain a hot meal as a result of Hurricane Maria damaging to the building has now allowed us to have limited services.
Can you please mute media? Yeah, we got a message to him. Yeah. Go ahead, Ms. Clendenin.
We impact a range of populations by providing support for the development and operation of emergency shelters and transitional housing, management of the territory's emergency housing stock, and the development of permanent housing units. As we assure you'll all agree, the issues of homelessness, however, is larger and more complex than we often acknowledge. Our local homeless population runs the gamut, starting from those who are chronically homeless to those who are more transient, often taking up refuge on a friend's couch or in an extra room, and also includes those living in severely overcrowded or substandard housing conditions as a result of a natural disaster, job loss, or other financial hardship. A gap analysis was conducted in 2019 that quantified the territory's need for resources in the various categories: emergency shelter, transitional housing, rapid rehousing, permanent supportive housing. This analysis revealed a significant need in the area of permanent supportive housing, close to 500 units, which would include appropriate support systems and wraparound services to ensure that the needs of the residents are met. Examples range from behavioral health services, including substance abuse treatment, to in-home assistance with daily tasks. The Virgin Islands Housing Finance Authority is a collaborative applicant for the VI Continuum of Care, COC. It's a cooperative of stakeholders committed to addressing the problem of homelessness in the U.S. Virgin Islands in a comprehensive, holistic manner. The COC conducts data-informed strategic planning, advocacy, and education on behalf of the homeless and at-risk populations. COC has oversight of the territory's crisis response system, the Homeless Management Information System, and supports capacity building for service provider agencies to ensure the provision of housing and services in compliance with federal regulations. Presently, the COC is working toward establishing a coordinated entry system as mandated by HUD to ensure that persons in crisis have easy access to homeless crisis response system and receive a standard assessment. The COC also created crisis response system review team that developed the process for assessment, prioritization, and referral for suitable candidates for emergency housing vouchers awarded by HUD as a supplement to the territory's Section 8 vouchers. These are specifically meant for individuals and families without homes. During testimony before this body in 2018, the need for the reestablishment of the Interagency Council on Homelessness was discussed. The Interagency Council is an advisory board that seeks to establish public-private sector collaboration to prevent and end homelessness in the Virgin Islands through policy and resource development. As the foremost territorial resource for homelessness planning and policy development, the Council would advise the Governor and Legislature on issues related to homelessness and provide recommendations for collaborative efforts and policy initiatives in implementing programs to meet the needs of the homeless. The most recent meeting was held this past November. Members of the Council on Homelessness represents the Office of the Governor, Department of Human Services, Housing Finance Authority, Legislature of the Virgin Islands, Department of Health, Department of Labor, Office of the Attorney General, the Schneider Regional Medical Center, the Wong F. Louis Hospital, Superior Court of the Virgin Islands, the Virgin Islands Police Department, Bureau of Corrections, VI Fire Services, Office of Veterans Affairs, the St. Thomas St. John Chambers of Commerce, the VI Continuum of Care, University of the Virgin Islands, Frederickstead Healthcare, Inc., St. Thomas East End Medical Center, and the St. Croix Mission Outreach, Inc. The Access to Mainstream Services, a subcommittee, has been formed to develop a work plan to determine priority services and identify funding for which nonprofits may apply to fund those identified services. The committee meets monthly. Next scheduled meeting is February 15th. The Emergency Solutions Grant. It's a federal formula allocation block grant. The ESG program provides grants to state and local governments for 1. The rehabilitation or conversion of buildings for the use as emergency shelters for the homeless, for the payment of certain related shelter operating expenses such as maintenance, operating costs, rent, repairs, equipment, utilities, insurance and furnishings, and also for expenses related to the provision of essential services such as emergency health services and ground transportation for persons housed in shelters. 2. Provision of street outreach services for unsheltered chronically homeless persons. 3. Homelessness prevention and rapid rehousing services for qualified persons who are literally homeless or at imminent risk of homelessness. And 4. For qualified expense associated with the administration of the Homeless Management Information System. ESG funds are typically subgranted to non-governmental entities which operate homeless programs within the territory. ESG funded activities through nonprofit subrecipients total a little over $48,000 for fiscal year 2021. They included the St. Croix Mission Outreach. They used the funds for the ESG Homeless Prevention Rapid Rehousing Program and the operation of its men's shelter known as Genesis House. Funds were used to pay operating expenses for the facility, including rent, utilities, materials, supplies. Catholic Charities helped 3 ongoing rental assistant clients under its homeless prevention program in the St. Thomas St. John district, while the Women's Coalition of St. Croix used ESG funding to support the operations of its Sojourner House safe shelter for victims of domestic violence. Funds were used to pay for shelter, operating expenses related to insurance, utilities, and materials supply. Emergency housing. Hurricanes Irma and Maria significantly impacted the territory's limited emergency housing stock. To address the needs of the community, existing facilities must be brought back to pre-storm conditions and the resilience of those facilities increase. There's also a need to expand facilities to accommodate requests for emergency housing, along with homeless individuals, and to pursue permanent supportive housing, transitional mental health services, and substance abuse services for this population. The IHFA's emergency housing units on St. Croix, in Anna's Hope, Estate Prophet, and Campo Rico sustained hurricane damage and are in various stages of repair. Also on St. Croix, the 18-unit Carnegada Inn was acquired by VIHFA. Staff continues to finalize the application for DR funding for those repairs. On St. Thomas, we currently have 23 existing housing units between two properties located at North Citavit and Hospital Ground. Of these 23 units, only 3 units in Hospital Ground are currently unoccupied, but all are in need of repairs. The scopes of work for 3 unoccupied units have been completed. Also on St. Thomas, the authority has begun the process of adding a total of 28 emergency housing units on St. Thomas. The first project identified is located in Estate Tannenberg and will consist of 1, 2, and 3 bedroom units. The IHFA has completed the architectural plans for the 12-unit building, and the project, like Carnegada Inn, is in the application approval process. Future emergency home development will be located in Estate Anna's Retreat, which will consist of 16 units. Finally, in 2019, the IHFA acquired the former Villa Morales property to be developed as a campus that will offer emergency shelter beds, units of transitional housing, and also units of permanent supportive housing. The project concept is modeled after a successful program on the mainland known as Community First, where the facility provides not only housing, but also resident services such as meals, wraparound case management services to include medication management and skills training through various collaborative partnerships. The property is currently being operated by Liberty Place, a local non-profit subrecipient, and is currently serving 15 residents. The property will require rehabilitation, and CDBG funds have been awarded for this purpose, and a solicitation will be developed for architectural services. Funding for all repairs is categorized accordingly: the Federal Emergency Management Agency Public Assistance or Community Development Block Grant Disaster Recovery Funds. Under CDBG-DR, they have interviewed community stakeholders and nonprofit organizations to gather firsthand knowledge and expertise on engaging and serving the homeless population, including those experiencing mental health and substance abuse challenges. Other information sources include data from the Homeless Management Information System, HUD Home Income Limit, and the U.S. Virgin Islands Housing Inventory Count Report. Information on pre- and post-disaster services was requested, and research on similar programs in other districts was considered for this development. The IHFA will fund 3 additional projects with the goal of increasing emergency housing, providing resilient public facilities, reducing the number of homeless persons, increasing the availability of mental health and substance abuse services, including providing available safe and sanitary shelters, and more importantly, providing increased support for vulnerable population. These projects are the Catholic Charities of the Virgin Islands. They are a nonprofit 501c3 agency that provides social services and counseling to the homeless and less fortunate in the territory for over 60 years. The organization is governed by a board of volunteers and staffed by compassionate and experienced individuals. As a Catholic charity, they put faith, integrity, compassion, and kindness at the core of everything they do. Catholic Charities of the Virgin Islands proposes to create an emergency shelter in Frederiksted, significantly repair damaged transitional housing in Christiansted, and construct a new shelter in hospital ground on St. Thomas. These facilities are proposed to aid and assist residents that are homeless and in need of emergency shelter year-round. In emergency situations with the threat of hurricanes, it is the hope of organizational leadership to provide shelter to those that may need it until the storm passes. A program will be implemented to provide meals, clothing, transportation, and case management to assist clients out of the homelessness into permanent housing. Methodist Training and Outreach Center. Methodist Training and Outreach Center Incorporated provides support services for homeless and coordinates services and resources to comprehensively address the needs of the homeless population, emancipated youth, veterans, and families with children. They establish and maintain a central database of local statistics and the population. They work with service providers, community-based organizations, and community leaders to maximize services and minimize gaps. They also promote community awareness and education regarding the issues of homelessness and the condition leading to it. The Methodist Training and Outreach Center, Inc. proposes to create a day shelter on Comprinsensgata, St. Thomas, providing hot meals, showers, and clothing during the day, and provide emergency shelter for homeless and at-risk individuals. 10,000 Helpers of St. Croix. This agency focuses on transitioning homeless, mentally ill men with or without a substance abuse back into society within 18 months. The mission recognizes the devastating impact of mental illness on individuals, families, and friends, and recognizes the isolation and the social rejection that the condition triggers. As a result, TTH is committed to assisting in creating an environment of caring and hope in our community that would encourage healing, recovery, and acceptance. The organization has proposed a renovation of its existing structure, which was damaged by a hurricane, and increased bed inventory. With these renovations, 10,000 helpers will resume normal operation, providing transitional housing, emergency shelter, drop-in services, case management, and referrals. Senators, the authority hopes this helps shed some light on the status of current projects, our partnerships with local organizations working to combat homelessness, and our efforts to bring more emergency housing units online. Thank you for the opportunity to add to the discussion, and my team and I look forward to answering any questions you may have.
Thank you very much. Chief of Disaster Recovery, Clendenin. We're going to try Mr. Stradaren once again. Malik. Mr. Stradaren. Okay. We'll allow him to complete his testimony once he's able to get back on. He was having some issues, technical issues. At this time, colleagues, we have heard all of the testimony for block number 2 and 3. And I'd like to open the floor up for a 6-minute round. And we'll start with you, Senator Villela. You're recognized for your 6 minutes.
Thank you so much, Mr. Chair. Before I ask specific questions, I'd like to ask Commissioner Gomez-Kazi if... Kazi Gomez. Just mixing it up a little bit. If they were able to make good on payments to all those individuals who were in acting positions, and if that issue has now been resolved?
I thank you, Senator Villela, for the information and question. We actually have 13 that are currently outstanding for $58,000. We just sent it back to OMB because they asked for additional information. So majority have been, only 13 are outstanding.
And you expect to have those resolved by when?
As soon as we can coordinate with OMB about the information they need, it should be able to resolve. The funding is there. And we just received, I believe it was yesterday, for an additional information. So we'll work with OMB to get it done as quickly as we can.
Okay, and those individuals who are acting, they are now permanent in those positions, or they're still acting?
Great question. I will just have to double check. Not all of them are acting. Some are in monies owed, but I'll be happy to allow Deputy Commissioner Rojas to answer. Is that okay?
Yes.
Good afternoon, Senator Violet. This is Deputy Commissioner Rhoda Rojas in regards to the question. We actually have 2 individuals moving currently into their permanent positions that were acting. Their positions were approved, so we have that going. By the end of everything that we have, because we have others that we're still waiting for the PRFs to come back, we should only have 2 individuals acting or 1 individual actually acting, because that one is in the correction officer YRC unit, and that one we have to address as far as getting a position in that unit for that person to either move into or have another person move into the role and remove that person from acting. So there's still a couple things that we have to do, but for the most part of all the individuals we had acting, they are in the process of moving into their roles.
And those who are still in acting positions, do they have a letter verifying that they're acting? We have individuals that are serving in a certain capacity and we don't have any documentation?
To my knowledge, at this time, I don't have anybody who is in a role acting that does not have a letter.
Okay, I think we really need to get this resolved as quickly as possible. It's been an issue that we have been trying to correct for a long period of time. Some of those individuals, I think the longest was acting for 10 years. So we want to make sure that you are well staffed and that the individuals who hold leadership positions in the Department of Human Services are actually in the position and not still acting. Now, with reference to Head Start, your Head Start has resumed 100%? Or any days of virtual?
Much. We're doing a hybrid approach for most of it, but it is in person, yes.
So 100% back in person.
AC Benjamin is on, and I'll allow her to answer fully to make sure that all classrooms are 100% in person.
Good
3
afternoon,
minutes.
Assistant Commissioner Benjamin. Yes, we are back fully in person.
The Head Start by Herbert Grigg, have they fixed the water issue? They did not have water for a long period of time. Has that been resolved?
No, that issue has not been completely resolved because it actually is will require a capital project. The problem presented itself due to low water pressure when using potable water. So we're trying to resolve the issue by remediating our ability to use cistern.
Are those students still in that facility? Are the students still in that facility?
That would be Kings Hill 1 and 2. They are back, yes.
So what are they using for water? For flushing and everything else, what are they using?
There's water there. The issue that presented itself sometime after November, and I'm going to check with the assistant administrator on St. Croix, but the issue that presented itself during coming on to the end of last year was a low water pressure issue, not necessarily.
Okay, so my question was, has it been resolved? It doesn't make a difference to me if it's cistern or portable. I just want to know if there's running water in the facility for the students and the instructors to use on a regular basis.
No issue has been reported to me, Senator. If the issue was ongoing, it would have come to my attention. So let me check with the assistant administrator on St. Croix so that I don't put anything out there that's wrong information.
Okay, please, before the end of this meeting, I know that there was a problem up there for over a month in which it wasn't regular water running. Commissioner, I saw your statement that borders at the hospital are not wards of the state. What are they, wards of the hospital?
Actually, no. We don't have guardianship over any of them. So they're actually citizens of the Virgin Islands that are in the hospital that have unsafe discharges, like they stated in the last hearing.
Yeah, but there must be a plan there. There are citizens of the Virgin Islands who has been abandoned at the hospital and don't have the ability to be checked out and go home and take care of themselves. So they have been at the hospital some longer than 2 years. Who is responsible to remedy that situation? Wouldn't it then be the government of the Virgin Islands because they have been abandoned? Some of those individuals have social security checks that are coming in, but yet they are left abandoned in the hospital. So isn't it the responsibility of Human Services to go and find out the circumstances relative to those individuals, and if we have to provide an alternative for them and become their custodian and garnish the check? It's so unfair. You have people there and somebody's collecting a social security check or retirement annuity, and the individuals are left in the hospital abandoned.
1 minute.
I'll allow Assistant Commissioner Mikhail Rama-Brown to answer, but I agree with you 100%, and it's a collaborative approach. So just because they are in the hospital, we are working with the social services, but I'll allow AC Rama-Brown to assist with the answer.
Yes, Mikhail Rima-Brown, Assistant Commissioner with oversight of the Senior Citizens Affairs Division. And our Adult Protective Service social workers work closely with the hospital's Senator. As a matter of fact, currently there are about 5 in the Juan Luis Hospital. We are about to take 1 of those boarders. In St. Thomas, we have 10. We have arranged for a Lucinda Millen home transfer nursing support services and coordinated with family to take back 2 of those 10. 1 of the boarders has behavioral health problems and would not be a suitable placement at the Herbert Grigg or the Queen Louise home. So our social workers work very closely with both hospitals with the border issue.
Do we need to work a little closer because some of them have been there forever? We need to make sure that we have a plan to deal with those particular individuals who have become boarders at both hospitals. And we have 5 on St. Croix where we have very limited room. So because of those 5 boarders, you have individuals that stay in the emergency room for extremely long period of time because there are no rooms. I don't even think we have 30 rooms at the St. Croix Hospital. So taking up 5 beds is a lot. But I'm glad you mentioned social workers.
Time.
The University, with your daughter, Mr. Chair, the University of the Virgin Islands now have a Master's in Social Work program. Are those students interning at Human Services? Have the social workers that are now, let me rephrase it, the social workers employed at Human Services, are they amenable to having student interns from the University of the Virgin Islands?
Assistant Commissioner Carla Benjamin has been working, and I would like to respond to the border situation since there's 2 questions. So AC Benjamin, go ahead with the coordination with the students at UVI, please.
Good afternoon, Assistant Commissioner Benjamin. The Department of Human Services had as many as 6 interns last school year. I believe we had 1 last semester, probably still have 1. The social workers at the Department of Human Services, even though they might be amenable, I believe that's the word you used, may not meet the qualifications, because not only do you have to have a Master of Social Work degree, it has to be a Master of Social Work degree from a CSWE accredited university, and not every university meets that. So there are a few of us, myself included. I had three interns. That's a heavy lift. So yes, they are, and as we are able to, we do.
So do you have a MOU with UVI for the placement of students at DHS?
Short answer, yes. I have Chief Legal Counsel on as well, but we do have an agreement with UVI.
Okay, I think you need to check legal counsel. I'm not sure if you have a MOU with the university. Is your HR department closely tracking those individuals at the university to be able to offer them employment when they complete the program?
Are we, no, sir. We're not. We don't have enough staff to do what we're doing in-house, much less track what UVI is doing currently. Once our positions are vacant, we'll actively search. But those that are graduating will have to also be licensed to become a social worker. So they'll have to pass the exam to be eligible for the position.
Okay, and I know that they would have to be licensed, but the intent of that master's in social work is to make sure that they are licensed and then they get employment right after. And we definitely need for DHS to have a close relationship with the university so that we can naturally transition those employees there. And I think I had received information before that there was not necessarily a MOU which DHS and the university. I'll reach out to Dr. Hall and find out if in fact you have one executed.
Sure, I'll be happy to check. I saw him this morning on the plane, but I'll be happy to check.
And my last question, Mr. Chair, in reference to, I saw your testimony, I can't remember you're speaking about Herbert Gregg or Queen Louise, where you said it would take between $900 to $1,620,000 for the 15 individuals to be housed. And then you went on to say, approximately $2,500 at the Herbert Gregg home for the age?
Yeah.
What's the last disparity? We already $2,500,000. We already have staff at Herbert Gregg. We'll need to add some additional staff and equip some additional rooms. But the cost is actually $1 million more than being able to ship them off island, or almost $1.6 million more if you look at the low end to have the 15 individuals stay on island.
So thank you for the question, Senator Belay. So there's two options. One is to try to find an off-island placement that will take them. And then right now during a COVID experience, we've had difficulty with them accepting. The secondary is that we do have a wing at Herbert Gregg that with minimal adjustments right now, maybe about $400,000 or $500,000, we can get that ready. But then we would need the staffing to accommodate an additional for 11 beds, so which would put us back at about 36 beds. So right now we wouldn't be able to accommodate until we get staffed up, supplies, and minimal action as far as the rooms are ready.
400,000 to prepare 11. So 400,000 and we can accommodate 11 additional individuals.
No, sir. No, sir. I have 457,000 approximately for a 0-ton machine, the beds, the canopies, the screens, the ACs for the additional the rooms to get it ready, and then an additional 1.2 million approximately for the additional residents. That would be operating costs, would be staffing and or supplies.
Commissioner, excuse me, the 1.2 million includes the 400,000.
Okay, good. My last is, are you in discussion with Wang Louis? Wang Louis is going to be transitioning to JFL North. They're going to be leaving a lot of equipment because JFL North is completely furnished. Is there any discussion with Wang Louis for the use of those beds that are usable, or the use of any of the equipment?
Great suggestion on my hospital huddle this week. I will definitely bring that up without a doubt. But thank you for bringing that up. I'll make sure that I bring that to the hospital huddle. Chairman Francis, may I respond to the MOU with UVI? Chairman Francis, may I respond to the MOU question?
Yeah, you may. You may. So.
We haven't executed.
I'm just thinking about this hospital equipment. So, okay,
I know.
I'm in days with this hospital equipment thoughts. Go ahead.
I was like, whew. I was like, ding, ding. So UVI, we actually have an executed MOU for 2 years that was executed August 31st, 2021 for students. So I remember signing it. So yes, we do have an agreement in place with UVI.
Very well. Commissioner, I wanted to revisit before I allow Malik Sridharan, who I see is back on. I wanted to again revisit that issue of the borders at the hospital and who's ultimately responsible for ensuring that they become the ward of the state. Isn't it the responsibility of Human Services to petition the court for that purpose?
Only if it is. Some family members will not. It has to be deemed appropriate by the court, but we can go for guardianship. But some family members may go against that.
Well, you would want that. You want them to go against it and be able to prove their case, because then they'll be responsible for them for the borders.
Agreed.
So yeah, so we really need to pursue that and at least petition the court to start the ball rolling. But we'd love for all of the family members to actually then intervene and take responsibility because that's exactly what the hospital wants. Okay.
Well, the other issue, it has been like we talk about capacity and receiving them. So yes, I know that they're at the hospital, but until recently, we haven't been able, because Senior Citizen Affairs just moved to Mars Hill and Frederiksted, so that space wasn't even available for us to expand to even incorporate the 11 residents that we talked about at Herbert Grigg, and it costs money. So if we get the funding, we'll be able to happy to expand.
But that's understood. But even while they're at the JFL or Royal Leicester Snyder Hospital, they still need to become the ward of the state because, again, family members are able to receive those Social Security benefits and other financial means while the GVI is responsible for caring for them. So again, if we want to really stop that from occurring, they need to become the ward of the states or at least we become the guardian of those individuals.
Agreed. And so our APS unit is working diligently with the hospital and their social services unit there. And the other thing is that the hospital could, charge them for a portion of it as well. And their funding from Social Security could go towards payment.
Yes.
But Member Brown, do you have anything extra for that aspect?
Okay. But the only authority they'll have, again, it needs to be court sanction. But in fact, even if they're going to charge for them, they need to have that court sanction to support the endeavor. But I see Malik Sridharan is back on. I'd like to go ahead and get him to put his testimony record, and then we'll resume with my colleague's questioning. Malik?
Can y'all hear me now?
Yeah, we've been ready for quite some time. You're the one that was freezing up on that end, Mr. Sridharan. Go ahead.
I apologize. Let me try to get this out of the way very quickly, please. Okay, once again, good day to Senator Francis, the chairman of the 33rd Legislature Committee on Health, Hospitals, and Human Services, committee members, the viewing and the listening audience. My name is Malik Sridharan, and I am the executive director for 10,000 Helpers of St. Croix, Inc., which is located in St. Croix, Virgin Islands. 10,000 Helpers of St. Croix, Inc., better known as TPH, is a 501c3 nonprofit organization established in 2002. This agency focuses on transitioning homeless mentally ill men with or without a substance abuse issue back into society within 18 months. The mission recognizes the devastating impact of mental illness on individuals, families, and friends, and recognizes the isolation and the social rejection that the condition triggers. As a result, 10,000 Helpers is committed to assist in creating an environment of caring and hope in our community, which would encourage healing, recovery, and acceptance. 2 programs have been in operations at our facility. Project Sunrise and the Drop-In Center are each program. Project Sunrise is an 18-month residential program that provides apartment-style living for 10 male clients referred from agencies, families, hospital rehabilitation programs, detoxification centers, and self-referrals. Residents engage in the following. We provide case management services to include recovery of identity documents, such as birth papers, driver's license, obtaining food stamps for the Department of Human Services, making and keeping all health appointments to address medical needs, and the resolution of any pending legal issues. Referral to the Department of Labor to prepare and search for employment, provision of informational educational assessment to determine residents' needs for educational and academic skills training, biweekly meetings or more frequent when necessary to discuss matters of group living. Individuals and small group meetings as needed to address conflicts and interpersonal difficulties amongst the residents. weekly staff meetings to discuss the progress of each client in order to monitor client needs and progress, and inputting and updating information in the Homeless Management Information System known as the HMIS system. And we're proud to announce that we've audited and have been passed during that period. Under Project Sunrise, our goals and objectives are to provide a transitional residence with the purpose of preparing residents to become self-supported and to live independently in permanent housing by providing shelter and safety, as well as rehabilitation and training. The Drop-In Center Outreach Program offers anyone off the street to be able to take a shower, change into clean clothing, and obtain a hot meal. But as a result of Hurricane Maria, damages to this building limited services are ongoing. The work of 10,000 Helpers, Inc. is in support and collaboration with the Center for Independent Living, Catholic Charities, the Village, St. Croix Mission Outreach, BIPD, the Department of Human Services, the Office of the Magistrate, Women's Coalition, NAMI, Alcoholics Anonymous, Neighborhood Pharmacy, Frederickson Health Center, the Disability Rights Center, just to name a few. 10,000 Helpers of St. Croix, Inc. advocates for persons who are homeless, mentally ill, or disabled, and seeks to educate the public about homeless and mental illness, and empowers the mentally ill and homeless to make transition to a functional life. The island of St. Croix is plagued by individuals who, because they are homeless and mentally ill, present a problem in the community. They may appear as vagrants, carry an offensive odor, being loud and disruptive at times, and carry bundles of their personal property as they move from place to place. To compound this situation, there are no temporary shelters on the island. Therefore, the community is seeing an increase of street people popping up throughout the island. 10,000 Helpers will provide a place where these individuals are able to shelter in place to avoid the spread of COVID-19 and receive help in a supportive environment. 10,000 Helpers tend to seek the needs of homeless people urgently to ensure equal protection against the virus and the protection of the greater community. As a result, the aim of the program will provide immediate housing, we provide immediate housing to chronic homeless people living rough and on the street. We provide accommodation for physical distancing, self-isolation, quarantine, and other health services, supported with access to privacy, water, sanitation, food, medical, psychological services, and testing. Ensuring the distribution of information on COVID-19 and provide access to non-discriminatory and cost-free healthcare and testing. Guarantee access to showers, toilets, hand washing facilities, and products used to sanitize. Provide homeless persons showing virus symptoms and those who test positive for coronavirus with a safe place to stay. Immediate medical attention, access to food, and any necessary support to make sure that they can manage quarantine and self-isolate. Ensure that food banks and other service providers for homeless people is equally distributed, such as food, health information, masks, hand sanitizers, and any other necessary personal protective equipment that is required for safety. 10,000 Helpers came up with an idea to provide emergency shelter to individuals who are homeless, mentally ill, and have substance abuse problems. Considering the current pandemic, a lack of access to adequate housing presents a potential death sentence for people living in a homeless that are living homeless and put the broader community at risk. COVID-19 challenges not only our own ability to stay home, but the ability of the homeless to do the same. Funding in the amount of $100,000 would allow for the homeless to be housed in temporary trailers on the 10,000 Helper site in Hospital Street, Frederickson. St. Croix Administrator Sanis has been working side by side with myself and numerous homeless and mentally ill cases. His passion, dedication, and drive are beyond words. Administrator Sanis held a meeting between the Office of the Governor and our agency, and at that time we were able to discuss our concerns and came up with solutions. An agreement was made for us to partner with the Governor, with the Office of the Governor, and they were impressed that we did not only have concerns, but we actually did groundwork and had solutions which came with all costs. We presented project abstract and were able to obtain $32,500 from the CARE Act Fund to assist in starting the first phase of this project. The final estimate came to $100,000. Our agency has applied for grants and have been seeking financial assistance from private donors and members of the community. Project abstract in completion will be 240-feet shipping container trailers transformed into 8 single-unit rooms, 2 separated bathroom units fully equipped with a shower, sink and toilet that will be sectioned off for both male and female. Everything from the entrance to the bedrooms and bathroom will be ADA certified, and we have pictures that are on the testimony showing the work that has already started. This structure will house both homeless male and female who would need a place to quarantine once diagnosed with COVID-19. It will also be used as a daily shelter, like the Commissioner of DHS stated, for anyone who is in need of shelter for that day. Basically, it is a first come, first served daily, and you will have to sign in and out at a certain time. This project started from January 2021 and is on hold as we are waiting on the responding to get this project completed as soon as possible. Our main building is a historic building, and due to all the damages incurred by the storms and some damages made by our clients, we also have some major repairs that are needed for not only the safety for our clients, but our staff also. I'm very pleased to say that Mr. Dan A. Derima, Supportive Housing and Sheltering CDBG-DR Program Manager for the Virgin Islands Housing Finance Authority, was able to find a grant that our agency fits for that criteria. This grant will allow us to make all necessary repairs and upgrades needed to our historical building. Mr. Derima, who is a very strong advocate for veterans and also for the less fortunate, vowed to work side by side with our organization to make sure all documents and contracts are done correctly, and want to be a part of making sure that our years of crying for help is finally answered. When everything is completed, our numbers will upgrade from 10 rooms to 18 rooms. The additional 8 rooms are well needed and would truly make a great impact in assisting more, as the numbers have increased triple and is still increasing every day. Some concerns we have is our agencies have never been invited to join the Council on Homelessness. The government opens its doors at 8 a.m. and shuts at 5 p.m., while nonprofits are open 24 hours. The community have expressed that they feel more secure and have a better relationship with nonprofits. The nonprofit doors are basically open 24 hours a day. Majority, if not all, the clients that fit this population have actively seek help with a nonprofit or have some type of interaction. Who else will be better to assist in giving insight on this issue in this council other than the organizations that do this each and every single day? A second concern seems to be an issue still with everyone's role in how a 722 code is supposed to be done. I suggest that some information be given out to the public as to exactly what a 722 is and all details behind it, such as what form has to be filled, where you can access this form, when the 911 operator call, what should be told to the operator, the role of the VIPD as it relates to a 722. That one is very important. Some officers say one thing and others say another. After VIPD transports the individuals to the hospital, what is next? Detailed information and some PSA and ads to educate the community is needed. HIPAA law violation. Too many pictures and videos are being taken and circulating all over social media and groups without consent. This is a major problem that needs to be addressed. Last but not least, what plans are being made during preparation of storms, not just for hurricanes, for the homeless population, just like we have flooding this weekend. We tend to forget about this population when the weather is announced to have a flash flooding. Also, decisions on shelters being open or not during hurricane seasons are made without thinking about the homeless individuals. I will end by saying thank you for the opportunity for me to be able to participate, and I'm here to answer any questions. And thank you, Senator Francis, and your committee.
Thank you very much, Mr. Sridharan. That was very good information shared here. So what we'll do is resume our 6-minute round, and so that my colleagues could be able to continue to query the testifiers. Senator Blyden, you're recognized for your 6 minutes.
Thank you so much, Mr. Chair. Good afternoon. Again to my colleagues, good afternoon, testifiers, and thank you so much for your testimonies. Mr. Sridharan, thank you for what you continue to do on behalf of those that less fortunate, in particular the homeless population. My line of question is going to be different, because based on the testimony, it will seem like we have a lot of funding, we have a lot of opportunities, and so on and so on. But at the end of the day, I get calls every day in my office, every day. I reach out to the different agencies and non-for-profit organizations, and many individuals still can't get no help. Cannot. And that's the problem. So I want to speak to coordination, collaboration, communication. Because based on the testimony, Commissioner Gomez is stating that the last meeting with the continuum of care was in November. I'm not sure who mentioned that, whether it's Gomez or Clendenin. But I don't recall seeing any memo or anything to that meeting. I usually go to those meetings on a regular, faithfully. I don't recall seeing anything that came to my office, number one. Number two, when it comes to funding for some of those programs, I'm going to give you an example. Housing Finance Authority, they have a program that deals with emergencies, and I believe it's called Emergency Grant, Solutions Grant. That's the name of the program. But yet still the program is there, but it has restrictions in terms of the 30% threshold. You know, I sent several people there and not one got help. Not one. So we have a problem. And we got to find a way to basically see how we can assist individuals, and we need to have a sense of urgency, and we need to be more aggressive. Because I can only imagine how it feels to be homeless and that feeling of helplessness, you know, and we need to put ourselves in their shoes in order to have an understanding of exactly what they're going through, because it's not easy. And we must find every way possible to help them when it comes to us, find a way to help the people in. The rental assistance program, another disaster. The federal government gave us so many ways to assist individuals, to include self-attestation, and we're still not doing what we have to do in terms of finding a way through their regulations to assist people as they come to us for help when they're most vulnerable and most in need. And that's where we come in. That's where we have to put our resources, put our minds, put our heads together and see how we can assist these people. And I'm just frustrated, to be honest with you. I'm very frustrated because I get a call on a daily basis along with my colleagues. And it's like we're spinning wheels. You know, based on the testimony, it sounds like there's so much opportunities, but there aren't any because it's not working for our people. We need to find a way for it to work for our people. I know that the housing voucher program, that's another situation where to help people with that hard send down. And when I send individuals to a couple of the non-profit organizations, they themselves did not even know that those funds were there and that program existed. So there's a lack of communication. And we have the continuum of care. That's where it should be happening. That's where all the minds are supposed to get together and actually work out many of the solutions that we are speaking about and that we are trying to get to. But apparently it's not happening.
3 minutes.
And I urge everyone that has anything to do with assisting our most vulnerable population to really, really dig in the heels and start working together on behalf of our people. Because today for you, tomorrow for me. You know, many folks get in that situation for several reasons. And you know, life happens. But at the same time, when you're in a position to affect change, you must. And you must lead by example. We talk a lot, but we need to see more action. Action is where it counts. Take a walk. Go to some of the shelters. Spend some time there. Talk to the individuals and have an understanding of who they are, how they got there, what they're going through, and how it affects their families. It's not easy being homeless. It really isn't. And when you put yourself in their shoe, you react differently. And you move with a different pace. You know, and it's hard. It's hard. And I'm just urging, you know, everyone to do their part. I know the Emergency Solution Grant, there's a cap of $1,300. So even if folks qualify, but and we know rental right now in this district is so high, St. John also, even though they qualify, they can't get a place to stay because it's too high. So what do we do? Are there other programs that we can link into to assist those individuals in the meanwhile until we tackle that situation. These are the things I'm talking about. We got to be creative. We got to think outside of the box. We got to do things differently. And I know it could be done because with the rental assistance program, there are many things that needs to be done. We have started to do some of them, you know, and be creative with it, you know. I don't know. I'm just the testimony says a lot, but if you're on the ground like I am, you're not seeing any movements.
1 minute.
You're not seeing any movement at all. And it's like so frustrating when you send people for help, you know, you go through the process with them, you see when you qualify, you go and get the assistant, you call, they gone, come back more frustrated. I can't gonna help. Why? You know, there are little things that we can work through. I know we can do it together. And we must do it together because if we don't do it, who's going to do it for us? I'm not really asking any questions because, like I say, communication is the key, collaboration is the key, and we must be creative in order to help these folks because it needs to happen. You know, it really does. And I took some notes, and to include Department of Human Services before my time is up. You spoke a testimony to the SNAP funds for the students, and that it was expired in January. But many people called my office and told me they got a last check October the 16th, and they never received anything since then. Is there a reason for that? Do you know of that? With the funds? Can you?
Thanks for the question. AC Mikkel Reimer Brown will answer for you, Senator.
Please.
Good afternoon, Senator. Thanks for that question, Mikkel Reimer Brown, Assistant Commissioner. We are about to submit new application for the new school year. So that is when we get the approval from the Food and Nutrition Services, we will disperse the funding. But we are eligible from the day school opened for all students in eligible schools with school lunch programs to disperse the PBT, and that should be happening between February and March.
I'm happy to hear that, but at the same time, what happened, because during that time from October to now, folks were hurting, you know, so what happened?
Senator, when we have the new rules and regulations, we have to rewrite and resubmit our state plans. So we believe that the program will kick off very shortly, and the parents will get their full allotment for the days that their students were at home attending and not attending physical school.
And when will a state plan? When was the deadline to submit a state plan?
We've been getting the information from the Food and Nutrition Services for the last few months. The Virgin Islands has been very aggressive with the PBT program, but we must coordinate and get all of the information from our Department of Education, work with our partners with the federal government. The monies will be issued, Senator, but we really needed to have gotten the new rules and regulations, and we're working as quickly as possible to get the monies to the parents and the children.
I don't want to abuse my time, but I'll let my colleagues deep dive. But at the same time, I just want to state before I leave that February 15th is the next meeting for the continuum of care. I look forward to receiving my invitation. I look forward to assisting and bringing up solutions moving forward. Thank you so much, Mr. Chair, for the time.
Thank you very much. Point of inquiry, Senator Fred Gregory.
Thank you, Mr. Chair. The senator's question needs to be answered. I think he asked about a deadline, if there was a deadline for submission, and I heard everything else except yes, there's a deadline, or no, there's not a deadline.
There's not a deadline. They work individually with the states and the territories, and our administrator and staff, they're working very closely with FNS, and we should be submitting the new plan.
So do you submit internal deadlines to receive the information? So what is your benchmark?
Yes, we do.
So what is it?
We do have internal deadlines. However, we're working also with PSNAP. In addition to PBT, Senator, we give out an extra $2 million per month So we do have deadlines, but there's so many competing
Commissioner, Assistant Commissioner,
services.
I'm just asking, what is your internal deadline? I mean, I hear all of the other ancillary information.
By or before February 15th, we should be able to submit our plan.
Okay, so you would say, because you don't have a true internal deadline. So in order for us to meet our goals, we have to know what we're working towards. And that has to be information that is provided to the team so everyone knows this is our benchmark. Sometimes you have to move the goalpost because things happen. But that's why I'm trying to establish what is that internal deadline that all of your team members know. So they now are in a position to ensure that they are meeting the requirements, meeting the information needs or whatever it is, so they can meet the deadline. If that ain't happening, then we ain't going to place. Thank you, Mr. Chair.
Thank you very much, Senator Gregory. Commissioner, real quickly, when was the last time there was a Virgin Islands Interagency Council meeting on homelessness? I know the last time we attended was November of 2020. I heard testimony there was one in 2021. However, again, of record, the last one I know of is November 17th, 2020. Can you please clarify?
I'm going to allow Kendall to time because the subcommittees are meeting in between the larger council meetings. So I want to make sure that we're clarifying who is actually meeting. And so Ms. Tutine is actually the best person to answer those questions.
Ms. Tutine?
Good afternoon.
Good afternoon.
Can you hear me? Good afternoon.
Good afternoon. Go ahead.
Okay. I'm Kendall Tutine, Director of Nonprofits and Support Services, Department of Human Services. Yes. We did have a VI Interagency Council meeting in November, as you said. In the testimony that Senator Blyden was referring to, it was mentioning the Access to Services Subcommittee is having a meeting on February 15th. It wasn't the general membership meeting. The Access to Services Subcommittee is looking at the data with the HMIS, the point in time, and other HUD-based data that we have available to determine two top priorities for FY 2022 that we can focus on and identify funding to develop services in the territory for homelessness. So we've been hearing a lot about, different types of services that we need to have. We're actually looking at all of the funding that is in the territory to see what can be utilized, how it can be accessed, and make sure that the nonprofits get access to that information so that these services can begin to be developed and ease some of the burden of the homeless population in the community.
Okay. At this time, the chair will recognize Senator Soro. You recognize for your 6 minutes.
Thank you, Mr. Chair. Ms. Clendenin, how many applicants do you have in the emergency rental assistance program?
Dana Clendenin, Chief Disaster Recovery Officer. I believe it's somewhat over 600, but I will ask Ms.
Hold on.
Janine Hector, Director of Programs,
Where is she?
Answer the question.
Ms. Hector, how many applicants? You're on mute.
I am so sorry. Good afternoon. I'm Janine Hector, Director of Federal Programs of the Housing Finance Authority. We have just over 700 applications.
How many have you processed?
We've paid 195, totaling just over $1.5 million.
How much has been allocated to that program?
The total allocation for ERAP, there's two tranches of ERAP. The combined total is $39 million.
So $39 million, you spent 1.5 so far?
Yes, that is correct, ma'am.
Why?
I will, of course, for the record.
Hold a second. So you have 700 applicants, 195 have been paid. That's under 5% of the people that have applied. Why the backlog?
I don't think 195 can be 5% of 700.
Well,
however,
go ahead.
195 sounds like 2/7 of it. I should say that having paid 195 applicants, that doesn't mean that that's how many files we have looked at. We have eyes on many more files than that.
Ms. Hector, you're giving me a smart answer, and I think I know math, and I said that's under 5%, which is under 5% of the people that have applied. So you wasted my time telling me about what a percentage is. I'm asking why do we have a delay in helping these applicants? Because I don't think that sometimes when 700 people apply for something, I may not meet the requirement, but I don't think that 195 only met the requirement.
As I was saying, we have paid 195 so far. However, we are actively working on an additional 400 applications. We have 115 applications that have been placed into an inactive status based on our
When do you expect to play that?
inabilities to.
When do you expect to pay out the active applicants? What's your deadline? What's your timeline?
As we complete the applications in terms of, they're all in various stages. So we have about 100 that are in final review, and they will move to processing for payment, meaning move to accounting as soon as they finish their final review. We have established a deadline for...
Ms. Hector, what's the timeline?
We have established a deadline for another 3 or so weeks to move those 100 to accounting for payment. And once we send them to accounting, we turn around the checks in a week.
Ms. Hector, Ms. Hector, I get a lot of blows for being very difficult and stern on the legislative floor. And I circulate in group chats and what, but at this point, I really don't care. Because Senator Blaney could tell you, we had an applicant that applied for emergency rental assistance. And the delay in the program led to her eviction. And because of her eviction, the person is now staying in a hotel since the beginning of December. And because she is not considered homeless, then she can be put to the top of the list for the VI Housing Authority as a crisis because she has a roof over her head. Hold a second. And you have so many applicants that fall within that category. And I'm asking about emergency rental assistance because it yields homelessness.
3 minutes.
It takes you to that point. And if the operative word is emergency rental assistance, E, and there is no sense of urgency in moving the project along. Like, we are going to send people on the brink of insanity. They're waiting for COVID funds. They got labor, they can't get unemployment check for the whole pandemic. They're going to get put out the house, they can't get emergency rental assistance. Damn it to hell. And I get a lot of flack for my tone, but you don't see the people that come to the institution every day. They're calling you, they're Facebooking you, they're Instagramming you, they're Snapchatting you. They're finding the friend to tell the friend. You can't go in the grocery store without somebody with some sad story. And it's enough to break you. You have 700, 195.
75%.
It is frustrating for me. These are people's lives, and it boils down to caring, passion. You can't legislate compassion. You can't legislate for somebody to care. You cannot do that. And Senator Blaney could tell you, ain't for one to calling, I have so and so, how you could help them. They're going homeless. We communicate every single day on a new applicant, while we're in our nice homes and cushioned environments. Commissioner Kazi Gomez, how many acting positions do you have? And are you still receiving an Oscar award for acting? Please.
Which question would you like me to answer first, Senator Terrell? Yes, we do have. We have several that are currently acting. I have 2.
How many? How many?
I believe it. Total acting positions. I'll allow DC Rojas to answer.
1 minute.
Good afternoon, Senator Sir. This is Deputy Commissioner Rhoda Rojas. I have 2 individuals who are currently acting in the district manager role for Adult Protective Services, and they are
overall. Hold on, I need an overall number, Ms. Rojas.
No problem.
In the entire department, how many acting?
We have 6 individuals acting.
So that's half. The last time it was 14, so we had half now. When do you plan to?
Yeah.
When do you plan for that number to become 0?
This year, positions so that they can move out of acting.
And have they been fairly compensated? Because the law says that after a certain amount of time, you have to compensate that person for the position that they've been acting in. Are we fairly compensating those individuals?
Yes, they are. The funding for we have individuals who are due funding, and yesterday I received a request from OMB for additional information to provide back to them, and I'm going to work on that to make sure that I could finalize payments to those
Was my time
individuals.
called? I don't. Oh, okay. St. John seniors, big ribbon cutting in St. John for the senior facility, and not one senior has occupied the facility. Can you tell me why our seniors are not in their senior center?
Assistant Commissioner Michael Rima Brown has a plan.
Yes, Senator, we could not open over the last year because of the COVID. We chose not to put the seniors in the congregate setting for safety and health reasons.
Do you know Do you know where the seniors on St. John congregate now? Do you know what's the de facto senior center? If you catch a boat to St. John tomorrow, any boat, just walk up to the recreational facility, and that is their de facto senior center even before you fix the senior center. So the seniors are looking for a place to congregate, and we lock the building up because we don't want them to come. How many seniors do you have on St. John that it would become a crisis?
Time.
For the senior center on St. John, I believe we have about 25. We're going to be phasing in the attendance in the month of March. That is our proposed date. There is a problem with the AC system at the Adrian Center, but we will be having about 25 seniors phased across.
Hold a second. So if I thought you'd have told me that you have like 100. You have up 25 seniors. We can accommodate the seniors on every other day, or this half come Monday, Wednesday, Friday, the other half come Tuesday, Thursday. You have COVID funds to disinfect continuously. So why are we not being creative in creating a good space for seniors?
Senator, we believed that it was not safe at the time. We have had Omicron where on St. John there was almost 400 positive people.
Assistant Commissioner Michael Rima, there were times where the pandemic was at a low. Omicron came in the holidays. You closed for a year. Are you telling me that when we had cases that were under 25 and whatnot, we couldn't create a space for our seniors? One more question, Mr. Chair. The pharmaceutical assistance program, what has been spent from that? I don't see this in the list of things that's in DHS, and we expand. That's one of the first bills that we move in the 33rd to give relief to those who had chronic illnesses that needed assistance. Is that program being used? How much has been spent? I think that will go to Ms. Modeste.
Let me pull that information for you.
Antoine.
Give me a moment to pull that information. I'll get it back to you.
Commissioner,
Senator, could I indicate?
Oh, no, I was waving my hand to the chairman. Sorry. I didn't know we had two screens
Yes,
up.
I was saying we continue to provide pharmaceutical assistance to those eligible seniors and adults with disabilities.
Mr. Chair, We're giving contracts to all kind of companies to advertise emergency rental to do this. And we have a pharmaceutical assistance program that is so helpful to those who have chronic illnesses. And I doubt that the people of the territory know that there's a program to give them assistance because there's no public information campaign on the program. The answers today leave a lot of room for concern. Thank you, Mr. Chair.
Thank you. Thank you very much, Senator Sorrow. I wanted to go back to Ms. Hector real quick in regards to some of the comments that she has put on record thus far. Certainly the ERAP program, $39 million, 1.5 expended, 195 clients so far that have been processed and received their checks, 700 plus applications. Ms. Hector, have you sent out any notice or any correspondence have been sent to the inactive or those ineligible individuals?
Thank you for the question, Senator. Files are placed in an inactive status after we have made 3 attempts to contact the applicant unsuccessfully. So typically, we have an application. If we need some additional information, we have a means of corresponding with folks to say, your application is under review, this additional information is needed. And we keep track of our efforts to solicit that information from the applicant. So we send out the request. The next time we send it out, it says, second notice, please comply within 30 days. Then we send it out again, third notice. If you don't respond within 5 days, your application will be placed in an inactive status. And that's how it gets into the inactive status. So we don't just take it and move it to inactive. There's a process by which we do that after a number of attempted communications unsuccessfully.
Very well. So I accept the 3 attempts, but is there a website that's then made available for those individuals that may be inactive? Are we posting these names or information in the newspaper so that they could be follow up? We're talking about our people. Again, that's without shelter. That's the reason why they actually applied, and what is the level of reaching out to them to make sure that we're trying to reel in as many as we can to make sure that information is passed on.
Senator, I appreciate the suggestion. However, I would be cautious about something like publicizing folks' names. I mean, you get to a point where you have to make sure that you don't cross that fine line of violating a person's privacy.
Ms. Hector, if there's abundant property, if you leave money in a bank and you have not claimed that money, the Lieutenant Governor's office is obligated to post that person's name in a newspaper. If you attempted 3 times and there's no ability to reach that person, then we have to then become innovative and get that information out. So I don't see how that will be offensive in any way to then post that name or information to allow them to know that they need to make contact with the housing authority because in fact, and you don't have to post a name, just simply put the information out that if you have not heard from us for the last 3 months, 60 days, 30 days, or whatever, then you need to reach and call. But I don't know even if the caller will be successful. I have left you, Ms. Hector, several messages because our office have now become the call-in center for ERAP. We have to get better at this. Again, we might be we are the people's representative, but you're the one that's tasked with doing this work. And we need to, again, show some empathy in what our citizens and our community is up against. Homelessness is not an easy situation. I just want to quickly read from our kids count. It is hard to argue that housing is not a fundamental human need. Decent, affordable housing should be a basic right for everybody in this country. The reason is simple. Without stable shelter, everything else falls apart. Matthew Desmond. Kids count. Quote. I mean, it's really difficult and we don't need to pick on you today, Ms. Hector. Maybe I should talk to Ms. Clendenin. She's the lady in charge. Ms. Clendenin, we have to do better with this program. We have to be able to reach our citizens and be able to avail them some opportunity in which we could address this situation. I'm begging you, I'm pleading with you, and imploring you. Our community deserves better. Point of inquiry, Senator Blyden. Please recognize
Thank
Senator
you.
Blyden's mic.
Thank you. Thank you, Mr. Chair. Ms. Hector, you spoke to send out email, through email, and my colleagues say call. How are you communicating with the landlord or the tenant in terms of finding them? Because we know many of these individuals are moving from place to place because they are many of them are misplaced. So who are you reaching out to, the landlord or the tenant, or both? And are you making calls instead of sending emails? Because it ain't everyone has emails, etc. That's my point of inquiry. Thank you so much. Ms. Hector?
Yes, sir. We are reaching out to both applicants and landlords. If a person doesn't have email, we make calls. Even if they have email, we make calls if we're not getting responses to emails that we have sent. We have made outreaches to landlords saying, we're trying to get in touch with your tenant. Likewise, we have made outreach to tenants saying we're trying to get in touch with your landlord if the information that we are seeking is from a landlord. So we are making every effort to establish those communications.
Ms.
And
Hector,
I would like to say,
Ms. Hector, does the application have a area where, in case of emergency, you can contact this person? Does the application have that?
yes, the application had the opportunity for a person to list 3 telephone numbers and their email address for the applicant, and as well as to provide for the landlord's mailing address, telephone number, etc. I've been trying to say without success, and I think I'd like to put this on the record if I'm permitted, that an application that has been placed in an inactive status can be removed from the inactive status at any time as we are able to receive a communication or establish communication with the applicant, etc. And there are instances where that has, taken place. That, being put in an inactive status is not fatal. As soon as that contact is established and things are rolling again in terms of our being able to proceed with the processing of the application, that is what we do.
Okay, thank you for your response. Thank you, Mr. Chair, for the time.
Senator Sarah, a quick point of inquiry.
Thank you. Do you have, Ms. Hector, do you have funding to hire people to answer the phone? And like a hotline or anything?
Under the ERAP program, there is administrative dollars. Currently, the staff that we have are field the calls that are received, as has been presented before this body, prior to this particular occasion. We are still trying to, we're still seeking to ramp up staff.
Hold a second, Mr. Chair, and the point I want to make is that there's no collaboration within the government. You have dislocated workers or those who went unemployed that go to the Department of Labor, and there should be some collaboration when you see an application that somebody was working in a hotel in the accounting division, whatever, and be able to say, hey, we have these amount of people at labor here that could fill the void over there. And what does that collaboration look like between labor and, because labor would have the statistics, and if via HFA for those critical programs? Thank you, Mr. Chair.
Thank you very much. Let's go to our next senator. Senator Carrion, let's give you you recognize for your 6 minutes.
Thank you, Mr. Chair. I would like, good afternoon to everyone and good afternoon to the testifiers. I would like to first start by, in name of all the nonprofit organizations that provide so much support to our community and partner and fill the gap where the government fails, but also we understand the government can't do anything. I would like to thank Mr. Malik from 10,000 Helpers for the services that he provide to our communities, particularly our homeless community in the district of St. Croix. And I know he is standing for all other nonprofits that with little or almost no resource go out and provide services in various areas to our community. So thank you, Malik, for your service. Commissioner Casey Gomez, let me ask you, regards to the Homemaker program, what is the status of the program? So I'm curious to find out what's the status. We know that there's a great need within our community that require those, or a desperate need for those services. How many homemakers have retired? What's the status? How many staff do you have currently?
I not to talk about how many homemakers I have, but I can tell you that we've continued our services, and I do believe that AC Reimer Brown would be able to answer some questions regarding homemaker services.
Good.
Yes, Senator. Thank you for that question. Mikal Reimer Brown, Assistant Commissioner. The Homemaker program continued to operate. They're one of the public-facing groups that continue to go into the homes. We do have a waiting list for homemakers. However, I have good news today. Our ARPA budget for supportive services has just been released yesterday by OMB. We will be able to hire an additional 4 homemakers from that funding source, and we'll be able to bring on many of the people who are on the waiting list. Additionally, OMB released yesterday the $125,000 that the local government, the legislature, appropriated to us. So we'll be able to do some contractual services with our community agencies that provide homemaker services.
So how many staff do you have currently?
We, sir, that we have currently 19 homemakers listed on our personnel listing.
19. Divide them per district for me, please.
Okay, I'll have to pull that. I just pulled names and titles. Let me pull it by district for you.
Yes.
And have you hired anyone as a homemaker the first quarter of this fiscal year?
No, sir. What we just talked about is the positions being available. So the 4 that are on the ARPA budget was just approved. The budget was just approved, so we'll have to do PRFs in order for us to hire for the homemaker services.
Okay, so 19, and you're planning to hire 4 with the funds that were provided to the ARPA fund. What's the size of your waiting list? How many do you have on your waiting list?
I believe the last time it was somewhere between 20 to 30 in each district. I can get the updated in just maybe give me a few minutes. Our Senior Citizens Affairs Assistant Administrator could text that to me.
Very well. Do you have the number for me per district, Commissioner?
Give me 1 second. I'm just pulling the information.
And how many have retired in the last year?
10 in St. Croix.
So we have 10 in St. Croix and
3 minutes.
8 in St. Thomas and 1 in St. John. And as far as retirements, I'll have to look. I know we had about 20 people retire. I'll have to look and see what positions. As far as I know, no homemakers have retired.
So I know your plan to hire 4. Is that the amount that you need to be able to service our community who have the need for homemaker assistance?
Not necessarily. I think that it will be better. But, you know, as far as serving an additional 30 people, AC Reimer Brown, you have another?
Yes. I wanted to share the good news with the Senator. In addition to homemaker services, because we know that they alone cannot take the load. So we added personal care attendance services to our Medicaid state plan. We have about 34,700 Medicaid members. If there are any individuals who are Medicaid members, they can go to the Medicaid program, and if they are eligible with a doctor's recommendation for personal care attendance, which is very similar to the Homemaker program, Medicaid will pay 100% for private hires of our community-based agencies. So that is some hope, Senator. Apart from the local government funds for Homemaker services, we have added personal care attendance services to the Medicaid program.
Well, that helps a little bit with the load, but still is a lot of work to be done. I didn't really get a clear answer then. Based on our population, those that you currently have and those in the waiting list, to be able to service that population, what's the amount of staffing that is required?
I believe with the additional 4, we may be able to bring down our waiting list for the Homemaker program, but I am extending to you that this is a larger problem.
So let me ask you this. So what's the ratio per Homemaker? How many persons can they service? Because I think that's the way how we could have an idea.
Yeah, it varies, Senator, with the capacity of the person. Some may have 8, some may have 10. But if there are individuals who need more support, that Homemaker may have fewer because they have clients who are more vulnerable.
Right. Commissioner, in regards to your social workers now, what's the total amount of social workers you have?
Good afternoon again. AC Benjamin, I'm going to allow you to answer the social work question, and you can pull that up right now. The total number of social workers we have, I have it right in front of me. Hold on one second. DC Rojas, do you have it in front of you?
No, sorry.
Assistant Commissioner Carla Benjamin, we have it on.
Total number of social workers, total number of vacancies, how many more social workers do you need?
1 minute.
We should have those numbers. We're here for overview of the departments.
Have the numbers, sir. With all due respect,
And
we
this
do have
is-
it. I'm just pulling up the spreadsheet. So I have a lot of programs, 84 programs to be exact. So I have probably more than 84 program spreadsheets. So just give me 1 second, please. AC Benjamin.
Yes. Currently, we have 15 social workers
15.
and 15.
That's territorially.
Yes, sir.
Per district, what's that breakdown per district?
I believe it's 7 in the St. Croix district.
How many social workers do you need, Commissioner?
100. I need it for every single program. So it depends on the capacity for each one, to be honest. So each individual office or division, and I'll allow AC Benjamin because we have social workers under 5 divisions currently. Intake and Emergency Services, Adult Protective Services, Division of Children and Family Services, DIPS, which is Division of Intervention and Prevention Services. And I believe that's it. So social workers are licensed, qualified, and then we also have support staff that can do different roles. So when you're asking for licensed social workers versus that, so AC, I can get you a total number by district.
So I double checked, and right now we have 8 social workers on St. Croix. The question that, as Commissioner was explaining, the question of how many social workers do we need is sort of a complicated question. We have social workers right now. We have family services specialists who carry out similar roles. We have caseworkers.
Time.
And then we have some support staff that that support all of those roles. We do have
So we don't have
some
a clear.
vacancies.
If I'm understanding correctly, we don't have a clear understanding of how many social workers we need to service.
We can look historically at how many positions we've had, but to give a blanket number and say we need 10 in one unit and 10 in another unit,
For me, as a wrap up,
wouldn't be
Mr. Chair.
realistic. Sorry, would not be realistic.
Well, this is very troubling to me. So historically, how many positions have you had historically? You're short by what number?
Assistant Commissioner Parliamentary, could you put on the record regarding the family services specialists and the licensure when we walked in the door, please?
Okay, when we came on board in 2019, there were 29 positions with individuals who have social work function as their primary function. 29 people who had social worker as a title. In the territory, as in most of the jurisdictions across the nation, in order to be called a social worker, you have to have a license. Of the 29 people that had the title social worker, 12 of those people did not have licenses. So pretty much they were functioning those roles, but outside of what is statutorily available. We, along with the Department of, we spoke with the Department of Licensing and Consumer Affairs. We spoke with the Division of Personnel. We talked with OCB. We partnered with the union and we presented opportunities, information. I myself provided tutoring for nearly a year and a half to allow individuals to take the social work licensing exam. In order to obtain your social work licenses, you have to take boards like you do for nurses or anything else. Of the 12 people, only 2 individuals with the title of social worker were able to get their social worker licenses. At the point in October of 2020, when a directive was given to all of the government of the Virgin Islands, that anyone with the title social worker had until initially October 31st to get their licenses. And then they were given a 90-day grace period that if they didn't have their licenses by the end of the year, 12/31/2020, they would be suspended without pending termination. The department, because social worker positions have always been hard to fill, we had been looking for years for a parallel position. And so during this time, while folks were given the opportunity to test and get their licenses, we went through the process with the Division of Personnel and we identified the Family Services Specialist position, which is a similar position with similar compensation, but does not require a social work license. And those, aside from the 2 that got their social work licenses, the other 10 were offered the opportunity to be reclassified as Family Services Specialists. And I believe only one of those persons resigned and left the department. So the title is not social worker anymore, but we retained those individuals. Since then, we've had 1 retirement and 2 other resignations. Additionally, we had, we talked about the acting situation. We had 3 people, 3 social workers sitting in social work positions, but acting as district managers. 1 has since moved into her position, which allows us to have a social worker vacancy. And there are 2 others that the DC Deputy Commissioner for HR mentioned earlier that are being transitioned into their full district manager positions, which will leave 2 additional social worker positions available.
All right, Ms. Benjamin, let me allow for my colleagues to ask some additional questions. I see that social worker definitely an issue here. I believe that the current social workers that we do have on staff is burned out. They're tired, and it's really leading to some delays in the courts as well as delay in getting services to those that need it. So I expected that today we would have heard exactly, and I know that there's some correspondence that have been sent to the commissioner from some of my colleagues in respect to what's the status of the hires of social workers and others, because it is a crisis situation that requires some immediate attention. If you need us to support you in being able to get some PRFs moving forward, whatever that need may be, please let us know. But I know that our current staffing with social workers are really at their wits' end, and it's leading to burnout. So I know that there's a point of inquiry by Senator Francis Heiliger, and you're recognized.
Ms. Commissioner Kazigo, I am sitting here a little annoyed, and I'm trying to keep my composure as much as I can, because all I really care about is to really understand how your agency is providing services to the people in this territory that need it. And all I'm hearing is excuses and stories and runarounds and you tossing up, 100, because somehow your agency has not done any assessment as to even know how much social workers you have. And I'm sitting here confused. Ma'am, 1 second.
Point of inquiry, Senator.
The question I would like to know, what exactly does your agency do in regards to assessing your needs overall and coming before this body and in an articulate way expressing it to us so we can assist you, so we could help the very people we represent? That is what I'm trying to understand. Thank you.
So, sir, Chairman, may I?
Yes, please respond.
So I currently have 10 social worker vacancies. And when I say vacancies, I'm very hesitant to say vacancies. 4 are on the social services block grant. So as soon as that grant or budget is approved by OMB, then those positions will be able to be hired or have a PRF for. I have 2 additional ones. As soon as the internal promotions for the district managers are done, then those positions that they're currently sitting in as social workers will then become vacant. So then that leads us to 6 current vacancies. And then I have an additional 4 that are on a couple of other budgets. So once those are all good to go, all the budgets are approved and everything, we can get an approved PRF for the 10 additional social work positions. And so if you look at the historical data, which was important, all vacancies were cut from the budget, including social work positions on the general fund. So so in order for us to succeed, like you've asked, and assess in each area of interest, then what we've done is we've added additional social work positions on federal budgets to ensure that we can serve the public like we do every day. I understand
Commissioner Kazi Gomez, I just want to say this quickly.
Yes.
I understand you speak of all these positions, but we literally altered people's titles because you couldn't even find or get them to pass social working tests. So how in heaven's name are we going to even fill these 10 and 6 and all these other things you're speaking of if the ones that are there can't even pass the test to be able to become social workers? Where are you going to find these additional people from to serve the public? That is what I'm trying to understand as well. Thank you.
So the question on the thing originally was, how many social workers do I need? I tell you that I need 10 social workers. Whether they're 10 social workers within the Virgin Islands that are currently here, I don't know until I put it out there. I'm assuming that there may be qualified licensed social workers within the territory that may want to come and work at DHS from another agency, private or nonprofit, or want to relocate from the states and come back home to serve. So until I do that, until I do the recruitment effort and they're posted, I won't know. So right now I have 10 vacancies for social work positions. And as a licensed social worker, just for the record, I have a master's in social work and I am licensed as a social worker. So it's very dear to my heart. So I do understand being short-staffed and overworked in a lot of different areas when it comes to being a social worker in the front lines. So it's been a complicated issue since we've been here. We want to make sure that we're staffed up to serve in each area of interest because it's important, not only for the clients, but also for the support of the employees.
Very well. Thank you, Commissioner. At this time, Senator, Senator Viola, you recognize your point of inquiry?
Thank you, Mr. Chair. I just heard the conversation in reference to licensure of social workers and those individuals that were not able to acquire the licensure. And then I heard the conversation saying, well, we look for parallel position and we found one, and family, whatever, service specialist or something like that. And the pay is the same, despite the fact that you have individuals that went and get and passed the social work licensure test, and you have individuals that did not, and then you have the pay the same. So what is the incentive for those who did what they were supposed to do? There's no way the pay could be the same. You can't require licensure for one group, and then the next group you say, well, I don't need licensure for that group, but I'm going to pay them the same. Then what you have just said is that there's no reason for you to become licensed. All you need to do is have some qualifications, you apply, and you're going to get the same pay. I mean, how can we really equate that? I'm trying to understand, how can you equate being licensed and not being licensed and getting the same? That's like saying you pass NCLEX, you become an RN, you're going to get a particular pay, and if you don't pass NCLEX, you're still going to get the same pay. It doesn't work that way. So just explain to me the rationale as to how you guys came up with that scenario.
Can I respond to that, Commissioner?
Yes, please.
So the matter of the family service specialist and the social worker still being paid at the same rate is not the plan. And DC Rojas could probably speak to what the process is that's happening between Division of Personnel, the Office of Human Resource and Labor Relations, and OMB that has prevented that from happening. But everyone has known from the inception, including the union and the union members, has known that this change in title was equivalent to a demotion, which would mean a loss in rate of pay. And I also want to speak to the fact that I am a licensed social worker and have been a licensed social worker in the Virgin Islands, in Virginia, in Maryland, in DC, and have worked as a family services specialist. It is a difference in title. It is not, we didn't manipulate titles. We didn't create opportunities for people who are not qualified to do the work that they are doing. The process that we went through was to enable the department to still provide the services. There are people who have been in the department who are social workers who have 25 and 26 years of experience. Some people are not good test takers. So because they weren't able to pass the test, does that mean all of a sudden they have no skill sets and we're doing the community a disservice? Had we not made a concurrent plan and the department had terminated 12 or 13 people, it would have been a tragedy for us, a tragedy for the people who we're trying to serve. And I'm sure we would have heard from this very body.
Senator Viola?
Mr. Chair, let me just be clear. Nobody was saying that you're saying that they don't have experience, etc. What is just clear is that you have one group of individuals who are licensed. And the analogy as to the DC experience, he clearly said she was qualified and licensed in all of those states. So if you serve in that particular position as a family service specialist, you are still licensed as a social worker. But we're talking about those individuals who are licensed, that I shouldn't be licensed. I have to take a test and pass it, and I'm making $47,000, and somebody that is not licensed is going to make the same 47. If that is the case, then you got to raise my 47, and you can leave there at the 47. I'm not saying to get rid of anybody, but I'm saying to create an equitable system, and that is the job of HR. We heard this same phrase or this same analogy, the same story months ago, and nothing has been done to include the acting positions. We still don't know what's going on with acting positions today. At some point, we need to know what is going on because it doesn't look good on this body and it doesn't look good on human services. We need clarity. Thank you so much, Mr. Chair.
Thank you,
I
Senator.
agree with you. It's a delay. DC Rojas can probably explain what the delay is.
At this point, we're going to move to the next senator. Senator Fred Gregory, you recognized for your 6 minutes.
Thank you, Mr. Chair. And I'm just going to go out the gate and say that I don't believe that Human Services has been before the 34th legislature in this update manner. And I'm going to ask the chair that until Human Services can get their act together, they need to come here every month. They need to come here every single month, because the issues that are occurring in Human Services are very telling on the social issues that we have in this U.S. Virgin Islands. They need to come here every month. I'm not saying it as a joke, because at one point, when a question was asked of the commissioner about the same social workers, she cracked a joke and said she need 100. This is not a joking matter. This is serious business. People's lives are being impacted daily while we walk around here in our stilettos and in our nice suits and our nice dresses and our pants. This discussion that we are having today is absolutely troubling. It's troubling. When we cannot even tell an answer, we come here for an update today. And a simple question, how many social workers do you have? We have to go look in our computer. If we're doing this every day and we're managing social workers or family service workers or whatever that title is, we should know this. We should know. And it's not only what's in your budget, it's what your need is or what your needs are. This has to stop. This is not funny. This is not funny. Commissioner, you came here today and you provided a testimony. And I'm going to say that your testimony was not comprehensive. And it was not comprehensive because we asked specifically for an overview. And in the majority of the pages of your testimony, you know what you provided? You shared with us, which is insulting to me. You shared with this body what the Office of Intake and Emergency Services does, and you went on and on about what YRC is the only secure. We know all of that. You don't have to tell us that that's the only detention facility. We asked for an update. We want to know how you're doing. That's what we want to know, Commissioner. How are things working in the Department of Human Services? And you neglected to do that. So we're going to ask for you to come back, because we do not have enough time to have this discussion. When I worked for government, I would sit in front of this legislature, one department, from 9 in the morning, sometimes to 6. You all are getting away. And this is why you have this willy-nilly approach to the responses that you're providing to this body. And it needs to stop, because we get all the phone calls. We get all the phone calls. So I'm going to ask you today, I have one salient question. I have a lot more. What all of these entities that you have, divisions rather, that you've laid out here in front of us today, that's the divisions that's under the Department of Human Services. What assessment, or how are you assessing to determine whether or not you are being successful? What benchmarks are you utilizing to ensure that you are moving the needle to address the issues? And we know you have challenges. You came here, you ain't let out none of your challenges. None. Zero. And we are getting the phone calls. If we appear frustrated, it's because we are. Because the people are calling us and they have expectations of this body. But when you come before us and you give us a testimony in this manner, I'm not sure what you expect for us to do with it. I don't know. So please tell me, how are you assessing your programs? How are you assessing your divisions and your programs?
May I respond, Senator?
Sure.
So each assessment, and it's a great question, and I looked at budget hearings in past, and you're right about the comprehensive nature. So next time I will be more
Just tell me how you're assessing your programs. My time is running.
Your mic is muted. Your mic
is muted,
Commissioner.
Commissioner.
Okay. So sorry. Sorry about that. So each program, depending upon if it's a GVI or a federal program, is assessed differently. So Medicaid, SNAP, Head Start, Child Care all have benchmarks within the state plans that we have. So those are benchmarks and assessments with the federal government that are expecting. So we do that accordingly. Being in looking at the budget hearing from 10 years ago, we're 300 people short than we were 10 years ago. So I look at that as being, as you wanted me to know the challenge, it's excessive. So I cannot meet the needs of the community at this time effectively without having
Commissioner, that's not what I asked you.
Yes.
So,
assessing each one
No. Don't do that to me. Don't do that to me. I asked you how you're assessing your programs. I did not ask you what an administration challenges were 10 years ago. I asked you, how are you assessing your programs? And what I expected you to say is annually, quarterly, you look at your KPIs or whatever it is that you guys use to assess your programs, and you make determination as to whether or not you're meeting your benchmarks. And if you're not meeting them, you're making adjustments to meet them. And then you should have been able to lay out for us today why you're not making your KPIs and how this body can assist. That's what I expect you to say. You telling me all about what happened 10 years ago. I am not interested in that information. We are here. 10 years ago, where was I? Perhaps at the Department of Education. I'm not sure where you were or where your team was at that time. But you cannot have those. You have a team of qualified people, and you are telling me about all this thing that went on 10 years. I mean, come on, man. Come on. We have to do better than this. And you all have gotten away last year. You all were not in this. You all did not come before. This conversation that we had regarding these social workers, it came up in the budget hearing. And guess what? It was brushed off. It is a serious matter. And I have to ask you, is there, I think the three leaders, three of the women leaders are social workers by trade, correct? Yes.
Correct.
And so social work is your profession. And I'm not sure how you're comfortable with expressing that some people don't do well on taking tests. You are okay with dumbing down your profession? You're okay with that? I'm not okay with it. No, do not respond. I am speaking. I am speaking. Do not dumb down your profession. Now, I have to ask, are there liability issues with, and I think I asked this question before and I got a whole litany. Stay focused on the question. Stay focused on the question. Just answer the question. All the other ancillary stuff is not necessary.
3 minutes.
Are there liability issues around having this family services, whatever that title is? I can't remember. Help me. What is it? Commissioner of Family Services? Specialists. Are there liability issues having family service specialists operating as a social worker?
They're not operating as a social worker. They have a job description that's different than the social worker. And
so who's
liability.
providing social work services to our community in the Virgin Islands then? If they're not doing that, then what type of social work services is being provided to our people in need?
A.T. Benjamin.
And how many I still haven't heard, how many social work titles do we actually have? How many?
So the Department of Social Service, so the Department of Human Services, there are social services functions performed across the department. There are social work services provided by positions other than social workers.
That's not what your boss just said. That's not what the commissioner just say. And that's why I'm trying to break this down, because we need to understand what's occurring. I'm going to ask it again. I asked about the liability. The commissioner said that the individuals who are social services specialists are not operating as social workers. You're saying something that sounds a little different. And of course, with the emotions, you could misunderstand what's being said. So I want to make sure that we're clear. Answer this one question. The social work title within the Department of Human Services, how many of those do we have?
Right now, we have 10.
10? How many in each district?
Yes.
8 in St. Croix and 2 in St. Thomas?
I just had up the letter. I'll have to check.
Who is their manager?
Senator.
Is their manager on the line on the discussion?
That would be me, and I just generated a whole letter breaking down all of the distribution.
How many
of all
social
the
workers do you have?
Open. Do you want me to read it?
So we have currently,
No.
may I?
No, we have
By title?
15, we have 15 social workers, 15 people with the title social worker. We have 10 individuals with the title family services specialist. We have 3.
So, okay. So I want to make sure that we provide the information that's being asked of us. And I'm not sure why you are intending to confuse me, because that's what's happening at this point. I asked a simple question, and I don't want to be mean about this, but it's frustrating. Just tell us, how many social worker titles that you have that are currently in the department working. Is it 1? Is it 5? Is it 10? Tell us. You going back to the family services, your commissioner just tell us. She just said to us, family services specialists do not operate as social workers. Clearly, she's saying one thing, are you doing an X? That's the reason
we're not.
Excuse me, I'm speaking. If, in fact, there isn't any confusion there, I don't know why we're having this confusion. So please help me to get past this discussion. But I'm telling you, Mr. Chair, we have to bring human services back in here sooner than later, and they need to come in for the whole day. They need to be the only. Can you please tell me how many social workers you have hired currently in the Department of Human Services? You have your HR people sitting there, nobody saying nothing. This is insanity.
Because, Senator, you're asking 2 different things.
I asked him 2 different things. Let me explain something. I'm a very direct person. This is my question. I'm going to ask you one question. I'm going to ask it again. How many social worker titles do you have hired currently in the Department of Human Services? There ain't no 2 different things.
There are 15 social workers, but there are more than that doing social work services. There are district managers who are required to be licensed social workers that supervise social workers.
But me ask you that. I didn't ask you that. This is why y'all can't get your act together, because y'all are convoluted. I want to know who's providing direct social worker services. If you're a district manager, you're managing and you're still doing other stuff. That's not what I asked. Just answer the question. So then you're going to say that you is one, and then Dr. Rima is one, and Kaz, the commissioner is one. Give me the social workers, please. Not the people who are managing, the people who are titled. Operative word here, TITLE.
So there are 15 individuals with the title social worker.
So if you send me, if I go to look at your budget, I'm going to see 15 social workers.
Time.
Yes, Senator.
Mr. Chair, my time has been called, and I'm not going to exhaust any more time on this discussion. There's a whole lot. There's just a whole lot to discuss.
May I?
No, you may not. I'm speaking. There's a whole lot to discuss around this issue today as it relates to human services. And the commissioner, I'm going to tell it to her again, she provided a disservice to us today. If she going to say to us, I'm going to read it. I'm going to just use one as an example, as an update. YRC is the only secure detention facility for adjudicated youth in the territory. Clients at YRC are remanded by a judge for violation of the law, and their charges run the full gamut, up to and included murder. Upon discharge from YRC, youth remain clients of the Intervention and Prevention Unit. Not even, we got 10 children, we funded $5, nothing, no information. This is insulting. I'm insulted. I am insulted by this testimony that has been provided today by Human Services. And I could go on and on. AHG, 8-bed co-ed foster group home for 13-year-old. Nothing. Nothing. Zero. Commissioner, don't do this again. Do not come before this body and give us this kind of report and think it's okay. There are intelligent people in here, despite what many of us may think. Thank you, Mr. Chair. We have to have another meeting. I am not going to get into the details of this discussion because today we did not get what we... You listen, when people like Senator Hansen them used to be in this body, you think they could have bring this in front of them? They could not have brought this. They'll adjourn the meeting and send them back and tell them, listen, when you provide us with what we ask for, then we will have a discussion. It's unacceptable, Commissioner. Unacceptable. And anybody from your team from these respective divisions that provide you with this information, you need to reevaluate them. Thank you, Mr. Chair.
Thank you so much, Senator Fred Gregory. Senator Gittins, you recognize for your 6 minutes.
Thank you, Mr. Chair. I hope I could get more than 6 minutes too. But good afternoon to all. Commissioner, as you have already know, I did visit the Hobart Gregg facilities earlier this morning. And while I want to congratulate you on the start, at least of the work on the dining room, there's a lot of work to be done still in the kitchen. Overall, we just have a lot of work to do. However, today's overview and the responses, I must say, are nothing short of depressing. I'm going to get straight to what I want to ask. What's the holdup with regards to the daycare centers? What's the holdup with the block grant payments to daycare centers, specifically those on St. Croix? Is there a problem going on?
AC Benjamin, or do you want me to? Go ahead.
There are a number of vendors a number of childcare providers who have outstanding payments for November and December. Some have been paid out, some have not. I do have those numbers. The major reason for that holdup is programmatic. The administrator for the program, who sort of puts final eyes on the invoices as they go through, was out. I know that that's not an acceptable reason, but that is what happened. She was out for the final 2 weeks of December. As the process that we have refined since we've been on board requires about 3 weeks for the invoices to process through the Department of Human Services. After the invoices are received, 5 days to the program, additional 2 weeks to the fiscal office before it goes to the Department of Finance. And then sometime there for them to do their vetting to get it paid out. So those vendors who are who have outstanding payments.
Is this person back to work yet?
She is, sir.
You know, as stated in the, and I thank you for your candidness, because it is totally unacceptable, as I told you when we spoke. But as stated in the commissioner's testimony in her scope and overview, the department is designated the state agency for all publicly financed social service programs. And evidently, based on what I've been hearing all afternoon, and we're going to be here well into the night, we don't have a money problem, but rather a management problem. And we continue to say this over and over. And if you are going to continue to want to keep friends instead of doing the people's business, then we're going to always be at this stage. But if people ain't doing the work, it's time for them to go home. Get up off of where you're sitting on, and let's get the people's work done. Now, going on to the social workers. Thank you for your response, Commissioner, to the letter that I sent you regarding the number of social workers in the territory and the status of your recruitment and retention strategy. But with all the vacancies for social workers, why haven't you hired anyone in the last 12 to 24 months?
Most of the position, and I'll take full responsibility of 2 of the positions because they were on the social services block grant and they got caught up in the round of it. The other ones, however, were not vacancies. And so those that were in the acting capacities, like we talked about earlier, were actually sitting in the social work position, waiting for their internal promotion. So we actually had to create district manager positions and get the PRFs assigned so they can move into the position if we have that position vacated. So, for example, adult protective services, I have 2 social workers in that unit, but I didn't have a district manager, even though they were acting as district manager. So I had to create the district manager positions to put them in. And now they can vacate the social worker so I can hire the social worker positions. So
I'm not going to ask the number of vacancies again because I did heard the question asked before. But how many vacancies have been actually posted? And what bites are you getting if you have posted any of these vacancies?
We had 1 posted, and I don't know what happened with Division of Personnel, but it went up and then came back down. And that was for the Office of Residential Services. And so that was one that was posted. In the upcoming, as soon as the Social Services Block Grant and the other 2 grants are approved, then those PRS will go down and those 10 positions will be able to be posted as well.
Did you say that none were posted?
1 was posted. The administrator for residential and interstate compact affairs was a social worker who was internally promoted to an administrator position. And when her position became vacant as a social worker, that position was now posted. The district managers are still pending their PRFs or NOPAs for their internal promotions before they can become vacant and be posted.
You also mentioned that positions were being deleted from the budget. But aren't these positions supposed to be critical hired positions? Why are they being deleted?
Well, I'm not exactly sure. So in 2019, when I came, we had a personnel listing that all the vacancies were deleted from the budget. And then 2020, we did a personnel cleanup, and then we had to add positions back into the budget. That including the social workers, district manager positions. So now we're at a place where we've hired and we put them on different federal budgets in order to make sure that we can sustain them versus just having them on the local budget. So right now the 4 positions are on the social services block grant. I'm looking forward to having that back. And once that's back, then I'll be able to post those positions. And although we were really focusing about social workers.
I keep hearing this thing about when we came on in 2019, everybody know when the administration took change, and 2 to 3 years later, people expect to see a difference. They expect to see progress, and it seems like we're not seeing progress. Rather, we seem to be regressing, and that is totally unacceptable. Now, let's go to Herbert Gregg. The facility was once a 92-bed facility. Now you have about 36 beds and 20-something residents, I believe. What's the status on the actual repairs of the dormitory for that Herbert Gregg?
Okay, so there's several questions. So first of all, we only have 22 residents currently at Herbert Gregg. No, it's not a 36-bed facility, it's 25. So I just want to clarify that for right now. So the secondary thing, I have Tricoci.
Hold a sec. I want when you start to respond, that once you turn back on your mic, give it a couple of seconds before you start to respond, because I'm not hearing the beginning of what you say.
Okay, so thank you for the question. So Herbert Gregg, I want to clarify. Can you hear me? You can hear me still?
I
Mic
can,
check?
but I listen. I can. I know it was originally a 96-bed facility.
Correct.
It now has capacity for about 36 beds.
No, sir. That's what I want to clarify. Right now, it only has capacity for 25. We, in our earlier part, we said, and in order for us to expand it to 36 to accommodate some of the boarders and add an additional 11 beds, we'll need additional funding and staffing in order to accommodate. So right now, we have 22 residents with 3 pending admissions, 1 from the hospital. And Adele go into that first wing, sir, when you walk. How's that?
Remember, I told you I was there today. I understand. I walked through. I looked for myself. Yes, the 25 that you speak of is the hard number. However, I saw that there were some other rooms where you actually moved out your senior center folks and whatnot, that you can now again put back in those rooms. That's why I counted those rooms up to the 36. It may be 35 or something, but I don't want to get technical. I just want to know what's the status on taking care of those dormitories, whether we knock them down and rebuild them or we do actual renovations to those buildings.
Okay, so we have several answers to the questions. So the first temporary solution to add 11 additional beds, we talked about this before with additional funding. And that would need staffing and some changes to that wing in order to accommodate the immediate solution. There's a prudent replacement for Herbert Gregg, as well as an extensive skilled nursing 60-bed facility, $61 million project that's also in the long-term planning. I have Deputy Commissioner Tricoci and AC Reimer Brown to clarify as needed.
Good afternoon, Senator.
Go ahead.
Yes, good afternoon, Senator. Mikkel Reimer Brown, Assistant Commissioner with Oversight of Senior Citizens Affairs. Currently, we have 25, and without going over to the section where SCA, Senior Citizens Affairs, left, we have an ability on the one occupied side to take an additional 11. The reason we cannot go over to the senior citizen side, we need to start repairing and reconstructing. We are not able to move out of the facility while the construction takes place. So we're going to repair the side where Senior Citizens Affairs vacated first. When that is repaired, we move.
Okay, stop right there. Okay.
Over.
Okay. Stop right there. So when are these repairs gonna take place? What's the timeline for the repairs at Herbert Gregg?
And that's where DC Tricoci will give you an update.
Good afternoon, Senator Giddens, and to the rest of the senators, Deputy Commissioner Tricoci, Department of Human Services. Senator Giddens, currently FEMA is reviewing the assessment for all of the information that we have given them. We talked about having a prudent replacement. And just to clarify, if a repair is not feasible, then FEMA looks at a prudent replacement. If the repair is feasible, but a replacement is more prudent, then we're looking at a prudent replacement. Based on the information that we have provided to FEMA, they're looking at a prudent replacement and is currently being reviewed for prudent replacement, where we will have a brand new facility. And that's where we stand right now. There is no timeline. FEMA has not given us a timeline because it's still currently under review.
So 5 years later from the hurricanes and still no timeline. Mr. Chair, I'm not sure. I believe the time has been called, but I intend to be here for the long haul, and I still have questions pertaining to YRC and our senior centers. So I'll yield to the next speaker. Thank you.
Thank you so much, Senator Gittins.
It's not within our control anymore.
Senator Francis Heidegger. Okay, very well. Your point? Okay, very well. No, Senator Whitaker, you're recognized for your 6 minutes, and then Senator Payne.
Yes, and good afternoon. Good afternoon, Chairman. Good afternoon to the people of Virgin Islands, Central staff. Good afternoon to all of the testifiers. I just want to first off, I know today has been a very intense day all around. A lot of frustrations. I really encourage some breathing and some, it's a lot of anger as well, because we're really dealing at the core with people's lives. We know that, the importance of the department. I want to go ahead and first start off from the perspective of workforce development. Last update I did receive, and we did have a meeting, Commissioner Kazi-Gomez and some members of your team, around vocational rehabilitation. And what I really would like as an outcome is that we get regular reporting. Where are we with vocational rehab? How are we? And you give a very comprehensive, a very detailed testimony. But in terms of how have you improved? And I'm going to really dive into when we talk about training, the training of the for sports at the children who are at YRC, children with disabilities. How has the department really worked at connecting with the Department of Labor with respect to even what is going on by way of workforce development from a funding perspective, but also in terms of connecting, whether it is with the Department of Education, the CTEC board, and others, what collaboration efforts, if any, have you engaged in to really make a headway with respect to the training of children and so they can be skilled and ready for the workforce?
So 2 questions. So I'm hearing from vocational rehabilitation aspect and then also from a youth rehabilitation center aspect.
Yes, correct.
Okay. Good afternoon. Thank you for that question. So I'll have AC Reimer Brown talk about the vocational side, and I'll have AC Benjamin talk about the youth rehabilitation side.
Thank you, Senator Whitaker. Mikal Reimer Brown, Assistant Commissioner with oversight of the Division of Disabilities and Rehab Services. Our vocational rehabilitation program continues to collaborate with our Department of Labor. We are part of the core group of the Workforce Innovation Opportunity Act, WIOA, and therefore we collaborate with interagency referrals. Labor refers to us when they identify a person with a disability, whether they're a teen or they're an adult. Vocational rehab continues to provide funding for educational and vocational training for adults and young people.
Well, but I'm going to stop you there. I'm going to stop you, but I appreciate because of time's sake. But what I'm saying, I'm talking about now measuring. I know I'm very familiar. I have had committee hearings. I've had internal meetings. I'm very familiar. I have a very deep understanding. I even have a historical understanding of WIO going back into the 70s and 80s. What I'm diving in and on, what what are you all doing to really address it systematically? What changes have you all made, even with what's going on nationally, what's going on with even workforce and even the issues surrounding even the preparation of these children so they can enter the workforce, person with disability? What measures have you guys done? What measurements have you all made? What gains have you made with respect to that? Do you have any stories to tell of a few children who benefited from these services?
Definitely, Senator. We have students on the secondary education, I would believe about 50 of our young people who are in high school. They benefited from our transition program, where even during this time of the COVID, we virtually trained them in job preparation skills. We also have probably about 30 or more young people who are in vocational and college courses on the mainland. When these individuals come back to us, they are placed, we attempt to the best of our ability to place them in jobs where they will be able to independently function. So we are seeing success for our vocational rehab program. We have our Randolph Shepherd program, where a legally blind individual is able to operate her business. We have many students who have graduated. They've stayed here. Some are in the States and are working, and there are many success stories.
Thank you for that. I want to dive into something that's also really important, is juvenile justice. And so, of course, the Virgin Islands Interstate Compact for Juvenile Justice, I reached out to Commissioner James, Commissioner James, and what she indicated to me is that the compact has not been, well, she did provide, and she responded, very quickly and promptly. The concern I have, we have severe issues. We know this. We've had children who have died in the hands of their guardians or parents. We've had a myriad of issues, the children who are where I see in the struggles. And I'm not seeing, Commissioner Okazi-Gomez, how can you express
30
the
seconds.
urgency, the urgency with respect to the compact? If they're not meeting, how are you really diving into juvenile justice if even the board responsible for juvenile justice is not meeting on a consistent basis?
Thanks for the question. Assistant Commissioner Benjamin has oversight of juvenile justice now. Yeah.
No, but my question is my question is specifically that as you as a commissioner, if this board is not meeting regularly, how are you all actually dealing? Chairman, if I will, I just conclude, and well, I have one more question after.
So I'll look at find out regarding the board and the meeting schedule, because I'm not actually on that board. So I'll double check with the board and get back to you, and I'll put that in writing through the chair regarding that. And as far as the interstate compact of juveniles, it really is crossing state lines when it comes to that. So it's a juvenile coming from another state or territory into ours and vice versa. That's when the interstate comes back, whether it's placement of children and or juveniles. So if a juvenile is in Florida and comes to the Virgin Islands and needs to place there, they come through ICJ, or the Interstate Compact of Juveniles. If we place a foster child in another state, then it has to go through ICPC, and the state has to accept the child into placement. That's why there's a tracking system for that. But Assistant Commissioner, yeah, so that's that portion of it. So as far as the board meeting, if there's no children coming through ICJ, then I'm not sure what the purpose of the board meeting would be. I think that there's a more of an in-depth kind of thing when it comes to prevention and what our prevention unit does and the intervention and prevention. So before they get to YRC, they're doing a lot of work. Von Walwyn and Carla Jarvis and their teams in the district manager aspect of things, and what they do deep down and working individually with those. I like to call them youth versus any kind of other term. Youth in the program as they're coming through the process. So I like to look at the prevention efforts that they're doing before and preventing them from coming into the system of YRC in the first place. So it might be a child that's a PENS and or they did something but they didn't get to an extreme where they would have to be remanded through the court. But AC Benjamin may be able to also assist with that.
Well, my time is called, but what I want to emphasize though, when I'm not getting into I mentioned the comp, but what I'm saying with juvenile justice in general, what I'm saying is that there should have been a task force by now. The level of issues we have with the youth, the crisis at YRC, the crisis that we're in, would lend itself to an actual task force. Our law is pretty narrow, pretty silent about prevention efforts in the context of juvenile justice. That's why I'm also working on legislation so we can have a youth court system and get together. But what I'm saying now, I don't see any kind of emergency efforts or task force to address what is a crisis, what is happening at YRC is a crisis, what is going on in our community. We are in a crisis, and we've been in that state for quite some time, and I don't see actual crisis intervention. My final, Chairman, if I will, because I at least wanted to ask questions around homelessness. Chairman?
Briefly, conclude.
Yeah. Yeah, so and others were pretty long today as well, so just in respect to me as well. The question I have for Ms. Dana Clendenin concerns homelessness with respect even to the interactions with 10,000 helpers. I want to say good afternoon to you, Mr. Dyron. Good afternoon to you, Director Clendenin. I did send a few months back to Director Griffith a question surrounding your ESG program and never received a response back. So the question I have for you in taking any kind of acting role that you're going to play in having a different level of communication with the legislature with respect to constituent concerns, whether questions around how you're funding and even questions surrounding, because there's been a pattern by the Housing Finance Authority to essentially fund some of the same organizations over and over again. What changes do you plan on making in shifting the focus and supporting organizations such as 10,000 Helpers and others?
Dana Clendenin, Chief Disaster Recovery Officer. Senator, at the moment, and really not until February 16th or somewhere, I am Chief Disaster and will be serving in an acting capacity. When I've had the opportunity to really sit with the staff and assess what's going well, areas in which we need to improve, I can better answer your question as to how we'll move forward.
Yeah, but under some saying in response, like when I send you a letter and ask for information on behalf of a constituent, or I have a question inquiry, particularly with how the grant is being spent or questions surrounding it, I would hope I get a response back, and as opposed to being ignored. And I just hope I get that from you.
Absolutely, Senator.
Thank you.
Thank you so much, Senator Whitaker. Senator Payne, you're recognized for your 6 minutes.
Thank you for the time, Mr. Chair. Let me begin with Interim Director Clendenin, or anyone from your agency that can answer this question. When did your agency receive the funds for the ERA program?
I will have Ms. Hector or Ms. Shelford can respond to the receipt of those funds. Ms. Shelford, perhaps, or Ms. Hector?
Right.
Okay.
Yeah, I'm trying to bring it.
And please, one moment. Please state your name before you respond. Thank you.
Good afternoon, everyone. I'm Valdez Shelford, the Chief Financial Officer. I'm trying to recall when we did receive the money. Yes. And can I get that back to you? I think it was in August 2020.
No, it couldn't have been in August. It couldn't have been in August. It was before August.
But it might have. Okay, well, let me get the
I believe it was either in March or April of 2021. Either March or April.
That's when we might have grown up the funding, but we might not have received the funds at that time. So I'll let you know when we receive the funds.
Okay, thank you. And
I'll get back to you in a minute.
All right. Ms. Clendenin, are you aware that according to the U.S. Treasury, in sometime in April of this year, you're slated to actually begin losing up to 10% of the funds if they're not utilized. If we don't spend at least 65% of the funds, we're going to start to lose those funds. And I did hear Ms. Hector state earlier that additional staffing could be utilized to help with the application process. There's also a percentage of the administrative costs that can be used for additional staffing or assistance with this program. And just like my colleagues, the calls don't stop of grown adults in our community calling us. Some of them are almost in tears, pleading and pleading, literally begging for assistance. And when we tell them, you can call it your program, that's an emergency, program. They can be dealt with within a week or two, 3 the most. And they call us back for months and months and months, and it seems like nothing is being done. So I reached out with my team and brought in an agency to assist the VI Housing Finance Authority with digitizing this program. All it takes is for the management to give the green light. What would we get for this assistance? It's gonna cost us a dime, you know. It's gonna cost the local government a dime. We're gonna get the program digitized. The applicants gonna receive alerts on their cell phones and their emails, home phone that have phones. They can receive voicemail, voice alerts on their phones. They can be able to go up and log on and see what's missing. If something is missing in an application, they can take their phone and take a picture of it, upload it, and when it gets to the agency, they will scan it, upload it to Word, transfer it to Word, and upload it into the application. Every application that's completed, 3 to 5 days, you get a check. 3 to 5 days. This agency turns over between 200 to 300 applications a month. And I know in my heart of heart, I have more than 600 people could utilize this assistance. However, they've been hearing on the street and be getting so frustrated when other people telling them, it doesn't make any sense to waste your time. You're going to waste your time applying because nothing is going to happen. Let me jump to human services for a second because I just heard I have about 2 more minutes left. I'm hopeful that the leadership in the VI Housing Finance Authority can just give the green light so our people can get some relief. I publicly ask you, pleading, please just give the green light. That's all you have to do. Human Services, Commissioner Gomez, before I start, I heard you mentioned 10 years ago, Human Services had about 300 more employees, and you stated you cannot provide the services that the community needs with the present staff. That's your belief? That's just a yes or no question.
1 minute.
That's your belief, Commissioner?
Not fully, no. I can provide a limited number of services with the staffing that I have, but I have waiting lists for every single program and division. So Meals on Wheels has a waiting list. Homewrecker has a waiting list. So if you're looking at those type of services, and I know that you're going to ask about the quality of service. So in order to get staffed up, we can provide quality services.
All right, thank you for your response. And for your family services specialists that you, St. John hasn't had a social work in God knows how long. But now that you've created family service specialists, which are technically almost like social workers, how many have been assigned to St. John? Have any of them been assigned to St. John? Yes, just yes or no? No?
Not to my knowledge.
Okay. The seniors in St. John who are mobile, they go to the churches and they meet with more than 20 and 25. They social distance, they wear their masks and stuff, but they need to be outside. They need to they just can't stay inside. Let me just Mr. Chair. They need to be outside. I took it upon my early in December. I went across with your Meals on Wheels program to feed the seniors. And doing that, so many of them who used to go to the center, they started to deteriorate. I gave persons at St. John who provide services the contact for Human Services, and they called Human Services, but no one returns their calls. They want to go to people's homes and provide things like masseuse. They want to braid hair. They want to read to them, assist them with grooming. Just spend time with them, spend 2 or 3 hours a day, because no one looks out for them. That was their only point of contact with the outside. The center. So if you don't have that in place, then you should find another way of getting services to these persons, because you provide a valuable service to the less fortunate or to children and families in the community. And just lastly, what's the status on the Head Start program on St. John?
So construction-wise, we're in the middle of the A&E construction design process, and so we got only federal funds to build that facility back. So we're looking at AC Benjamin is at a year and 3 or 4 months, and it should be up and running completely.
So now another year and another year, and
Well, first of all,
almost 2 years before the center is up and running.
Well, there are two things. The first and foremost, it was actually a FEMA-funded project. And when we applied for funding through Office of Head Start, which is completely 100% federally funded, they then put all the FEMA Head Start projects on hold, stating that because we were getting additional funding, they would no longer provide the FEMA funding. So once we were approved for funding for Office of Head Start, which is 100% federally funded with no local match, then we'll be able to have that fully into a state-of-the-art facility. In addition to that, we're also approved for a modular unit, not my favorite, because I heard the statements from both education and health about having modulars, but that is an option as well. We've actually been approved from FEMA to have a modular unit so we can have that for the next school year, which would be 2022-2023, sir.
Being confined to or having your movements restricted for like almost a year or even more than a year, it's not something that every person can actually deal with. I mean, even the police department has reported an increase in domestic violence cases throughout the inception of the pandemic. And ever since school started, I've been sent videos almost every day of children engaging in fights, and they ain't just regular fights. It's like they are in a rage. And what I want to ask you, has the Department of Human Services, in concert with the police department and Department of Education, have you all done any type of outreach, community outreach throughout the pandemic period? And that's it.
I think we're just coordinated during the pandemic. I would say no. That coordinated effort would be a no to a short answer to that. Are we engaging within education and VIPD currently? Yes, we actually had a dropout prevention discussion recently, and having those collaborative issues around students. And as I recall, most of the time that they come to DHS is usually an intervention, not usually a preventative type of thing. So I do think that we need to collaboratively work together in order to solve some of the rage and anger issues that you're seeing displayed now, especially in the schools, especially since they've been so inside for so long.
Mr. Chair, thank you very much for your time, and I echo the sentiments of my colleagues. You have to bring back human services within 30 days. Thank you very much for the time, sir.
Okay, thank you, Senator Payne. Michelle Ford, it's nice to see you there. You have been one of the lifeline for many individuals in the community, especially working in my office. I want to thank you publicly for that. Let me ask you, based on one of my colleagues' last statement in respect to some individual that's trying to assist the department with the agency with assisting many individuals with a ERA program. I know in the last hearing, we spoke to non-for-profit organizations to come online to assist the agency. Is the agency still accepting or onboarding non-for-profit organizations to assist them with the application process? Number one. And number two, let me ask you, when it comes to the agency also, where you're at in terms of response timelines when it comes to the process from beginning to end with those individuals, with applicants? Because I know that there are many funding for those services. So where are we at? Anyone?
Go ahead. You were asking where we were at with.
I asked two questions. The first question is, I know in the last hearing we had, we spoke to non-for-profit organizations coming on board to assist the agency, which you have onboarded a good much in St. Thomas and St. Croix. So are you still onboarding in non-for-profit, or you're at a point where you can handle the caseload? That's the first question.
So we're at a point where we would, that we are trying to handle the caseload while looking at, like Senator Payne said, we did meet with a group with him. And so we revisited all of those things so that we could meet the deadline in terms of this funding and get additional assistance.
Okay.
We're also looking internally.
Okay, thank you for
So
that.
we are working on it as a group.
Thank you.
Might I just add to that, Senator, please? As Ms. Selfwood said, we have changed or are looking at changing the strategy in terms of looking internally, cross-training some other staff to help with the workload, as well as to Senator Payne in terms of this company, et cetera, that can help in terms of doing a procurement process for that. Yes. Because it is federal funds, we would have to do a procurement process. So we recognize there is a problem, and we believe we have a strategy to move forward.
Okay, thank you. And secondly, in respect to the time frame, what the process from beginning to end, from intake to receiving a check, what the average time for individuals to receive a check from the time the process starts? I know it's different situation, but what have been the average for individuals?
Ms. Hector, I'd like you to respond to that, or Ms. Shelford, because I know you guys are intimately involved.
This is Ms. Hector. I will respond to that. Senator, as you indicated, it varies from case to case. I have seen cases that from the beginning of the processing to the issuance of a check, has taken 3 weeks. Obviously, I've seen cases that have taken longer, depending on many factors, such as, the ability to have the tenant and the landlord provide all the documentation. Sometimes we see cases where what has been asked for in the list of documents has been provided, but it still does not tell the story. And so in a situation like that, you still have to work with the applicant to say, well, okay, what is the story here? Because sometimes, folks will apply, they'll provide everything, and you're reading it and you're still saying, but what is the COVID impact? And if they haven't explained that well, then you have to, work with them to get that. And sometimes that leads you to needing other things, etc.
Thank you so much. And I didn't see who was speaking about us.
I'm sorry. I thought I identified myself. It was Ms. Hector.
That's fine. No, I'm talking about being on the screen. Senator Francis Heidegger, you're recognized for your 6 minutes.
Good afternoon once again to my colleagues. Good afternoon to the testifiers, and most of all, the people of this territory. When I was about 16 years old, there was a homeless lady that literally lived up underneath the tree next to my house. And I developed a friendship with her because, periodically we would give her food, check on her. And it came to a point where she needed some major help, and even her own family couldn't help her. She wasn't getting help from the government as she needed. And I went to my mother and I said to her, Mom, can she come stay with us? My mother said yes. And at 16 years old, for the next 3 years, that lady lived in my home with me and my family. And she thrived because she got the attention that she needed. She got the help that she needed. She was able to stay on her medication. And when she got to a point that she was so ready to blossom, the government came around and stepped back in and said, well, we could help her out now. She went downhill after that. And that's an experience that I have carried with me for years, for about 30 years. And sitting here today listening to the responses, and I was a little frustrated earlier, and as I sat here and I felt like my chest was closing in, and I was trying to understand what that feeling was as I listened to the responses and the back and forth and who didn't do this and it caused a sense of chaos and confusion for me that really saddened me today. Because I hurt for the people that need your services. And we're here talking mainly about one aspect of them, homelessness. But then I sat here and I started to think about the foster care, the seniors, people that have come to human services, molestation. Everything started to cover my mind. And I'm saying that if this is the chaos we're dealing with, just to speak about homelessness, I am frightened. I am genuinely frightened trying to understand what this agency does when it relates to helping the very humans. Human services, helping humans. And when I listened to Mr. Malik Stradiran talk about something he said to me as a senator sitting here, he said the people that come to us appreciate us working with them than even the government. So why are the very people feeling more safe, secure, getting the help they need from a nonprofit that have a fraction of the millions of dollars that flow through this agency? I have all these questions I could ask, but I genuinely need someone to tell me what is happening with this agency. We have 3 sets of people that I would have been proud to say that as social workers, you are now in leadership positions. You moved up the ranks. You know what happened when you started out and possibly had to deal with the very individuals, maybe from the bottom. And you moved up. But it almost seems like it's such a bureaucratic responses that I don't know if people have forgotten that human connection. When I sit here and I'm worried about the homeless lady that was almost raped the other day, because I get to go when I leave here, and when it's time for me to sleep, I have a nice bed to lay in. I have some place to put my head. But somebody is sleeping in the graveyard inside of an empty tomb because that's the best they can do. And I'm sitting here between tears and frustration because we all want to do better for these people. I didn't run for office to be in any back and forth. We trust that every single person in your agency, when they get up and head to work at 8 o'clock in the morning, they go in there with the best intention, with all their thoughts and abilities focused on making and helping the people that need it the most. Help them. That's all I care about. And for the life of me, Commissioner, I understand that you have a lot to do. I'm not going to sit here and try to tear anything down. But you have to understand, when we're listening to some of the responses, and we looked at this testimony, and I'm actually expecting updates, and I'm seeing a lot of fluff. I'm thinking, how serious does the life of that one person that has to sleep on that park bench actually means? It means a lot to me, and I want it to mean just as much to you and every single person that works in human services. Because even if it's one person that you had to find passed out on a bus stop, eventually died, they have to be your priority and your staff's priority every single day. We have to step away from the friendships. I have noticed one thing with this government. It is who you know, what you know, who's friend of who, and somebody could come in and be the most mediocre employee under the sun. But what we do is we shift them. We move them away. We can't fire this person and make sure they understand that their behavior and their inability to do their job is detrimental to somebody else's life. And because we have this mentality and nobody really bears the consequences, this is the result. That I'm sitting here frustrated and fearful of the people that put me in office. Fearful for the people that didn't even vote for me because they needed me to be their voice to come and ask you to help them. I'm just asking you, sometimes as human beings, we have to reset. We have to go back to the place where we began. We have to understand that, yes, I might be up here now, but this is where I started. And remember that you might be here, but there's somebody still down there that you need to reach out your hand and help pull up. And that's all I'm asking of this agency today. So I'm gonna ask when my colleagues bring you guys back, I am expecting an actual update that I could work with in order to help you to do a better job on behalf of the people of this territory. That's all I need, okay? Thank you.
Thank you.
Yes, ma'am.
So much, Senator Francis Halligan. We have 2 points of inquiries. First, we have Senator Saru with a point of inquiry, and then Senator Whitaker. Senator Saru, you're recognized for your point of inquiry.
Thank you, Mr. Chair. Going back to my point of inquiry is germane to the speaker prior to the last one. The Human Head Start, St. John. So in the absence of no building, do you have a Head Start program on St. John?
We don't have a Head Start program. However, the children that are eligible for Head Start are able to have vouchers for child care centers, so they're able to still get the child care that they need, either through their friends and family and or a voucher through a child care center.
Okay, so that's not a Head Start. They're getting a voucher. So Head Start
So
will...
they get child care, but not Head Start.
So they
unless
won't,
they come to St.
So the only way to receive a Head Start education is on St. Thomas?
or St. Croix right now.
Okay, and those vouchers, are you aware that St. John is also limited with the amount of Head Start programs that they have? So your vouchers still mean nothing in a sense that they are still limited in finding a daycare or preschool?
Yes. And that's why I want to make sure that we have the $43 million that we're getting for Head Start, that we'll be able to have really wonderful state-of-the-art facilities for 794 children.
And I'm saying that because I have, every year I've been in the Senate, I've had a staffer from St. John. And it's frustrating to watch my staffer not be able to have a place for her child to be educated. Voucher or not, the programs are limited. So there must be a plan of action in place to find there must be some temporary building that we can retrofit to at least have a Head Start for 25 of those young scholars. So I ask that you revisit the voucher program is one thing, but even the staff that was employed on St. John for the Head Start, where are they working now?
Assistant Commissioner Carla Benjamin can answer, but most likely they're working in St. Thomas.
They're working on.
So they're catching a boat to report to work on St. Thomas?
Correct.
Well, I think that we can find a building, use some federal funds, or if you need some funds anywhere to retrofit an area that's feasible, that can pass all the standards. St. John needs another preschool daycare. We continue to disenfranchise St. John, and young mothers have no place for their children to be educated in that early childhood education component. Thank you, Mr. Chair.
Thank you, Senator Saru. And as I stated earlier, we need to put ourselves in others' shoes so we can actually understand the hardship that they are facing. Senator Whitaker, you're recognized for your point of inquiry.
Thank you, Chairman. Commissioner Kazi Gomez, you have a subgrant awarded for homelessness. Can you please explain or provide the number of homeless individuals that have benefited from this, the one thing, at least I know of one subgrantee, and I also tied to that, Director Clendenin, I also want to find out from you when you all make the decisions concerning funding, particularly on homelessness. If an organization has received, what check do you do of the organization's receipt of funds from other government entities? So Commissioner Kazi Gomez, how many people have been served as a result of the funds received through a sub-grant for homelessness?
I'll have to double check that particular for you. But just so you're aware, the miscellaneous budget, this body legislature, miscellaneous budget and the crisis intervention funding are designated. You're the body that designates.
No, Commissioner. Right. My question is not a question about the amount of designation. I'm asking you, what's the number of homelessness to have? You give money out, and you have to measure it. So what's the number of homeless individuals who have benefited from your awarding to them through that process? Do you have the number of homelessness who have benefited from receiving the funds? You have at least I know one sub-grant.
So Ms. Chutine actually does regular checks with the nonprofit agencies she's worked with, and then she expects reporting as well. And I believe she's still online. Kendall, are you still online that you're able to maybe answer that question? I see her logged in, but yeah, go ahead, Kendall.
Good evening. Kendall Chutine, Director of Nonprofit Services and Support Services for the Department of Human Services. As Commissioner Kazi Gomez stated,
excuse me, can you please turn on your camera? Can you please turn on your camera?
Oh, I'm sorry.
Thank you so much.
I forgot about that. I apologize.
It's okay.
The Commissioner, as she said, we are providing oversight to about 9 homeless service programs in the territory. And as far as being able to give you like total number, I would really need to break that down by the different services that we are funding. To give you an example, under the homeless prevention, at least 20 people have benefited from going through that homeless prevention program that we have. With the Catholic Charities programming through their Bethlehem House, the House of Hope on St. Croix, and their outreach program. They service over 100 to 120 between the sheltering and the feedings that they provide, and the contacts that they make outside, with their outreach program. So what I can do is I can provide it in writing by program with the different types of services that are provided. But I could say 200 to 300 people have benefited from the programming that we have been monitoring over the last year.
I'm going to dive deeper into that because it's different. Mm-hmm. Feeding is one thing, service is one thing, and really assisting people to get back out there to, in working conditions is different, because a lot of what the churches are doing, they are more engaged in the feeding aspect as well as nonprofits. We have to get beyond just the feeding. We have to get people, do our best to get them back into, to be able to, beyond, the street, and getting them where they can transition, have transitional housing for them to get a job. Just feeding them, and the money is going into that. Feeding them is important, but we need to work really on making a lot of these individuals whole, and that's not happening. Thank you, Chair.
Can I speak to that? I know you have limited time.
Please do.
Okay. I wholeheartedly agree, and the nonprofits agree as well. One of the issues that they are experiencing is when we do have shelters, it's very, very difficult to move people from a shelter to transitional housing to permanent supportive when we don't have the inventory. People are staying way too long at the shelter level because there's no ability to move them to the transitional level, or again, because there's no permanent housing inventory available to support this subpopulation. They're staying in the transitional housing level too long, with backlogs coming in at the shelter level. So the bed space is limited, and in order to move people from one level to the next level to the next, we need to make sure that we're building inventory.
Okay, thank
Another issue that they're facing is they don't have enough money to pay enough staff to meet the need and the demand of all the homeless people, whether they're unsheltered or at risk for being homeless.
Okay, okay, thank you so much for that. And please send that information to the chair, Senator Francis' office, okay? Senator Joseph, you're recognized for your 6 minutes.
Thank you so much, Mr. Chairman, and a pleasant good evening to you and the colleagues, as well as the people of the Virgin Islands and our testifiers. We've been here practically all day. It's now minutes to 7, but we are going to plug on. Now, my questions are going to be geared towards human services. One of our testimonies that came through, and it was read into the record, talked about us being judged, us as a community being judged by how we take care of the least among us. So let's focus in on who I deem are the least among us. And there's 2 demographics, of course, and that's our elders as well as persons who are homeless. Those are some of the segments that we have in our community that are being underserved. We just have to admit they're being severely underserved. Now, in your testimony, Commissioner, I have to tell you, I was looking for more meat. I was looking for numbers. I was looking for timelines. I was looking for quantitative information that I know that your administrators submit on a monthly basis to you with their monthly report. That should have been included in this testimony. So next time when you come, bring the quantitative data. That's what's key. That's how we understand the need, so we can support you. And also bring a status of the money, because the money is sent here to deal with the needs. Okay, that's how that's how you are being paid. That's how all of the workers are being paid, from that federal money. So you shouldn't be bringing to us any type of testimony that doesn't include the funding source, specifically where we are with expending the money, how many clients are being served. Okay, what is your timeline for your developments and all of those things? Those are critical. Those are work plans. And all of you should know this because, I remember I had to provide reports. And my report was both narrative in nature as well as qualitative and quantitative. So you know this. So this is not a very pleasant day for me, because I know what I used to have to report on to my supervisor on a monthly basis. And you are at the helm. Do better. When you know better, do better. So don't do this anymore. Please do not do it again. Now let's go back. Now let's go
3 minutes.
Thank you kindly. Now let's go to the status of the elderly facilities. We know we have borders. We know we are in need of assisted living facilities as well as skilled nursing facilities. Where are we with that? Where are we? Because I know there was some movement to purchase some properties over here. The governor had spoke about it in his State of the Territory last year. I remember that vividly. Where are we with that?
I'm at the Department of Property and Procurement, so we're going to talk about 2 islands. The first one is St. Thomas Queen Louise Home for the Aged. So we got 100% prudent replacement, 100% for Queen Louise Home, the existing facility. We're in land negotiation swaps for Queen Louise, and that should be completed within the next 2 to 3 weeks. And we're doing that through property and procurement, because that is the entity that does the negotiations for any kind of land purchase and or swapping, I guess it would be a good word.
So you're swapping the property, hold up, you're swapping the property at Queen Louise Home for another?
No, I have a new identified property to build a brand spanking new Queen Louise Home facility. And until I close on that property, I'm not going to disclose it because if I come to this body and say, it didn't work out.
I recall.
So we're going to.
I'm sorry to interrupt you, but I do recall A.C. Reimer Brown talking about it last year. Last year, she'd already identified it. So what's the hold up? This, we under a state of emergency. Our elders in a crisis. This is crisis situation. So how are we moving to expedite the process?
We're doing weekly meetings with FEMA, weekly meetings with about the CDBG discovery, Department of Property and Procurement, the planning and natural resources when it comes to Head Start, Department of Public Works. So it's not just DHS as far as the entity doing it. It has a collaborative federal approach as well as all of our local entities. It just takes a long time for construction.
Okay, I'm sorry. What funding source are you using to make this purchase? And that's just skilled. Yes, that's just for the skilled nursing facility, right?
Yes, skilled nursing, Queen Louise. It'll be state-of-the-art CMS certified facility. The funding source is CDBG application. Until I get the land, I'm not able to do the application. The Queen Louise, the Herbert Grigg home application for CDBG is already in.
Okay, because if you're doing that with CDBG, and I have to remember because I have written some grants, you do need the land, but that shouldn't, you could have been simultaneously preparing. Yes, you can. You can be, yes, you can. Preparing. I didn't talk about submitting. I ain't talking about the submission. I'm talking about preparing. Mr. Chairman, may I? You could be simultaneously preparing the grant application for the CDBG while you're going through the process to purchase the land.
And I agree with you. And we actually have the draft application. I just can't submit it. So once the land so it's not that I haven't done that, because we've done the research. We've got all of that aspect of it, how much it's going to cost and all that. We've actually done the Healthy Housing Initiative as well. So we've done that portion.
Okay. So you're going, so when you could use CDBG money to purchase land. So
correct, but it's
CDBG funding. Hold up, because I one thing I know about is grants. You can use the CDBG money to purchase this land.
We're in negotiation. We're in negotiation of land. So once property procurement approves the fact that we're able to purchase it, then we'll be able to put that whole application in with the purchase price in the CDB application. Until we negotiate that, I can't put it in the application.
Okay. All right. And so it's taken you, several months to negotiate that?
Yeah, and that's not Human Services. That's Department of Property Procurement.
Well, I'm going to have a discussion with Commissioner Anthony Thomas, because I know there must be more in that mortar than the pestle. Mr.
But may I? There's more than one funding source.
Oh, it's more than one. Now we're getting to it. Which other funding sources you're using besides CDBG? Because CDBG go ahead.
There's two positions: disaster recovery and mitigation. Because the project's going to be about $40 million. So CDBG is the funding source. Disaster recovery and mitigation are two tranches under CDBG, and then the FEMA funds as well. So it's going to be a combination, because the building will be about $41 million to build.
I just wanted to know the funding source for the purchase of the land, because purchasing the land is CDBG allowable cost. Acquisition of land is an allowable cost under CDBG funding. I know that. So you're telling me that the land acquisition have been down in procurement for over 2 to 3 months. Is that what you're representing on the record?
Yes.
Okay, thank you. Mr. Chairman, I don't have any more questions. Thank you kindly.
Thank you so much, Senator Joseph. Commissioner Gomez, based on my last colleague line of questioning, with the land. It has been some time now since we spoke to purchasing, basically get that building for our senior. That's very good news, first of all. I'm happy to hear that. How close are we? I'm not going to get into detail because I know you really can, but how close are we to finalizing that process?
I actually met with Commissioner Thomas yesterday and DC Richards from Property Procurement, and they assured me that the land swap negotiation would be within the next several weeks.
That's good.
And so once that's done, it's very good news.
Thank you for that. The colleagues, we're going to do one more round, a rapid round. We're going to do one more round, 3-minute round, and listen, 4 minutes. Senator Fiele, I'm going to recognize you for your 4 minutes. You recognize. Senator Fiele.
Thank you. Thank you, Mr. Chair. Ms. Glendon, in reference to the CBDG, DR funded project, I know you said that the 18-unit Trinidad Inn was acquired. The authority expects to have 36 emergency housing units functionable this year. Where are those 36 housing units, and what is the status of the Trinidad Inn? You're going to renovate it, but what is the timetable for renovation and for work to actually start?
Thank you for the question, Senator. I will have the Chief Operating Officer, Mr. Richardson, respond.
Good day, Senator. How are you doing? Good afternoon. Darren Richardson, Chief Operating Officer, Virgin Islands Housing Finance Authority. Now, going back to your 36 units of, one second.
You said that they will be functional this year. Where are those 36 units located?
The 36 units that would be is actually going to be the 28 units on St. Croix. It'll be 8 at it'll be 12 at Estate Profit. It'll be 8 at Campo Rico. 20. I'm
okay,
sorry,
12
16
and 8. Go ahead.
Sorry.
That's 20.
Sorry, it's actually going to be 16 and 12. It'll be total of 16 at Campo Rico. We intend to have finished the 8-unit building and 12 at Estate Profit. And going back to Cranigari,
and also of the 16.
Excuse me?
And also of the 16-unit emergency housing.
No, that is
the roof was repaired. What is the status of
the roof was repaired?
Of the interior space and road repair.
Undergoing
2 minutes.
Undergoing architectural drawing for the renovation of the interiors and the roads, and I don't think I'm going to get that in service this year. Still has to go through complete the plans, do the procurement, and I don't think I could get that completed.
Okay, thank you so much. Commissioner, any of your social programs contingent on school enrollment, that they have to show proof that their children are enrolled in school?
Great question, and I'm trying to think of the eligibility for TANF, potentially. AC Bremer Brown, do you have the eligibility? That's the only one I can think of potentially that they're enrolled in school. I don't know if that they just have to have children. I don't know if the enrollment in school is one. PEBT, in order to receive that, I know that they had to be certified through whether it be the private or the public schools.
Let me change the question.
Okay.
Is it possible to make receipt of these social programs contingent on school enrollment, that you won't necessarily fund X, Y, and Z unless there's proof that the children are in school? Because, I mean, the overall is that we want to help the family, and we don't want to have young students that are being kept at home and not being sent to school. And our school enrollment have severely decreased since this pandemic, and we have a number of students who are not attending school, or a number of students who are failing. Is there any way that we can utilize these social programs as an incentive to make sure that they remain in school?
Time.
Great question, and I'm not sure I can answer it based on the eligibility for being in school, PEBT would be the only thing qualifying them for that benefit. AC Reimer Brown, do you know of anything that would qualify them to have to be in school?
Not right now, especially for PBT. It deals with the public health emergency and the requirements of the local government. So if the governor declares that no one attends school, PBT will pay for those children who are not in school. So there's not a requirement, Senator, that they must be enrolled because of the pandemic public health emergency.
Through our social workers, are we seeing a large number of individuals who are dropping out of school and some of these families that are facing issues?
So the school dropout aspect, I don't even know what the statistics are as far as the dropouts are concerned. I know that like right now at our Youth Rehabilitation Center, Carla, what's the census? Is it 11 right now at YRC?
The census at YRC now is 10. The alarming thing that we're seeing on the social work side is children who are virtual, who are not logging on. So hopefully, folks going back in person will help to remediate that particular issue.
Okay. In reference to your district managers to the Adult Protective Services, those two individuals are acting?
They were acting as a district manager, and then they're currently in social work positions, but I believe that we're working on the PRFs and NOPAs for them to go into those positions.
So to your knowledge, you don't think they are presently acting? They have been made permanent?
DC Rojas is on and should be happy to answer.
Sure. Good evening, Senator Violet. This is Deputy Commissioner Rojas. We just received the PRFs from OMB last Friday.
I can't see it.
Yes, go ahead.
Okay, sorry, just a little bit technical on this side. And so those are going to... Thank you. So those are going to, they're in process now that we have the PRF back to be able to move them into those positions. But those are classified, so they have to be posted and then internally posted for departmental promotion. And once that time frame is done, they can then be put into the position.
Time period, estimate?
It will be 2 weeks because the posting has to be for 10 days. And then after that, it will be entering it into the system for their promotion. And with Division of Personnel, their turnaround time for NOPAs is 3 to 5 days. So it would take about, in total, with that being in mind, it would be 3 weeks.
Time.
Okay, and I'm asking a question because they're acting in that particular position, and from the information I'm getting, they're still functioning as social workers because of your shortage that we presently have. And I really think that we need to do everything possible to retain those social workers that we presently have. And if they're in a management position and they're acting, that we get them to be permanent as quick as possible. And then we work on the back pay for the time that they were acting. You also have some individuals that you're successfully able to transition from acting to permanent, but what is the status of the back pay for the period of time they were acting? When are they going to get that?
So those are the ones that we mentioned earlier that OMB has asked for additional information. So when we originally came to you guys, we had people who were acting and those positions became available and they moved into it. Right now, that's why we have such a little bit amount of individuals who are acting today. And we have put those positions on the FY22 general fund budget so that we can move them into it. Once those positions are approved, their PRFs are currently at OMB for these other individuals, then we can move them into it. And once we submit the documentation that
Okay.
OMB asked for us yesterday, we'll be able to move
But
forward
I'm
and pay
talking about
the amount they have owed to them for acting.
one minute, ma'am. I'm talking about those individuals that have already gone through the process and received the NOPA for the permanent position. They're no longer acting. They're in a permanent position, but they have not received the back pay. So I'm not speaking about that internal process. And that process you spoke about, we have been speaking about that from last year. And we are willing to do anything possible to coordinate with OMB, and OMB have stated that they're awaiting, that they just need the information in order to process and make it a go. So what happens to the back pay for those that have already gone through the process, that have already been in a permanent, they're already now in a permanent position, they're now getting the right pay, but they're owed back pay for 2-3 years and sometimes more.
Forward with the rest of getting our requests approved. And I've been asking and working with them since last year, because the PRFs we sent down before the end of the fiscal year did not get processed. And I have been working with them, including working with the commissioner and other members to get these going. And yesterday I received an update requesting for additional information for me to be able to process the PRFs. Individuals who were previously acting and moved into their roles, the majority of them did get their acting pay paid to them. There is just only a few individuals who are due monies. And there are also individuals who are due monies for other things, and that's on our list as well. So we are working directly with OMB. I have been integrally talking to them and asking for everything that needs to be done to be able to get this money paid so it can be off of our list of things.
Thank you, Mr. Chair.
Before we go to Senator Blyden, let me first of all thank Senator Blyden for sitting in while I travel back to St. Croix. Before I go to Senator Blyden for his 4-minute round, I wanted to ask you, Commissioner, is there any arrangement being made to allow for the servicing of SNAP recipients in the Christiansted area? How are they being able to be processed? Do they always have to go to Frederiksted, or there's something being done to at least have a satellite office in the Christiansted East area?
Right now, there's no plans for an Easton satellite office, Senator. Most of the time, we've done waivers.
You're on mute. Try that again.
Can you hear me now? Mic check.
Yes. Yeah,
Okay,
yes,
now?
you can.
So it's right now, we do not have a satellite or an office that would be in the east. Most everything is consolidated in the west end office. We've done waivers and flexibilities, lots of online certifications and phone calls, especially during the pandemic. But right now we don't have anything that would be considered the east end. And it's not a regular basis that they would have to go to the office. And especially during the pandemic, we have not required that. So now that the recertifications are coming, it's not every, I don't know, AC Reimer Brown, it's not every month that they would have to be required to do so.
No, as a matter of fact, recertification is once a year. For seniors, it's 2 years or more. So there is a reduction in the requirement to come in person in the office. We asked for the waiver, Senator, for telephone recertifications, and that has been passed.
Very well. Very well. Thank you for that. That's good. Commissioner, what about your meeting with your staff? When was the last time you have had a meeting with your rank and file staff?
I'll have to double check. We did town halls, I believe. It was last year that we did town hall meetings. We did them by division, and we're planning to do those again in March. And these ones will be actually in person. We decided that we'll do it at a church so we can do it safely, in order to accommodate the large staff. So that was already in the planning mechanism for that. I've done some walkthroughs as far as YRC is concerned, Head Starts and whatnot. I've done those as well individually, not formal meetings, but walk through. And I know I definitely need to do that again. I've been to St. John probably 3 or 4 times over the last month as well, looking at shelters and also working with staff there. So it definitely is challenging to have as many sites as we do have in order to get to everybody. But March will be the time where we do the town hall meetings, and we'll make sure that we do it in a safe environment as far as the amount of staff that are coming. So we'll have to do it by divisions.
Okay, so you plan to do a plenary session sometime in March, and you'll do it per district as well.
We'll do it per district, and then we'll do it in a way that we're able to do it in person. We did it virtually several times, and I feel like the in-person seems to be more impactful. And then we'll make sure that we are able to give a good update for everybody. But yeah, we'll do that. We've done some divisional meetings, depending upon. We've had several meetings with Head Start virtually, and that we probably have 4 or 5 meetings with Head Start over the last 4 months, especially since the vaccination mandate. We've done those by classroom and by virtual and by district. So,
Senator Blyden, you're recognized for your 4 minutes at this.
Thank you.
And again, thank you for sitting in.
Thank you, Mr. Chair. Anytime. And you're welcome. Commissioner Gomez, let me ask you, in your testimony, you mentioned the Low Housing Water Assistance Program that's federally funded. What's the amount of that grant award?
Assistant Commissioner McHale, that's a brand spanking new one we just got. So
yes. Good evening, Senator Blyden. That award is relatively small. It's about $195,000. We have requested additional ARPA funding from our Office of the Governor, and we are awaiting the word on that. But water assistance, this is the first year they've released it on the federal level, and we're excited to get that started.
Okay, you have assisted for more funding. How many individuals have been assisted thus far?
The program has not kicked off as yet. We have just received the award and the approval to expend because our state plan, even though a small amount of money, $195,000, had to be approved. So now we are gearing up to move forward with the $195,000. It will be for people who have had cutoff notices, who are in emergency assistance. But if we do get the additional funding, we'll be able to help more people.
So when do you plan to advertise, and what type of advertising will you be putting forth?
You should be hearing some advertising before the end of February. We're working together on the PR campaigns to put that out there, and you'll be seeing that, Senator, along with a couple other programs from Human Services that are COVID funded.
Okay, thank you for that. And Mr. Richardson, good evening. Mr. Richardson, Darren.
Good evening, Senator.
Hi. Let me ask you quickly. I know you have the, I believe it was mentioned in testimony that there are 8 or 6 individuals still left at the emergency housing around the field. How many individuals are still there at that site?
At Charlotte?
Yes.
There is 17 individuals at Charlotte.
Okay, because I know several years ago, it was slated to demolish.
Yeah, we have 1 building for demolition.
Okay, and what about a site up on the hill by Manasseh Road? When is that slated for demolition? It should have been happening already by now.
You're talking about the one Queen Louise up on Fireburn Hill?
Yes.
That's slated. The contract have been signed. They did the pre-construction, pre-demolition meeting. That should be starting this month.
This month?
Yes, it was delayed because the contractor was delayed.
So you're on schedule?
Yes, we are a little behind schedule, but the contractor had asked for more time to complete another project, and we allowed him some additional time, so we are on schedule now.
Okay. Happy to hear that. And what about the issues that the issues at Charlotte? Have those issues been addressed in terms of the maintenance issues? I know there were some maintenance issues, but there were hesitation there because of decisions, etc. What's going on in that space?
No, we're currently, there's 3 units that are really bad, that's unoccupied, that we're working to bring back online. But those
2 minutes
buildings are really, as you may know, really old. So we're constantly having to do, repair tickets on those. Our thought is, how to bring more newer units online and then eventually move to the demolition and reconstruction on that site, because those buildings are bad.
Yeah, I know they're bad. If I ask, at least you're dealing with the health and safety issues, are you?
Yes, we are. We're doing all the tickets that we have, and we constantly doing our HQS checks and stuff like that.
Okay, very well. And before my time is up, Commissioner Gomez, I know it seems like we gave you a hard time today, but it's all in a spirit of love, because we really want the best, as you do, for our people here in the territory, especially our seniors, and those that's most vulnerable. And it's non-personal, but at the same time, we all are related. We all try to look out for each other, and we all try to do the best on behalf of our people. And we try to work with all of the different agencies in coming up with solutions and solving problems, but we need information in order to assist, and give proper feedback. And that's all it is. It ain't non-personal. And I want to thank you guys for hanging in there with us all day. Of course, all of my colleagues have requested that, we see you guys within 30 days again, so we can really deep dive and get into the meat of the issues. So this is 2022, we really have a lot of work to do. And it's never a bad time or a wrong time to do the right thing. So I believe this year we're going to be a little bit more aggressive with the different committees, different departments, and we're going to try and be more creative. And as I stated earlier, think outside of the box and coming up with solutions. We're not going to have any excuse anymore, but we're going to find our way to get it done, period. Because we have seen unprecedented funding coming into the territory through the disaster, through COVID, and we must find a way to utilize every penny, federal dollars, before we even touch the local dollars. That's what I feel. And we need to work together and really find a way to, really work hard on behalf of our people. Thank you so much, Mr. Chair, for the time, and everyone have a blessed evening and rest of the week. Thank you.
Thank you very much, Senator Blyden. Senator Saru, you recognize for your 4 minutes.
Thank you, Mr. Chair. The previous senator said that don't take it personal and ain't personal, and he softened the discussion up. But this is personal for me. This is personal. And we open every Senate session praying, and I believe the Bible asks that if we help the poor and we feed the hungry, then our nation can be called a repairer of the breach. And human services should be the repairer of the breach. Now, Commissioner Kazi Gomez, Queen Louise, is it still one big communal area?
Yes.
No.
But we have dividers.
So we have something up?
They're like, what would you call them? AC Ram around. They're like
the plexiglass. Okay, good.
Correct.
Yes, we have barriers between the bed spaces and the area, Senator.
That's all I asked for. That's good. MAP, Provider Relations. We have the job titles for Provider Relations Unit. Any NOPAs have been executed for MAP, that unit? Or we still have the 1.5, 2 employees still there acting in their positions as admin assistants? Do we have Provider Relations? Ms. Rojas?
Good evening, Senator. Sorry, we're both on mute. Good evening, Senator Saru. Yes, well, We are working with the Division of Personnel on the reallocation, on the whole review of the job description. It has been a long time that we've been working on it, and it is. I actually had a meeting yesterday that had to be moved, so I plan to meet with them next week in order to proceed going.
Ms. Rojas,
Provider
I talking about MAP from the previous commissioner. Provider relations are critical, especially with the expansion of MAP. In 2022, there is no reason why those people have not been moved into the provider relations unit. Now, next thing, you hire, I have a lot of complaints about HR. October, an employee, let me give you one example. An employee started in October. Today is February. That employee just received their NOPA last week and still have not been paid. That's one. Number two, people have interviewed, they've been given a start date, they've quit their previous job because a start date was given to report to work, and when it's time to report to work, no job for them, and they've quit the previous job, and they've been unemployed since then, waiting for human services. That is the reality. Ms. Rojas, speak to me, please.
Yes, thank you again for the question. In regards to the situations, they're each on a different issue. So in regards to the person that you are referencing, the budget that we had for that individual in particular, we had the extension information, and that was sent down to OMB because the PRF had expired. The budget had expired on 9/30. Part of the process with what we are experiencing is that when we go to send down the information for reapproval, we are told that we now have to do an adjustment on our payroll side for the 2-year budget that we have. And that is what we're encountering. So it's an unforeseen challenge that we did not know. Had we known that, we would not have had an offer for that person to come on with a start date and put them in that situation where they have left their position to come to us.
Ms. Rojas,
2 minutes.
You telling me this, right? And you know when I pick up the phone and I call Director O'Neill, I am going to get a horse of a different color of an answer? That's always the situation. Then employees, we telling employees, hey, your start date is next week, and they tell the job, they get a job at 2-week notice, and when it's time to report to work, you have no job for them. Now I'm looking at Indeed. Indeed has nothing. First of all, how many vacancies do you have in the Department of Human Services? Commissioner Gomez, I'm coming to you. How many vacancies do you have in Human Services in totality?
I believe it's 116 PRFs that we sent down.
How many have? 116, Ms. Rojas, 116 all are funded by this department?
Yes, correct. 116 were sent to OMB. We've received recently 72 approved PRFs.
Okay. Now, this is where I'm going, right? So,
now,
go ahead.
We have 15 currently posted on the neo.gov website.
Okay, and that's exactly where I'm going, because 116 positions funded, the same that were funded in the previous fiscal year and the previous fiscal year before that. And then you have 72 approved, and then you only have 9, and you have no vacancy posted on the Department of Human Services website, nothing at all. And then the measly 15 I found was on the Division of Personnel website, and then you have no vacancy listed on Indeed or anywhere else or any major job search. How do you expect to recruit people to work for Human Services?
30 seconds.
And so that's a rhetorical question, right?
And thank you for the question. I'd like to respond to that. This is Deputy Commissioner Rhoda Rojas. In regards to the positions that we just received, Senator, we received 32 positions back from OMB yesterday. So while
Ms. Rojas, hold on. Excuse my frustration, but Commissioner Kazi Gomez, do you remember when I copied both you and Director O'Neill on an email early last year, asking about the jobs and what's the delay? Do you remember the response? So we can't put 100% on OMB giving you the codes, I'm going to say QR code, the code for a job when the both of you want the same trainer emails? And Commissioner Kazi Gomez, do you not see a problem with the response from HR in regard to hiring a young lady from October, still no pay? You don't see a problem with that? You think it's fair for somebody to come to work from October to now they have children and bills to pay and no pay? You don't see a problem with telling people that they're going to start work tomorrow and they show up for the job and they have no job? We don't see a problem with that. You don't see a problem with those responses? You are a social worker. You should naturally be an empath. And we don't see a problem with any of that? Thank you for the time, Mr.
Yes,
Chair.
I do. I'm not sure if there was a question, but I do, yes, I do think that that is occurs.
Thank you, Senator Sauro. At this time, Senator Blyden, you recognize for your point of inquiry.
Thank you, Mr. Chair. Commissioner Gomez, do you have any posting in-house?
When you say in-house, so
Within the
internal
department?
postings?
Yes, within the department.
So I'm not sure, like just to give the information in-house, like through like an all DHS type of understanding.
Yeah, for the employees that work there.
We've done it on a couple of different occasions. We haven't done it for the recent 15.
That was my.
But what the plan, what the plan was, once we get the 72, we were going to list them all, and then as soon as we get the other person on for HR, we're actually doing a job fair because we should have Head Start, SNAP, and Medicaid, and a few other federal and local positions. So we should have a good chunk, a lot of positions that we haven't had before.
It's important to always start at home. You give the employee an opportunity first. So you need to post it in-house, and it also helps to build morale. Thank you so much, Mr. Chair, for the time.
Thank you very much, Senator Blyden. Before we go to Senator Gittens for his round, I wanted to ask Deputy Commissioner Rojas, have the employees who retire from before the collective bargaining agreement had been completed, have they been made whole?
Thank you, Senator Francis. Thank you, Senator Francis, for the question. This is Deputy Commissioner Rojas. In regards to the amount, they are no, they have not been made whole yet. The vacancy savings that I'm working with through OMB is what I am going to use to be able to pay those individuals for that amount. I have the agreed upon list from the union, and the next step is to use the vacancy savings identified through OMB to be able to pay for those individuals. Right now, OMB wants me to first pay for the outstanding monies that I've spoken about, and then from there I will work with them to pay for these individuals who have not been paid per the CBA, which was I'm not sure the reason why it was not taken care of previously, but that is what we are here to solve and make them complete.
Any timeline in which you intend to hopefully be able to execute that payment?
I would like to say that it's going to be completed in the near future, being within this quarter. But my only thing is it's not reliant on just me. So it depends on how quickly I can work through OMB to get it done.
Very well. Senator Gittens, you recognize for your 4 minutes.
Thank you, Mr. Chair. And I know we had a long day, but don't let our colleagues let you pull your hair out asking you to bring back the Department of Human Services in the next 30 days. I'm sitting here wondering, what can they tell us in 30 days that they can't tell us in 1,136 days? That's how long they've been in office. And this is where we're at today. As I recall in the State of the Territory address, the only thing that was basically mentioned with the Department of Human Services was that our children did not go hungry, and the brag of $23 million or so in food benefits. I really wonder if we realize how much work we have before us. I wanted earlier, I was asking for a point of information and point of inquiry to find out from the Department of Human Services with regards to Hobart Gregg. I know you already stated that you don't have a timeline on the repairs of the dormitories. However, what's the status, and if media can show the pic, because this is far too long from 2017 that our employees and the residents of Hobart Gregg, whenever that dining room is finally completed, would have to still walk in the open areas. When would we be able to see some kind of covering from the dorm up to the dining room? And media, if you have the picture so that they can understand exactly what I'm talking about, so that they could see, please. We have personnel working in the laundry, working in the kitchen, etc., that would have to traverse from, that's the dining room area that you're seeing there, that will have to come down that walkway, and there is no covering from 2017. The frame is still up on the corners of the end of the walkway, but no covering. Do we need to wait for FEMA approval as well to put up the covering from at least this first dorm building where our residents are, going back up to the dining room?
So is that
All this is open. We had a whole set of rain here the other day. Imagine going with laundry or food from one building to the next. That's it, media. So I'm asking, what would it take now to get that covering back up?
Covering, I can do a temporary covering, and then I actually proposed that to Ms. Martinez at Harbor Gregg as well as DT Tricoci regarding a temporary covering in the event while we're doing that. And then that way it can be taken down during any type of storm. So then that way that's actually a solution. So we talked about that. We'll get that done by April. The dining area, thank goodness the roof is completely finished and it's really looking nice. And so DVD Construction has stated that they should be completed within the next month. 3 to 4 weeks is what they've told us. And so that will make sure that we follow up with that. And I look forward to everybody being able to be in the cafeteria when they are.
Commissioner, it's been 3 years I've been asking about this covering. 3 years. And we still don't have an answer. Let's go to YRC. What's the current conditions like at YRC with the building structure? And who oversees that facility at this time?
I'll allow AC Benjamin to speak. Right now, we have a position that's vacant, which is the administrator for the Division of Intervention and Prevention Services. And so that was the administrator. At YRC specifically, we have the chief. Well, I'll allow AC Benjamin to kind of see the triad that's there right now.
But before you turn it over, the vacancy that you speak of, what position is that?
The administrator for the Division of Intervention and Prevention Services, which oversight of
and how long has
YRC.
that been vacant?
I believe it was November.
People walking away because they're frustrated.
Actually, a relocation on
the again, COVID-19 has become, like I said yesterday, a new brand for Band-Aid in this government, for a Band-Aid for every sore. So our senior centers remain closed from since the pandemic of March 2020. How many staff members are we talking about that are now added to the senior community nutrition aides to deliver food. And is this the same program as the Meals on Wheels?
Commissioner, would you like me to answer this?
Yes, please.
Yes, Senator, good evening. Mikkel Reimer Brown, Assistant Commissioner with Oversight of the Senior Citizens Affairs. We are currently going to be posting, because our ARPA funding has arrived, and we are going to be adding approximately
Stop. Assistant Commissioner, you're not answering the question. Sir. How many staff members? There was a statement earlier that the senior center staff was added to the senior community nutrition aides to deliver food. I'm asking one, is this the same as Meals on Wheels? And I'm asking, how many staff members are we talking about that were actually added to this senior community nutrition aides program?
Okay, Senator, let me clarify. They were not added to the Meals on Wheels staff. They took the meals to the seniors' homes, who they would regularly feed within the centers. So if per day, 2 days, 2 workers would go out to make the delivery, or 3, they took it to those specific 50 or 60 people who would have been in the senior centers. So they were not added to the Meals on Wheels staff.
So again, you should have answered the first one first. If so, Meals on Wheels is
30
the
seconds.
community nutrition aids program. Yes?
That is the familiar name, yes.
Okay. And it wasn't my words that they were added to the senior community nutrition aids. I'm looking at my note. I wrote down exactly what the commissioner stated, that they were added to the senior community nutrition aids. I like to pull records, so I'm not putting words in your mouth. That was used earlier,
Senator.
And I'm just simply asking whether or not it's the same program. You stated yes, and I wanted to know how many employees are affected that were actually added, or however you want to put it. How many of those employees now delivering food?
Time.
There should have been about 4 staff on St. Croix. They take it to their clients. And on St. Thomas, there are about 3 staff who deliver to their clients in the St. Thomas, on the St. Thomas Island. The Meals on Wheels, or senior nutrition staff, they continue to serve approximately 800 or so home delivered meals clients who were not previously in the senior centers.
And is this the total amount in this in the senior center program? 4 on St. Croix and 3 on St. Thomas? Yes or no?
The staff who deliver, yes.
In the staff who deliver, yes. You're telling me who's delivering, but I'm asking, is that the total amount of staff members assigned to the senior center? 4 on St. Croix, 3 on St. Thomas?
We have a couple more on St. Croix, and it's a round robin that they go out and they exchange. I would have to get that exact number in each center for you.
The reason I'm asking is because I want to know what the others are doing. And are all the seniors that's in that participated in the senior center program, are all of them on this daily meal delivery program?
Not all of them. The rest of our staff, they continue to keep in touch with our seniors. They do wellness visits. They take them arts and crafts. At times, we have held various social activities in churches. In May month, we had limited activities. So we have not just stepped aside from the seniors. The senior center staff have continued to work with their clients from home.
And Mr. Chair, I'll wrap up here. As I stated that, COVID has become a Band-Aid for every store, and the senior centers have been closed since March 2020. So I want to know from the Department of Human Services, what's the status of our senior centers throughout the territory? How many do we have on St. Croix and St. Thomas and on St. John? And if the CDBG funding is not approved due to the location you stated for Aldersville and Frederickstead, have you or your team looked at any other suitable location on the western end of the island?
Go ahead, AC.
For St. Croix, no, Senator. We are focused on Richmond Senior Center at this particular point. When we reactivate the senior center there, if there's more of a need, then we will take a look. Actually, the complex for Herbert Grigg, the reconstruction, we also had plans for a senior center to operate in that facility. So, you know, it works with the different stages and the different plans. But for now, we're in Richmond and we're at Strive on St. Thomas, and we will be at Adrian Senior Center on St. John for now.
I'm sorry. Okay, you said Richmond St. Croix. What happened to the Aldersville facility?
The Aldersville facility has long been in disrepair, even before 2012, I believe. That has been in disrepair. We
know that. We know that, Assistant Commissioner. We want to know what you're doing to reopen this facility for those residents on the western end of the island.
That facility, Senator, is not in our immediate plans to have a senior center. We are working on a collaboration with Housing Authority to operate a facility on the western end, and we will soon be able to talk more about that. I would really want Housing Authority to take the lead on that, but DHS will be collaborating with them on a site on the western end. But I will leave that for Housing Authority to give you more detail.
Thank you. Thank you, Mr. Chair, and thank you for the leniency.
Very well. Thank you, Senator Gittens. We have a point of inquiry from Senator Sorrow. You recognize your point of inquiry.
Thank you, Mr. Chair. The senior center, Adrian Center on St. John, that we had a big ribbon cutting for and everything else, with the numbers going down in COVID, do you have a timeline as to when our seniors can move out of the St. John Recreational Center and move into the place that you have retrofitted and repaired for them? Do you have a time frame on that?
Yes, definitely, Senator. Thanks for that question. By or before March 15th, and if we can do it in February, we would. Right now, we're dealing with an AC issue. The physical air conditioning system, something has gone wrong. We've contacted Housing Authority. They are the owners of that building, and they're going to correct the situation, and we will be moving into Adrian thereafter. But the target date is by or before March 15th, 2022.
Thank you, Mr. Chair.
Thank you very much, Senator Sorrow. Chief Clendenin, in respect to emergency housing, how many emergency housing units do we have territory-wide, and also if you could break that down per district?
Sure, I'll let Mr. The COO, Mr. Richardson, respond.
Richardson?
Senator, can you repeat your question, please?
How many emergency housing units do we have available? And I'll like it territory-wide as well as per district.
We have total units right now on St. Croix, with the acquisition of Cranigata Inn, it will be 62 units. On St. Thomas, with the...
No, I was referring to what's operational now, Mr. Richardson. COO Richardson, what's operational now at current?
Okay, what's operational now is... Oh, 1 second, counting in my head. We have 1, 2, 3, 4, 5, 6, 18. I have 12. No, I'm sorry. I have 6 at Profit. I have 8 at Campo Rico and St. Croix. And St. Thomas, I have 3 at North Sidavai, and I have 17 at Hospital Ground. So 20 on St. Thomas, 14 on St. Croix.
And while I have you, CEO Richardson, what is the status on the first-time home buyers program, the money that we had provided, the $4 million to support the first-time home buyers? What is the status on that?
We did receive the funding. We are right now putting together the SOP to move forward, but we should have that. I think I spoke to Ms. Clendenin, and I should have that to her in a matter of 2 weeks. But we are open to accepting applications at any time, but our SOPs will be completed in the next 2 weeks.
Very well. And do you intend to market that to the public to make sure that they're aware of the availability of the funding?
Yes, and that's what we actually want to do. Market it to the public with all the eligible uses and the amounts and limitations and the process of and who would qualify for it. So we want to make sure we have all of that taken care of. We actually went through the code, took a look at what's eligible, what it was actually saying, and that's where we're actually writing and preparing the SOPs off of. So as soon as we meet with the incoming acting executive director and finalize those, we will have a media campaign going out about that $4 million.
Very well. And going back to Krangata Inn again, is that a facility that HFA will be actually managing, or you intend to lease that out to a private entity or a nonprofit organization?
Right now, it's our hope to actively manage it along with our other emergency housing units.
Mr. Malik Sridharan, are you still with us? Very well. Senator Viola, you recognize for a point of inquiry?
Yes, thank you so much, Mr. Chair. In reference to the First Time Home Buyers Act, you're having discussions with the bank and putting your SOPs together that when we launch, it would be a seamless process that individuals know how the two would be aligned?
Yes, Senator. Darren Richardson, Chief Operating Officer, Virgin Islands Housing Finance Authority. Yes, Senator, that's part of putting together everything so they could know what would be in play, because they would actually go through their normal process, but they would also let the clients know of the availability of the funding and the purpose of the funding through the Housing Finance Authority. I'm not sure how if we're gonna do pamphlets or how we're gonna exactly communicate that or have the banks communicate it to the clients, but we'll be a little creative. I'll see if they could direct them to our website or something like that. So that's not been finalized, but the banks are definitely in play and in discussion with us.
Okay, and lastly, you have an incoming executive director on the way?
We have an incoming acting executive director.
I heard you say you are waiting the incoming executive director for review.
I don't know. Not that I know of. That goes to the boards, Senator. I don't know anything about that.
Yeah, I was just repeating what I heard you say. You say you were waiting for review by the incoming executive director?
The incoming acting executive director, which will be Ms. Dana Clendenin.
Okay, thank you so much for clarifying.
Thank you.
Thank you very much. Senator VLA. Next, we'll go to Senator Carla Joseph. You're recognized for your 4 minutes.
Thank you kindly, Mr. Chairman. And again, Human Services, I want to go straight to my point. I'm looking at what we have and what was represented by OMB regarding the premium pay for public and private sector employees. Kindly indicate the status of paying those employees, because I remember vividly we had individuals from the homemakers, and again, I'm going to the elders, homemakers, Meals and Wheels, delivering throughout the pandemic. And they've been calling my office unceasingly regarding when are they going to get their money. They said educators have gotten it. They've said also that persons from the hospitals have gotten money. Where are our essential employees going to get their share? That's my question.
Short answer, I have.
And the cooks at Head Start, all of these people, these are deemed essential employees. They have not seen a dime. A dime. Where are we with that? Thank you kindly.
An application will have to go in for the ARPA specific funding for premium pay. And so for me, education was the first tranche, is for what I was understanding. I don't know the process to get the premium pay reimbursed for them.
Let me tell you, based on what Jennifer O'Neill represented, and I could be wrong, at the January 16th meeting here for the Committee on Disaster Recovery and Infrastructure, she didn't say that. She said, you guys will have to be able to assess. So have you looked at how much monies that your workers are supposed to be getting out of the ARPA funding? Is how much they have here is 40 million. How much are they going to get paid? When are they going to get that money? Have you started a process of discussing this and sending the information to OMB to pay the employees who were deemed essential and who are working because they could not telework?
Yes, actually, we have begun the assessment. I know exactly which employees were not teleworking and which were front lines. We have 4 24-hour facilities, so that's all of those, the Meals on Wheels, everybody that came out of their homes to give services. So we'll ensure that we'll work with OMB, and I'll make sure that that assessment gets to them so we can make sure that our employees get exactly what other agencies like the hospital and education have gotten.
Okay, so
I agree with you 100%. I agree with you 100%. It'll be within the next 30 days that I get that information to OMB.
Okay, thank you so much for at least setting a timeline for 30 days. We will be following up. I'm sure the able chairman will be having another meeting so that we could follow up and get a very, very precise and more detailed update from you and your team. Thank you kindly, Mr. Chairman. I'm done. Thank you.
Thank you. Thank you very much. And it's been a long day. Thank you, Commissioner, for responding to all of the questions that have been raised. And obviously, we have some work to do. I will be, bringing you back sometime in the future so that we could continue this dialogue, so that we could be able to address some of the concerns that have been raised today. And I'm sure that you made notation of what those may be. So at this time, I'll give you a minute or two to go to wrap up, as well as the Housing Finance Authority as well.
Thank you, Senator Francis and this body. So what I did here was I'll bring the meat next time as far as the data, the statistics, and actually show what Department of Human Services is actually doing. So I did hear everybody, and I will make sure that I get that information specifically to tell our story. Maybe I believe I did a disservice today to my staff that are actually working essential and on the front lines, because we have been working really hard and serving our most vulnerable in our community. There are times when you're giving examples when we didn't do our job, but there are also times when we 11 o'clock at night, I'm signing a letter of agreement for someone to be flown off island for medical services. The homeless situation, getting calls on Saturdays and Sundays, that's just what we do. I do it every single day. And I know my staff have been 100% front lines essential. So I want to make sure that everyone understands that I did a disservice today, allowing me to tell them the story of exactly what they're doing and how they're doing it. So the next time I'm in front of this body, I will assure you, I will tell you exactly who we're serving and how we're doing it. The other part of it that I will definitely tell you is what I need. And the challenges that we're facing. So the shortages of staff and how that affects our service to the people of the Virgin Islands. So right now we're serving almost 37 people under Medicaid. We have 25,000 people that are eating because of SNAP benefits. We have 150 seniors serving under homemakers. We serve our littlest people in our Head Start. We're licensing. We're doing a lot. Hundreds and hundreds and hundreds of children within the Virgin Islands are protected because of our social workers and those going out morning, noon, and night to intervene at the hands of whoever's taking care of them. So I want to say thank you to this body for allowing us the opportunity to give a brief overview of DHS. I will ensure you that I will bring it next time. And I want to say thank you diligently to my team here today, Governor Bryan and Lieutenant Governor Roach, as well as the hardworking DHS staff, because they are doing the work that a lot of us in our community do not want to do. They are doing the laundry and they're cleaning and they're coming behind people and taking care of them every single day in their house, in the homes for the aged. They do the hard work. They're teaching our little people in our Head Start classrooms. They're doing the hard work, and I'm truly, truly appreciative. So this body, I would appreciate the understanding that they are also doing the hardest work that they can and with limited resources. So I appreciate that. I'll make sure that I bring it next time. So thank you all for your time today and this evening, and we look forward to the next time.
Thank you very much, Chief Dina Clendenin. I keep wanting to say director, Chief.
I know. I know. Thank you, Senator. Really to the staff on the call, Ms. Shelford, Mr. Richardson, Ms. Hector, Ms. Walwyn, Ms. Hanley, thank you for staying, and thank you for the opportunity for us to provide just some testimony on our partnerships with the local organizations, as well as projects we have in place to help bring emergency housing units online. We too have heard your concerns where the ERAP is concerned, and again, we are working on some strategies to make that better. Although we have made some $1.9 million in payments, we recognize we still have more work to do. Thank you all and have a wonderful evening.
Bye.
Thank you very much. I want to thank everyone that was on this call today. Again, some of the questions that has been posed may be difficult, but we're the people's representative. We're the one that gets the calls and the frustration from our constituents, as well as even some of the employees. Nothing that have been said here is personal, but rather, again, for us to be able to probe and be able to get that information so that we could all make for better government. So I appreciate the work that have gone forward. Certainly, we know that Human Services have stepped up to the plate. We know that certainly the Housing Finance Authority also stepped up to the plate. They're managing a tremendous amount of money, but we all are subjected to criticism, and that helps, constructive criticism that is, and that makes us better and effective at the job that we're doing here. So all I could ask is that and implore you is to continue to be mindful. Continue to be mindful that our community is dependent on us. They're relying on us to carry that heavy responsibility to make sure that we're making this community a better place for we all to work and live in. The housing program, the housing rental, there's a level of frustration again from some of the renters as well as the homeowners. And, it's important that we're able to really address that situation and close the loop. $39 million, $1.5 million expended. When you talk about 100 plus individuals that have been serviced or received checks thus far, and still there's another, 500 plus that have not received their check, it's really a difficult pill for us to swallow. So, please do whatever you have to do. Continue to take the day and make night. So that we could be able to answer the calls for service. And public service is thankless. But at the end of the day, we want to make sure that we're doing our best effort when we go to sleep at night. We know that we have put our best foot forward. I want to thank my staff for today's hearing. I want to thank Central staff again for the extended hearing today and staying in the paint with me. We certainly appreciate your work. Media, things work very well today. I must say that the media, again, the connection seems to have worked well, and we hope that that continues. We know that we're challenged with technology in the very near future, and myself and the Senate President will have the conversation, but we intend to start to bring our testifiers in person because I think that it'll make for a better conversation moving forward. The Committee of Health, Hospital and Human Services of February 9th, 2022 is hereby adjourned. Everyone get home safely. God bless.